Good morning, and welcome to day one of the Law and Mental Health Conference, digital and online. It's July 19, 2021. I'm Jason Renaud, Program Manager for the conference. This is the second year the Law and the Mental Health Conference has been entirely digital and online. COVID and the associated economic fallout has affected not only our personal health, but also the lives and health of our clients, our friends, and our family members. It's also affected how we work, how we gather, how we educate, how we learn, and how we socialize. So all the activities that go along with an in-person conference are still not quite possible at this time. But I hope that there are advantages to this digital conference that you take advantage of. The conference is a project of the Mental Health Association of Portland. It's a peer and volunteer-led nonprofit that does advocacy and education work in Oregon. Our subject this year is alcohol policy and the impact of alcohol on states and local governments. We have terrific speakers from all over the country who will illuminate different areas of this complex and little understood area of our work. Now, the short story, as I understand it, is that with the ratification of the 21st Amendment to the Constitution and the end of prohibition, a vast new set of legal restrictions on alcohol were put in place with the same understanding of alcohol's dangerousness and with the same intent to limit alcohol's availability and protect both drinkers and non-drinkers from the harm of alcohol. Now, I'm from Oregon, where we now have more legal and easily available mood and mind altering substances that are of a higher potency and a lower cost, more available at more locations, and more accepted and less regulated than at any time in human history. And there are effects of those policy decisions. Public health services, like treatment for alcoholism, are underfunded and overwhelmed and largely ineffective at stemming the tide. Our jails and prisons are filled with people who did their crime while drunk or loaded. Our high school dropout rates are at an all-time high, and homelessness is growing throughout the country. We're now seeing more people on the streets than ever before. Hospital emergency room staffs consider addiction and alcoholism like you would a medieval siege. This collateral damage that's caused by alcohol is not coincidental or unintended. These are carefully weighed policy decisions at the federal, state, county, and city levels, which balance commercial interests against the public health and well-being of our communities. And for those concerned with the health and welfare of people affected by alcohol, we're losing this battle. So the subject of this conference is both important and I hope you are attentive. Each of these sessions are handpicked to convey an articulate understanding of the status of alcohol policy at this time. And you'll hear all through the conference today and tomorrow a background rumbling noise. That is the concerted efforts on the part of at least 4 gigantic industry groups. There's the alcohol manufacturing and distribution industry. There's the restaurant industry, the grocery industry, and the hospitality industry, which includes hotels and resorts and venues. These together comprise a political pressure group far larger than the National Rifle Association. Together, they're more akin to a military industrial complex in the way that they wield political influence and pure power. You'll hear in this conference, in sessions, war stories by advocates trying to amend these state and local laws. And you'll hear from academics who are measuring the social impact that alcohol comes from these industries. And you'll hear from our keynoter this morning, author and historian Susan Cheever, on the history of drinking in America. You'll hear also from recovery warriors like Don Coyhis about how social movements and mutual support is a largely untried and successful way that governments can reduce the impact of alcohol. Now, each year, the Law and Mental Health Conference and our organization includes the Oregon Advocacy Award. And this year's awardee is David Oakes. For more than 4 decades, David has worked as a human rights activist in the mental health field, developing the Mad Pride movement through his international organization, Mind Freedom. And now as a consultant, David is working on disability rights and to stop global warming. We're proud to honor David Oakes as winner of the 2021 Oregon Advocacy Award. Now a bit of housekeeping. The Law and Mental Health Conference will have 2 keynote sessions with a question and answer follow-up and 4 live panel discussions. You can participate in all of these. And this is where session speakers can respond to or answer your questions. I'll moderate the live keynote Q&As and each of the panels. Questions can be submitted via email to my email address, you see this below, or put in the chat section of this YouTube program. The timing of the live elements is somewhat variable because it is live. The keynote Q&A will take place immediately following each of the live keynote presentations, and the live panel set discussions will take place after the session speakers' individual presentations that they conclude in the morning and the afternoon of the conference. The morning panel sessions can be expected about 12 p.m. Pacific time, and the afternoon panel sessions around 2:50 p.m. Pacific time. Now, continuing education for the Law and Mental Health Conference comes through the National Association of Social Workers of Oregon and through the Oregon State Bar, both offering nationally recognized credit, and also through the Mental Health and Addiction Certification Board of Oregon and the Oregon Department of Public Safety Standards and Training for those practicing here in Oregon. Now, note, you do not need to watch today's or tomorrow's conference in real time. Everything is recorded, and you'll be able to have access to it for 30 days until August 19, no later. You'll watch and pursue credit until the conference closes on that date, August 19th. So circle that date, August 19th, everything has to be in. Please visit and review the logistics webpage on our website for the most up-to-date information about seeking your CEUs and for the recording links for this conference. The link is included here in the video description below, and the password can be found in your welcome email that you received to the address you registered with for the conference. Now, if you have any questions about the conference or your CEUs, contact the conference coordinator, Liv Lopez, at the email address below. She'll be able to help you out. Now, I'd like to thank our sponsors for this conference. These are healthcare and service organizations which recognize and appreciate the value and potency of independent and interdisciplinary dialogue about these crucial, timely, and complex issues. They are the Oregon Health Authority and the Oregon State Hospital, the Multnomah County Behavioral Health Division, Kaiser Permanente, the Ganapati Fund of the Oregon Community Foundation, Central City Concern, Providence Health and Services, Cascadia Behavioral Health Care, the Association of Oregon Community Mental Health Programs, the Virginia Alcoholic Beverage Control Authority, the Northwest Addiction Technology Transfer Center, Bridgeway Recovery Services, Rainier Springs Hospital, and Health Share of Oregon. I'd also like to thank our partners who helped us to market the conference. They are the Oregon Council for Behavioral Health, the Mental Health and Addiction Certification Board of Oregon, Oregon Recovers, the Oregon Department of Justice, and the United States Alcohol Policy Alliance. So thanks for your attention. Let's get on with the show.
It's an honor to be here in Portland. I'm Susan Cheever. I'm an alcoholic. And I want to thank Liv Lopez and Jason and the Mental Health Association of Portland for this incredible conference that you all are attending. I'm gonna talk to you about the past, about American history as seen through the lens of alcoholism. I'm going to tell you about some of the most dramatic examples of drinking in our past and the light that they can throw on our present, because as you know, those who forget history are doomed to repeat it. I hope to enliven some ancient tropes for you. I hope to give you a few new ideas. And I hope to take the pictures of our ancestors off the wall and make them dance and drink. But before we think about the past, let's take a moment to honor the present. Today, July 19th of 2021, I invite you to take a deep breath, to connect with your faith, whatever that is, to send up a prayer to your God, whoever that is, and to just be where you are for one moment. Okay. Alcoholism. Alcoholism is a disease that has shaped us in many ways, and I'm evidence that there is treatment and that the treatment works. My father took me to my first Alcoholics Anonymous meetings in 1975. I'm not going to tell you how old I was, but I wasn't 8. It took me a while to get it. I thought that alcoholics were sort of middle-aged men in dirty trench coats. But now I have 29 years sober, and I've had the privilege of writing a biography of Bill Wilson and some other books about drinking. And I'm one of 3 generations of recovery in my family. And that is an astonishing thing. And we are a very lucky family. So I want to start talking about American history and drinking. At the beginning, although it isn't really the beginning, but it is the beginning in a way, in 1621, with the Pilgrims on the Mayflower as they crossed the Atlantic. So the landfall for the Pilgrims was Cape Cod. That was the first land they saw. They had been at sea for a long time. They had had a terrible voyage. They were 6 months late. They had hoped to have landfall in the New World in July. It was now November. And I'm going to tell you how that happened. They knew perfectly well that if they landed on Cape Cod, it would be illegal. Their charter was for Virginia. They were heading for Virginia where it was warm and where they would have a welcoming party. But everything had gone wrong on the Mayflower. Every single thing almost that could go wrong had gone wrong. This was their 4th try to cross the Atlantic. And there they were faced with the dunes of Cape Cod, which William Bradford, who was the writer on the Mayflower, called a hideous and desolate wildness. They were cold, so should they land? They were cold, they were plagued with problems, and the worst of it was that they had to land soon because they were running out of beer. As Bradford wrote, "We could not now take time for further search or consideration, our victuals being spent, especially our beer." So they were a ship in crisis. They were running out of beer, and even though they knew that they should not land on Cape Cod, that it was illegal to land on Cape Cod, and that it was a practical disaster to land on Cape Cod, which clearly wasn't a place where things grew, and they couldn't even find a harbor at that point. They were landing on the backside of Provincetown. But they knew that they had to land because they were running out of beer. And this brings us to a second question about alcohol on the Mayflower. So I began to wonder as I was writing about this and reading about the Mayflower, why did they have all these problems, right? And they had tremendous problems. They kept starting out and turning back. They started out as 2 ships. The Speedwell had to turn back. So many of them got sick, partly because they were running out of beer, that half of them died in the first winter on Cape Cod. Why was the Mayflower so plagued with problems? I asked myself. Halfway across the Atlantic, one of the beams broke, and many of them wanted to turn back again. And I think a lot of their problems were caused because they were sailing while intoxicated. The daily ration on the Mayflower, the daily ration of beer was 1 gallon for every man, woman, and child. And it was real beer. It was about 6%. I mean, it wasn't perfect, but you know, when you think about that, it explains quite a few of the errors in judgment that we see in the Mayflower captain and crew. You know, they tried to sail south that day that they had the landfall, and they were turned back in a relatively easy sail in a place called Pollock's Rip. They were turned back and they headed back for Cape Cod on that same day, and they landed on Cape Cod famously because they were running out of beer and because they were running on beer in the first place. But to my mind, that landing on Cape Cod instead of Virginia, instead of them sailing up the Hudson, instead of the instead of New York Harbor, instead of the many other alternatives which would have been better for them, was incredibly important when it came to setting the American character. A lot has been written about the formation of the American character, the individualism, the defiance, all of it. But this landing in a shallow harbor between 2 great harbors in November, they had to wade in through cold water to get to the beach. That's how bad it was. Seems to me that it had a great deal to do with how the American character began to unfold starting on that day in 1621. And that's sort of the beginning of this particular kind of American history. And so it begins in beer. And as history moves forward from 1620, there are dozens of examples of ways in which drinking and alcohol created and defined the American soul. After the Pilgrims, of course, the American Revolution, which was very much engineered by people who were drinking a lot. Many of the offensives of the Revolution were planned in the basement of the Green Dragon Tavern. Ethan Allen, a hero of the American Revolution, drank so much that there's a story about him being bitten by a rattlesnake and the rattlesnake sort of wandering away going, "What was that?" and forgetting to release his venom. Johnny Appleseed, of course, was not a man who brought seeds to the frontier in order that they could grow Honey Crisps and eat delicious apples. He was a man, as Michael Pollan has brilliantly written, who brought seeds to the frontier so that they could grow apples for hard cider. You can't really grow a good eating apple from a seed. So the whole thing was never quite what it was represented to us in 5th grade. Paul Revere, on his famous ride to Lexington, stopped at Captain Hall's Tavern to have a few drinks. He got to Lexington early. The British were very slow moving. And the entire American militia retired to the tavern to drink until the British showed up. And when the British did show up around midnight, you can imagine the scene. I'm not going to get into it, but the American militia had been waiting for an hour drinking, and the British were also pissed off. In fact, that entire British regiment should have gone right to Al-Anon, but of course they didn't. And in the Civil War, the Union victories in the Civil War, the great Union victories, were won primarily by the active alcoholic General Ulysses S. Grant, who did that drinking thing of disappearing and then reappearing with redoubled fervor. And Ulysses S. Grant, whose alcoholism has been brilliantly written about by many people, but certainly Ron Chernow's biography of Grant lays it out pretty well. He was probably the best American general that we've ever had because of the way he was able to use brandy. to make himself braver than a normal man and to inspire his troops in a way that other people couldn't. But he went on, of course, to become one of our worst presidents ever, because the skills that make you a great warrior don't necessarily make you a great president. So all of these things are entwined with American history. In many, many places, there's drinking when it comes to a way to understand American history, or when it comes to any understanding of American history. But there's something extra special about American drinking. Many countries drink less than we do here, and many countries drink more than we do here. But no other country goes to the kinds of extremes, the passionate extremes that Americans do when it comes to a drink. We are special in that way. Dan O'Krent, in his History of Prohibition, writes, America had been awash in drink almost from the start, wading hip deep in it, swimming in it at various times in its history, nearly drowning in it. So look at how we go back and forth in our relation to alcohol. In 1830, we were one of the drunkest countries in the world. Much drunker than we are now, much more alcohol consumption per capita than we have now. Farmers, it was an agricultural society. And of course, as soon as machines were introduced to society, drinking became much more dangerous. But if you were plowing a field, and so most farmers kept a bottle or a keg at the end of each row, which moved down the field as they plowed their field. School children, most of them had a drink called Flip before they went off to school in the morning. Flip was a little bit of fruit juice and a lot of grain alcohol, which I'm sure made school much more bearable. And the tavern was really the center of the New England towns that were built in the 1830s. A little bit the church, but more likely the tavern. And then, so that's one extreme, right? We're all drunk out of our minds. And then the other extreme is 100 years later, less than 100 years later, we outlawed drinking completely. In 1920, with Prohibition, we outlawed the sale of liquor. We outlawed the drinking of liquor. I mean, it's crazy. So, we go from one extreme to the other much more than other countries. And that's the other piece of the American character that comes from alcoholism, in my opinion, is those extremes. We're very individualistic, we're very defiant, and we love our extremes. It's all or nothing with us, as you can see in current politics. I'm not going to mention that. Okay, speaking of Prohibition, many people ask me, and please don't ask me after this is over because I'm going to answer it already. Why do writers drink so much? This is a big question that a lot of people have spent a lot of time thinking about and talking about. And because I'm a writer and because I'm an alcoholic, I seem to be an obvious person for this question. So here's why I think this idea of writers and drinking got its start. I think that if we look at when they're talking about the writers who drink, and many, many books have been written about why writers drink so much, right? This is a big question. So 5 of our 7 Nobel laureates for writing, Faulkner, Hemingway, O'Neill, Sinclair Lewis, and probably John Steinbeck, were alcoholics. To say nothing of the drunks who didn't win the Nobel Prize, like F. Scott Fitzgerald. And there's just a lot of speculation about why this happened. Do writers need to be released somehow into another emotional framework by alcohol? Why can't writers write without drinking? And it's interesting to look at Prohibition in relation to this question, because there are all these people saying, what is the connection between writers and drinking? So, but when I started to dig, I began to see there is no connection between writers and drinking. If you look at the writers of the 19th century, right, the writers who wrote what we think of as American literature, Emerson, Thoreau, Hawthorne, Melville, the Alcotts, Emily Dickinson, those guys didn't drink. Longfellow, they didn't drink at all. Hawthorne, there's some little question, but they were not drinkers. That just wasn't what they did. They weren't sober, but they just didn't drink. And those are the guys, I mean, Melville, Hawthorne, et cetera, the Alcotts, Emily Dickinson, those are the people who wrote what we think of as American literature, and they didn't drink. And then along comes Prohibition, and suddenly drinking is against the law. And suddenly our president gets called on the carpet for drinking, right? Suddenly, not only are you not allowed to sell liquor, you're not even supposed to drink liquor. And if you want to drink liquor, you have to go to a speakeasy. And when my father first came to New York, he went to his first literary party. This is in 1930. And they literally had made bathtub gin. They had a bathtub full of liquor, which he drank a lot of and threw up all over the literary critics, which may have made his career start a little more slowly than it would have otherwise. But in 1920, liquor became legal, and that's when writers started to drink, because of course they did. Because what writer is interested in doing something that's legal? No writer. And that's the real connection, I think, between writing and defiance, between writing and stirring things up, between writing and being subversive and perverse. So I believe that Prohibition created a generation of alcoholic writers. And that's how the dates look. In starting, if you look at 1970, which is when Saul Bellow won the Nobel Prize, a non-drinker, right? That's when it ends. And if you look at our writers now, our great writers now, none of them drink. We've gone back to the 19th century in that way. The writers on the bestseller list, the writers who write the books that, you know, are talked about, the Times notable writers, most of them don't drink at all. It's just not in the equation. And so this whole idea that writers have to drink or that all writers are drunks is really based on one generation of writers. And I believe that that generation of writers was created by Prohibition. Now, Prohibition created many things, a criminal class and a lot of other things too, but I think it created a generation of drunken writers. And I think that the connection between writing and drinking is based on those, let's see, 1933, Prohibition ends to 1970. So that generation, those 50 years. So that's my theory. I want to look at one more piece of American history before we wrap up. I want to look at a date that I'm sure you all know, November 22nd, 1963. Just a few minutes after noon in Dallas, Texas. So that was the moment that a bullet was fired into the open car in which President John F. Kennedy, his wife, and Texas Governor John Connally and his wife were riding. That first bullet hit the president in the neck, but did not kill him. The next shot, fired 4 seconds later, was the one that killed him. 4 seconds later. Four seconds, during which the Secret Service detail did not cover the president as they had been trained to do, but rather debated what made the noise of the first shot. They asked each other, was that a firecracker? Was that a backfire? They slowed the car down, enabling the second fatal shot. And this is all pretty well known. What's less well known is that 9 of the 28 agents who were in the motorcade that day had been out in local clubs the night and the morning before. In one case, the guy was out until 5 a.m. In fact, 3 of the agents who were a few feet away from the president that day had been out drinking, an activity which is obviously prohibited in the Secret Service rule book, but any of those 3 men could have changed history. But they didn't, because they had been out drinking until early that morning. Or maybe not because, who knows? But they didn't, and they had been out drinking until early that morning. When this information was discovered and included in the Warren Commission report, where you can read it, Chief Justice Earl Warren himself was furious, and he called the Secret Service Chief James Rowley on the carpet. And I'm just going to read what he said. Warren was so angry when he found out that these guys had been out drinking. He said, this is a quote, "Don't you think that if a man went to bed reasonably early and hadn't been drinking the night before, he would be more alert than if he stayed up until 3, 4, or 5 o'clock in the morning, going to beatnik joints and doing some drinking along the way?" Warren noted that some citizens along the route of the motorcade waiting for the president to pass by had actually seen a gun barrel pointed out of the 6th floor window of the Texas School Book Depository. None of the Secret Service agents had noticed it. "Some people saw a rifle up in that building," Warren went on. "Wouldn't a Secret Service man in this motorcade, who is supposed to observe such things, be more likely to observe something of that kind if he was free from any of the results of liquor? Don't you think that they would have been more alert, sharper?" So that's yet another place that alcohol intersects with American history in a way that may have had huge, huge results. I hope that in talking about these 3 incidences and a couple others where alcoholism changed our history, that I've given you a slight shift in perspective when it comes to what we think of as America, the United States, whatever we're going to call it, the United States, I guess we call it. Alcoholism is still a massive public health problem, as you know. It's a much greater problem than our records show. If you read the news carefully, you will often find that where there is violence, where there is fury and disagreement, where there is assault and battery, there is also often a drink or a few drinks. Just in this past decade, there's been tremendous progress in defining, seeing, and treating alcoholism and making it visible. And that's wonderful. Still, I've been amazed by people's resistance to information about alcoholism. As if learning what alcohol does to the brain, or finding out that 10,000 people a year die in drunk driving accidents was somehow gonna, or looking at the way drinking has formed the American character, might compromise people's ability to have a few glasses of wine. I don't understand that. It's not true. Sobriety is every bit as intoxicating as the finest vintage, I promise you. Thank you.
Well, thank you, Susan, for that great talk on drinking in America, giving us some of the background, the history of how alcohol has affected Americans since white people arrived here on the Mayflower. I want to just point out that a lot of what you spoke about is in your book, Drinking in America, which you can find on any bookstore or online catalog. It's great stuff, easy to read, packed with all kinds of facts and interesting material. But Susan, you've given us some idea of looking at history through a new set of lenses, a set of lenses that's aware of the experience of alcoholism. How can we, as we look at history on our own, whether it's American history or otherwise, how can we continue to sort of maintain that set of lenses?
Well, I think it's really helpful to ask yourself the question, was there a drink there? Was somebody drinking? For a while, I had my children do an exercise where they would read the newspaper every day and find the drink, because there's often one there. I'm very interested in finding the drinks in what happened on January 6th. That's research that hasn't been done yet, and I think it would be pretty interesting. So I just think it's a very illuminating way to look at American history, and it certainly helps me to stay sober, but it also gives me a new way to look at it. But I just think you want to ask yourself when you're reading history and when you're reading the news, where's the drink here? Is there a drink here? Where's the drink here? And I have to say, when Ron Chernow started writing his biography of Ulysses S. Grant, and it is a magnificent book, so he turned to some people that he knew who knew about alcoholism and sobriety, and I think that enabled him to really nail it, because Grant has been written about a lot, but Ron Chernow's book is just magnificent, just magnificent. So I think you just ask yourself, was there a drink there? Were these people inebriated? And if so, what effect did that have?
I'll second that on the Grant history. Chernow did uncover really important information about Grant's drinking or lack of drinking, and the characterization of him over time. So you also talked about prohibition. And could you tell us, do you see any continuing effects of prohibition, say in the now or in the past decade?
Well, for me, the biggest effect of prohibition, as somebody who wasn't alive during prohibition, is this idea that writers drink and that drinkers can write. In other words, this coming together of this idea that somehow to write well, you have to be drunk, which I think is an incredibly destructive and stupid idea. To write well, you actually have to not be drunk. That's, to me, that's the big, I understand there's a criminal masterclass, but I don't know much about that. But to me, in the writing community, which is my community, there's still a lot of feeling that writers should get drunk. And I think that comes right out of prohibition. It certainly didn't happen before. Those 19th century guys were just, drinking didn't interest them. And so to me, that's the big and worst legacy of prohibition, is this idea that writers have to be drunk all the time, and that somehow drinking will help you be a better writer. And, many, many people want to be writers now, which is wonderful. People want to tell their stories now, which is wonderful. But I'm afraid that some of them think that it will help them to get drunk. And in fact, the opposite is true. So to me, that's the big kind of backwash of prohibition, is this nutty idea that to be creative, you have to be drunk, when in fact, it's pretty much the opposite.
Well, our friend Tiffany Hall from Alaska writes in the chat. She asks if you would talk a minute about how creative people, writers and performers or musicians who are sober now, tell us a little bit about how to connect with creativity once you are sober. That's an interesting transition that some people have to make.
Well, I'm fascinated by that. If you look at, for instance, the paintings of William de Kooning, right? When he's drinking, there are these angry women, right? Who are just going to jump right out of the canvas and eat you up. And then he gets sober, and there are these beautiful, delicate canvases. So you can see it when a writer or a painter gets sober. It's pretty obvious. With my father, you know, he had written a couple of big family novels and a lot of short stories. And then he got sober and he sat down and wrote this beautiful, short, powerful novel about incarceration. A novel that he never could have written if he was drinking. Falconer, its name is. And so I think you can see it when a writer or a painter gets sober. I don't know enough about music to talk about that. That their work changes dramatically and in many cases gets better. I don't think that rage and, you know, all the things that go with drinking, I don't think those things are really good for writing.
One of the great damages in our American history that alcohol has caused is the damage to the indigenous people who were here before white people arrived. And it was just devastating throughout the 18th and 19th century, and still we see the damage today. Talk a little bit about how alcohol has affected and the politics there.
Well, I wish I knew more. The one thing I can say is that alcohol has often been used as an instrument of oppression. There was also a lot of alcohol on Southern plantations. The slaves got free whiskey. You know, there was a lot of using alcohol to, so both with Native Americans and with African Americans. This is one of the things that the patriarchy figured out early, that you can use alcohol to force another group of people to submit. And that was one of, I mean, Frederick Douglass on drinking on plantations is really such an amazing writer anyway. But, you know, I think that the Pilgrims certainly used alcohol, and the Puritans and the waves of people from England who followed them to help pacify, is that the right word? To help to strip the indigenous peoples of their dignity and to force them to submit. And alcohol is pretty effective that way. If you want to have power over somebody, get them drunk. And actually, now that I say that, that's why alcohol is so often a factor in sexual assault. You know, it's really a powerful tool for stripping someone else of their power and dignity, if that's your intention.
Susan, I had never thought about the use of alcohol on plantations to control persons. That's an example of those that lenses and how we need to now look at history in this different way.
Yes.
Just could you spend a few minutes and tell us a little bit about this book you wrote? This is the history of Bill Wilson.
It was such a privilege to write that book. You know, I did sort of fall in love with him, as some reviewers chastised me for doing. But like many books that I'm proud of having written, I didn't want to write it. What happened was the great Walter Isaacson in the year 2000 was doing an issue of Time magazine about the great men of the 20th century. And he decided that Bill Wilson was one of those men. And so he asked me if I would write the profile of Bill Wilson to go in this issue of Time that was the great men of the 20th century. So I knew Time magazine, they have researchers, they have everything. So I said, I would love to, right? So I said, send me the books, send me the stuff. And there weren't any books. At that point, the Robert Thompson book was out of print. The group book, I've forgotten its name, was, you know, I mean, I thought there would be 5 full dress biographies of Bill Wilson. I mean, how sober was I then? 8 years, right? And so I was horrified. There's no real biography of this guy. You know, there's Robert Thompson, his friend, who decided to tell the story however he felt like telling the story. And so I went around saying, somebody should write this biography, somebody. And I tried to get Nelson Aldrich to do it. I mean, I was really, somebody's got to do this. Yes. And so I was having lunch with my then agent, Kim Witherspoon, who is a smart woman. And I said to her, somebody's got to write this biography. And she said, you've got to write this biography. And I was like, oh, no, 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 no. I'm already writing this or that. So before I knew it, I was writing a biography of Bill Wilson, even though I felt, I don't know, is unworthy the wrong word? I hoped I was the right person and prayed that I was the right person to write it. And then, so there are 3 different archives. There's one in at the GSO on Riverside Drive in Manhattan. And there's one in East Dorset where Bill was born and grew up. And there's one at Stepping Stones where Bill and Lois lived for 30 years. So I first went to the GSO. I got permission from the GSO archivist, and I went down there and I spent a lot of time down there, not coming up with very much. I had to ask, when you have to ask an archivist for what you want, that's very limited. You're not going to stumble into anything because you have to ask, right? But being there was very helpful. There's a kind of mini museum of Bill Wilson at the GSO, which I can't recommend highly enough. But then I just stumbled into this incredible piece of what I call biographer's luck. I went out to Stepping Stones, and as it happened, Lois, God bless her, after Bill died, she had built a matching house to Stepping Stones and made it the archive. She put everything in there. And then she had installed a caretaker also in that same house. And so I got there and the archives hadn't been touched. No one had even indexed them. They had hired an indexer and he had, there had been a couple of attempts since Lois's death. So, but it hadn't, the archives were just sitting there in this room. And here's the piece of luck. At just about the time I was making friends with that caretaker, right? And knowing that the archives were there, they hired a brilliant archivist from the New York Historical Society. So this woman, Lynn Hoke, and I would go out there and she would help me go through the archives because I don't know how to go index an archive. So I stumbled on the biggest archive, the best archive, the best guide I could possibly have had. And Eileen Giuliani, who was the caretaker at that point, was so helpful. And we would just go out to Bedford Hills on the train together, Lynn and I, and it was just a gold mine. So I forget so I'm talking about writing that book. So the things in that book that surprised people, the fact that Bill Wilson asked for a drink on his deathbed, and a lot of other surprising things, all came from that archive. And they really came through the guidance of those 2 astonishing women. So I just was very, very lucky. And, I was able to walk from the Bedford Hills station the way Bill had up Oak Street and walk, it was just, Bill built himself a little, what he called the shack. I think it's now called the study, out of cinder block, just a little bit up the hill from the house so he could see who was coming and come out if he wanted to see them and not come out if he didn't. So, I just had incredible luck with that book, both in being the person who ended up writing it, which I certainly didn't think would happen, and then stumbling on the archive at Stepping Stones. I mean, Stepping Stones is a treasure trove. And if you care about Bill Wilson, you should definitely go there. And you should also definitely go up to the GSO in Manhattan. Sorry, that was a long answer.
You've said a lot of, in your book, really heretical comments about Bill and his life, and just things that we don't want to, in the saintliness of Bill, we don't want to think these things, like asking for whiskey. How do you come about that as a historian? How do you say, well, we want to create this character, but we also have this truth?
Well, I think, to my mind, saintliness is overrated. I mean, look at Ulysses S. Grant, right? I mean, I didn't want Bill to be a saint, and he certainly wasn't. You know, Bill was a hot mess, or a cold mess. It was Vermont, but you know, his parents abandoned him when he was 11. One of the moments when I was trying to figure out if I should write the book was I went up to East Dorset. I spent a lot of time in East Dorset as well, and I was in the Griffith house, which is where Bill was dumped with his grandparents when he was 11, and his parents both left because they had more important things to do than raise the children. So I was in the Griffith house, and I went upstairs, and as I came down the stairs, I realized that I had to nod to keep from hitting my head. And I knew that Bill at 11 was already 6 feet tall. And so I thought what that was like for an 11-year-old to be abandoned by your parents, dumped on your grandparents, who had just lost their son, by the way, and having to live in a house where you literally didn't fit. When Bill read at night, he had to put his feet out the window in order to lie down in bed. And I had an 11-year-old son at that moment, as it happened. So, you know, Bill had a terrible time from the beginning. And certainly he never intended to be a saint. And as I say, he wasn't the perfect man, but he was the perfect man for the job. It's almost as if God, if you'll excuse the expression, I believe in God, had some kind of blueprint, and Bill Wilson checked all the boxes. He grew up at a time when temperance was taught in the schools. He had a family where there was a lot of struggling with temperance. Vermont was a dry state and then a wet state. While he was living there, he learned about grassroots democracy. It's really a Vermont program in many ways. He learned about grassroots democracy from Vermont town meetings. You know, it couldn't have been more perfect. And, you know, then he went into the army. And of course, he had decided never to drink. And of course, he drank. But Lois, without Lois, there would certainly be no Alcoholics Anonymous. It was her money, for one thing. So everything Bill did somehow helped with the establishment of this extraordinary thing, which is Alcoholics Anonymous. And every piece of education he got seemed to me to contribute to his ability to do what had to be done. So he certainly wasn't saintly, but I wouldn't have liked him if he was saintly. I mean, who likes a saint? But he was, everything he did was almost perfect. He had made a few mistakes, but not many, in relation to building this extraordinary Alcoholics Anonymous, which has saved millions of lives in every country in the world. And that's Bill. That's the unsaintly Bill Wilson.
And speaking of saints, you mentioned the importance of Lois and how if she had not been there, none of this would have happened.
It was Lois's money for openers. Lois Bill bankrupted the Rogers family. Basically, they had to sell the house in Brooklyn, and he bankrupted it partly by drinking and partly by trying to establish a way to stop drinking. Lois was an extraordinary woman. I don't think she gets her due. She was older than Bill. She was desperate to get married. Bill was an 18-year-old with severe mental illness. And Lois, for some reason, and it was partly the way things happened, she had just been proposed to by a man who wanted her to go live in Canada, which she did not want to do. And Bill was friends with her brothers. And so Lois and Bill got together, and, they were not well matched, but what a match they made. And Lois put up with so much. But, I think she knew. I think she had her eye on the prize. I really do. I think she understood that Bill was up to something bigger than both of them. And I think a lot of her tolerance came from that. And it was extraordinary tolerance one of the reasons why I think that is after Bill died, Lois lived another almost 20 years. And she spent those 20 years taking the money, which she got back, of course, and building a foundation in Bill's memory so that people in Alcoholics Anonymous would have somewhere to go, so that there would be an archive, so that there would be a picnic, all these things that Lois established. And she kept that house where they lived for 30 years in pretty pristine condition. So you can go there now and see, the jerry-rigged water system that that Bill the engineer built. But without Lois, there would certainly be no Alcoholics Anonymous.
It's an amazing story. Thank you, Susan, for telling it.
It is an amazing story.
Well, thank you. And thank you for coming to speak with our folks here. That's all the questions we have. And thank you so much.
All right. Well, thank you. And thank you for your part, Jason, in spreading the word and in helping to educate people, if that's the right word for it, about drinking and what it does and what it doesn't do and what we can do about it. Thank you so much.
Part of the issue with Washington is that there aren't enough behavioral health beds. There has never been a specialty hospital in the Southwest Washington area that provides inpatient and outpatient services for behavioral health. Rainier Springs is here to do that.
I think the community benefits from Rainier Springs because we're able to offer comprehensive chemical dependency treatment as well as mental health treatment. It's something that Clark County has been lacking for a very long time.
You know, when people come here, they really feel like a person. You know, they don't wear hospital gowns. If you've seen our rooms, they're really treated like a bedroom. It's kind of almost set up like a hotel. So people come here, they don't feel like, you know, they're going to be strapped down, like they're going to be just, you know, snowed with medications. I've had patients say to me, you know, I've been a lot of places, and this place I really do feel cared for. I feel like I can come out and enjoy the beautiful scenery. I can exercise. So they are really treated like people. You know, it's people with disease that we need to treat. It's not bad people, it's good people, bad diseases.
Good morning or afternoon, depending on where you're joining from today in the country. My name is Tom Codier, and I'm currently serving as the Acting Deputy Assistant Secretary for Mental Health and Substance Use. I am pleased to be part of the 2021 Law and Mental Health Conference, focusing on reducing the impact of alcohol on states and local governments. I'm humbled to join an agenda that's filled with informative, influential, and inspirational speakers. I began working at SAMHSA back in 2014. From 2014 to 2017, I served as the senior advisor to the administrator and later as chief of staff. A little over a year ago, I became the regional administrator for New England. And on January 20th, I was asked by the Biden administration to serve in the interim period until permanent leadership was appointed at the agency. Dr. Miriam Delphin-Rittman, the former mental health commissioner from the state of Connecticut, has recently been confirmed, and I am now helping her transition to her new role as the next Assistant Secretary for Mental Health and Substance Use. Within the Department of Health and Human Services, SAMHSA leads public health efforts to advance the behavioral health of our nation. We are continuously in pursuit of fulfilling our mission to reduce the impact of substance use and mental illness on America's communities. While we're often known for our grant making, our paramount roles include providing leadership, giving voice to the issues of substance use disorder and mental illness, improving data collection, using data to effect positive change, using surveillance tools like NSDA, the National Survey on Drug Use and Health, educating the public and increasing awareness, providing regulation and setting standards, and finally, providing opportunities and materials for practice improvement. At SAMHSA, we work to help Americans understand that their behavioral health is essential to their overall health, that prevention works, intervention is critical, treatment is effective, and that people can and do recover. I'd like to share a short story with you. It's about a man who, by the time he was 30 years old, was pretty successful by most people's standards. He came from a good, loving family, and he had many friends. He had been employed in nonprofit management and development for many years, and he had risen in his career to become the executive director of a large nonprofit agency. He was also very involved in his community. He had a love of politics, and he was an elected member of the state Senate. On the outside, everything about this man's life looked normal. Some would even say perfect. However, on the inside, he was tortured. So he turned, first to alcohol and then to other drugs to cope with the stresses that he was experiencing. Underestimating the power of these substances and not understanding the consequences of taking them, he quickly became addicted, and his life started this downward spiral. As his life began to unravel, he started to lose the things that were most important to him. When his family and friends tried to help, he resisted their help and he pushed them away. This caused him to lose them. He lost interest in politics. He lost his job and his position in the Senate. His health deteriorated. He lost his apartment and became homeless. He lost his spirit. He lost his freedom. In the end, he lost everything, even his desire to live. This man's life, which at one time was so full of hope, became hopeless. And I know this story well because, as some of you may have guessed, it's mine. But fortunately, I was able to get the help I needed. And while I may be joining you today as the Acting Deputy Assistant Secretary, more importantly, I'm also a person in long-term recovery, which for me means I haven't used alcohol or drugs since May 15th of 2003. And I'm honored to be able to bring my lived experience to leading SAMHSA. You see, I was one of the fortunate ones, one of the roughly 10% of Americans with a substance use disorder who received treatment. In fact, the substance use disorder treatment I received was funded by SAMHSA block grant dollars, and the recovery support I received post-treatment was funded by SAMHSA's discretionary grant program known as the Recovery Community Services Program. People can and do recover. People just like me, and perhaps just like some of you. I mentioned that before serving this role, I served as the regional administrator for New England, or SAMHSA's Region 1. I helped the states in my region respond effectively and compassionately to back-to-back crises. The New England region, like other regions, was facing increases in COVID-19 infections, along with spikes in mental illness, substance use, and increases in drug overdoses and suicides. I know the conference this year is being supported by many organizations in Oregon and the Pacific Northwest. I want to give a shout out to our incredible regional administrator for Region 10, David Dickinson. He is a skilled and knowledgeable professional with vast amounts of behavioral health knowledge and can certainly help you, as can all of our RAs, navigate the federal bureaucracy and consult with you on whatever challenges you're having in your state. Please reach out to them. We know that the loosening of alcohol regulations under COVID and the increase in alcohol sales has had an impact. SAMHSA has been given significant resources over the past year to help address that. The Biden-Harris American Rescue Plan, along with other COVID relief bills, nearly tripled the amount of money available to the Substance Abuse Prevention and Treatment Block Grant. These resources are made available to states, and alcohol prevention, treatment, and recovery and prevention are all allowable uses for these funds. Please reach out to your single state agency to find out the best way to access these for your programs. Effective prevention program is critical if we're going to continue to make progress, especially on youth alcohol use. In 2016, I worked with Surgeon General Vivek Murthy on Facing Addiction in America, the Surgeon General's report on alcohol, drugs, and health. The report identified over 60 evidence-based programs that are being used to effectively prevent alcohol use. Other tactics like increases in state and local taxes on alcohol are a simple and effective way to reduce the harm of alcohol. We all know that alcohol regulation happens across the government. We at HHS work with our partners at the FTC, the DOJ, the ATF, and others. SAMHSA leads the Interagency Coordinating Committee for the Prevention of Underage Drinking, which is bringing everyone to the table to commit to doing more. This is key to limiting the alcohol industry's marketing to youth or misrepresenting the contents or character of alcohol. SAMHSA is also committed to recovery housing and scaling up collegiate recovery programs in many public colleges and universities, as we know that this is a particularly at-risk and vulnerable population. To conclude, let me emphasize that SAMHSA is taking quick action to save lives. We will continue to work with our federal partners. We will keep identifying pandemic-related behavioral health needs. We'll carry on with the planning and implementing of new services while encouraging the safe delivery of care. We know that the far-reaching stressors of the pandemic have devastated many Americans and have created unprecedented challenges for the behavioral health providers across our nation. During this time of increased demand and urgency, I want to assure you that funding is in place to help states and territories create more pathways to prevention, intervention, treatment, and recovery services, especially for underserved populations. Together, we must work to restoring our systems and expanding our nation's treatment and recovery support systems permanently. Now, more than ever, these are matters of life and death. Thank you, and have an amazing conference.
Well, hello, everyone. I'm Tim Namey. I'm the director of the Canadian Institute for Substance Use Research in Victoria, British Columbia, Canada. And today I'm going to be talking about alcohol's impact on states and municipalities and giving you a bit of public health and clinical perspectives. So as a brief outline, I'm going to talk about alcohol consumption in the United States, including the different definitions and dimensions of alcohol use. I'm going to talk about the health, social, and economic impacts of alcohol use. And then I'm going to talk about risk factors for problems like community level factors, genetic factors, personal characteristics. Then we're going to cover off on some of the things what we can do to prevent or reduce alcohol related problems. And then I'm going to talk in particular about alcohol policies, which are, after all, laws, as cornerstones of solutions to alcohol related problems, including those pertaining to mental health problems. So because we're the focus of the conference is mental health, I wanted to give a particular sort of focus on alcohol's role in mental health, because it can affect multiple forms of mental health in an adverse sort of way. So alcohol is most likely one of the causes of depression. And in addition, it can be a clear exacerbant of depression, meaning people who may have developed depression having nothing to do with alcohol, it can be made worse by alcohol consumption, particularly excessive drinking. For these same reasons, alcohol is intimately involved with suicides. Depending on the study, anywhere from 30 to 50% of all suicides will involve alcohol at some level. And this is in part because when people are impaired with alcohol, they tend to do stuff that they wouldn't otherwise do, even if they felt like it at the moment. Then we have to remember that alcohol use disorder, or in the old parlance, alcohol dependence or alcoholism, is actually a type of mental health condition, or is described as such. In the short term, alcohol leads to emotional lability, means changes in emotion, impairment in judgment, can lead to anger, with verbal and physical abuse and violence that might not have otherwise occurred in the absence of alcohol. Alcohol contributes to sleep disturbances, interpersonal relationship problems. It can interfere with medication adherence. So people who are drinking excessively or heavily may not take medications. Again, this is another way that alcohol consumption can influence mental health conditions that involve taking pharmaceutical products. And then alcohol can definitely contribute to job problems. Now, job problems are not, strictly speaking, mental health, but again, a lot of these kind of existential things like our jobs and our relationships are intimately related to mental health, which is why I mentioned them. Well, what about the public health of importance of alcohol, and in particular relative to other substances? So when I think about public health impact, I think about, that means like how many deaths, how many injuries, how many problems does it cause? Then I think about what is the preventable fraction? In other words, something that has more public health value is something we can do something about. And then I also think about secondhand effects, because those are particularly important when the people other than the drinker, him or herself, are suffering consequences. So alcohol, of all the kind of most commonly used substances, causes lots and lots of deaths and injuries and problems. We'll go into that a bit more. But in terms of total deaths, it probably still trails tobacco. But even now, alcohol causes many more deaths, for example, than do opioids, and certainly marijuana, obviously. In terms of the preventable fraction, for tobacco and alcohol, the preventable fraction is high. Why do I say that? Well, it's because both of those substances are legal, and therefore we have a series of laws and policies and regulations that surround the use of these substances that can be dialed up or down to control how much is consumed in the population. And then alcohol, in terms of secondhand effects, is definitely the king of the substances, because lots of alcohol-related violence, sexual assaults, child abuse and neglect are tied closely to alcohol. So I'm not saying that other substances don't cause, heartbreak or problems for other people, but alcohol is the leader of the pack. Well, one of the problems in my field is that the definitions and measurement of alcohol consumption are all over the place. So if you're feeling confused by all the terminology, don't feel bad, because a lot of people are. So I'm going to talk about a few things today. One is per capita consumption. That's sort of saying, what is the sales of alcohol, and assume the consumption for the total population as a whole. Current drinking usually refers to any consumption. It can be in the past month, or it could be in the past year. Binge drinking is an important term, and refers to levels of drinking that result typically in alcohol-related impairment. So that would be 5 or more drinks for men, or 4 or more drinks per woman on a drinking occasion. Note that this basis for the binge drinking definition is not to do with average consumption, but it is consumption that is clustered in time, if you will. Now, just to confuse things, in the context of heavy alcoholism or in the context of addiction medicine, binge drinking is often used in a different way to describe like a long period of drinking, like going over days, but I'm just going to mention that as something to be aware of. But in the common parlance, it's sort of drinking to the point of impairment. Heavy drinking is a term that's used by the Centers for Disease Control, which refers to levels of average consumption in a day or in a week. Moderate consumption is a term that's thrown around a lot, but there's not really a definition of it. And a lot of people will use the idea of drinking in moderation to mean sort of low-level drinking, but it really depends a lot on who's using the term. There are also, from the dietary guidelines, there's also recommended limits for people who consume alcohol. And it's how to consume alcohol in a reasonably low-risk way for most people. And that's up to 2 drinks per drinking day for men or 1 per drinking day for women. And then there's alcohol use disorder. We've mentioned that in the past already in this talk. That's a clinical diagnosis, and it's based on having 2 or more out of 11 criteria, having suffered problems or showing signs of tolerance or withdrawal, these types of things. So these first measures are based on how much someone is drinking, and then the alcohol use disorder is more based on a clinical diagnosis. This is a slide that shows per capita consumption in the United States. On the y-axis, on the left there's the number of gallons of pure ethanol consumed per person aged 15 and older in the US population. And what I want, this goes way back all the way to the 1930s, so shortly after the lifting of prohibition. You can see that consumption really went up, but I want you to focus on the last 20 years, that consumption has increased about 10% between 1995 and 2015, and it's actually continued to go up. So you can say, well, that's only a difference. It went from like 2.1 gallons of ethanol per person up to, now almost 2.4 or 2.3.5. And even though that doesn't sound like a big difference, it actually translates into big differences health-wise. This shows you the per capita consumption by state. If we look at these same views, this is from 2016, for example. The states that are the bright red have the highest consumption per person in the population. So these tend to be the West, the Intermountain West, the middle of the country, and the Northeast. The Midwest and the Northeast, with lower rates typically observed in what some people would call the Bible Belt and in the Southeast. Now, there's an important concept I want you to get across to you, which is this idea of the drinker's pyramid. So before we get into what the specific labels mean, if we think about this pyramid pertains to, let's say, people who are drinking in the general population. In the United States, at the bottom there are about 35 or 40% of people who really don't drink alcohol at all in the past month or past year. A lot of those people have never consumed much alcohol, but more than half of them are actually what's called former drinkers. Some of them may have, sort of drank too much and quit drinking, or some of them may have become ill or older and just stopped drinking because it's not as pleasurable. Then there's like 35% of people, we might call them low-risk drinkers, or people who are kind of not, meeting criteria for binge drinking, and they, maybe have 1 or 2 drinks most days that they drink. Then we have your high-risk drinkers, and then at the very top of the pyramid, we have the alcohol use disorder, or the people with probable alcohol dependence. And that's about 5% of the population. Now, what we're going to talk about today is that typically people have just focused on the 5% at the top. But if you want to do prevention, and you understand that a lot of the problems are actually coming from that 20% right below the 5%, you need to focus on both of those people. You need to focus on the high-risk drinkers and people who have alcohol problems. Again, not only because the high-risk drinkers are contributing quite a bit of problems, but because today's high-risk drinkers are going to become tomorrow's people with alcohol dependence, or may become those people. And once you have people with alcohol dependence, even though, we try to treat them, or they, hopefully a lot of people, aren't interested in treatment, and treatment is not always effective. So we really would like to, in this talk, really the whole concept boils down to intervening with people before they get to the top of the pyramid, if that makes sense. Now, thinking about prevention and different things, that's the way we think of binge drinking. In the same way that high blood pressure is a risk factor for heart failure and having a stroke and getting hardening of the arteries or this and that, so too I want you to think about binge drinking, not as a disease in itself, because it's not, but it's a form of high-risk drinking that increases the likelihood of alcohol-related problems, or directly causes lots of alcohol-related problems, including among people who are not otherwise meeting the definition of alcoholic or having an alcohol use disorder. So binge drinking is a strong risk factor for things like injuries, even certain types of liver disease, violence, sexual assault, we've mentioned. Actually, cardiovascular disease, people are more likely to have heart attacks when they're binge drinking or have been, and different things. So if you want to think about this, I would put kind of binge drinking as, if you will, as the fundamental building block of alcohol-related problems, whether or not alcohol use disorder is there or not. So in terms of health impacts across the country, alcohol contributes about 106,000 deaths annually in the US. And again, that's compared to about 50 or 60,000 now from opioid overdoses. It's the third or the fourth leading behavior-related cause of death. Each alcohol-related death causes about 30 years of potential life lost. And that is because, of course, many of these injury deaths from alcohol occur among youth and young adults who have many years of life ahead of them. This would contrast to something like tobacco, where most of the deaths from cigarette smoking, or a lot of them, are caused by heart disease and cancer, which tend to affect older middle-aged adults and older adults. So that if you look in terms of the years of life lost, actually alcohol causes more of those than does cigarette smoking. Economics, I'm not going to go into great depth, but alcohol, excessive drinking costs about $750 per person in the United States, not just among drinkers, but if you were to spread that out among each and every person, or about $2 per drink if you were to divide the costs among all the number of standard drinks sold. And I should mention that, remember, a beer has the same amount of alcohol as does like a standard 5-ounce glass of wine, as would a shot of, whiskey or something like that. So each standard drink costs about $2 in terms of costs for health problems and problems from the legal system, and et cetera. Let's look at the breakdown. Now, this is a slide just kind of showing the approximate breakdown of deaths just from excessive drinking. So this total here is about 88,000 deaths from excessive drinking. I just mentioned that there were 106,000 deaths from drinking overall. That's because there are some deaths actually that come from quote unquote moderate drinking or drinking at low levels, certain cancers, including breast cancer, for example. But let's look at deaths from just excessive drinking. We can divide these into two main pools. The first is the acute causes of deaths, or things that are basically happening because someone's intoxicated. So those would be like motor vehicle crash deaths, injuries, violence. Those total about 43,000. And then we call them the chronic causes of death, which is a cumulative effect of alcohol's toxicity to various tissues in the body. So those would be alcohol-related liver disease deaths, CVD is cardiovascular disease, And then the alcohol-related cancers, another 19,000 deaths a year. So that comes, so about a pretty close to an even split between acute and chronic causes of death from alcohol. And then the secondhand effects, I think I've mentioned them, but these would be like pedestrian injuries, somebody walking on the sidewalk is run over by an impaired driver, people who are injured in alcohol-related fires or homicides. There are things on society like a lot of economic costs. There, pretty much all of the effects that happen to children are by definition secondhand. These would be like financial problems or child abuse and neglect. And of course, there's the effect on fetuses. Alcohol is the leading neurotoxin among America's children, and probably about 4 to 5% of all pregnancies in the United States are alcohol involved. And the other key point to take away about that is that fetal alcohol syndrome is the full-blown kind of thing, but it's important to remember that there are lots of alcohol-related effects, even among people or even among kids who aren't diagnosed with the full FAS. So there's now this whole concept of FASD, fetal alcohol spectrum disorder. So a lot of things like certain learning disabilities and so forth caused by alcohol exposure in utero, even if you don't have the full syndrome of fetal alcohol syndrome. This is another way to look at the harms to others. This is a paper from Nutt et al. From England from a few years back. But if you look at the ratio of the red bars to the blue bars, the blue is the harm to users, and the red is the harm to others. And you can see that as a ratio, not only is the total harms from alcohol more than from all those other substances, but a greater fraction of the harms occur to people other than the drinker, him or herself. Now, I kind of gave you a hint about this earlier, but the traditional paradigm around alcohol we've been rooted in this, what we call the biomedical model. And to simplify things greatly, in this case, the problem of alcohol was alcohol use disorder or alcoholism, and the solution was specialty treatment. But I'm here to kind of tell you that this kind of paradigm is kind of changing a bit. I think it's important to be very honest about the problems with the way the problem and the solution are conceptualized. And I mentioned some of these earlier. The first is that there are a lot of harms that come from alcohol consumption that come from those who don't have an alcohol use disorder. So, all that binge drinking that goes on in people who may not meet criteria for having an AUD and all those problems. And remember, that group of people is 4 or 5 times as numerous as the people with an AUD. So you've got a lot of problems that are caused by people before they even get to the stage of an alcohol use disorder. So from that standpoint also, if you're just focusing on people with AUD, well, you're kind of late to do any prevention, right? So we, again, would like to focus on people before we get to that stage. An example that I use frequently in talks is the idea of deciding to treat, we don't wait to treat people's high blood pressure until they have a stroke, or we shouldn't, right? We recognize that high blood pressure is a risk factor for having a stroke, and we try to treat the high blood pressure before the stroke occurs. Well, the same thing we want to do is prevention, is when we recognize that people are drinking in risky or unhealthy or heavy ways, we want to intervene then, before they get to having an AUD. The other problem is that if we wait until people have an alcohol use disorder, we have to remember that relatively few people with an AUD engage in treatment. They may not have health insurance. Even if they do, they may not get into a treatment program. The treatment program may not meet their needs or kind of fit in their kind of what they're looking for. And so the result of that is, the bottom line is that treatment is expensive and it's difficult, and actually a relatively high percentage of people with an alcohol use disorder have never had treatment. And actually, a lot of them are not interested in treatment. And we definitely need to make treatment more attractive and more available, but that's not going to solve the problem. So I want you to think more broadly. We have a clinical box. I'm a doctor. We've had this biomedical model, and as doctors, we love to think about, okay, we're going to bring the person with the severe alcohol problem. We're going to treat them in the clinic. We're going to maybe admit them to the hospital. And, and then unfortunately, we have the morgue when that doesn't work. But really what we really need to be understanding is all these non-clinical factors that are strongly influential to whether people drink alcohol and how much they drink. And I've just kind of thrown a few of these into the slide, like people's, the social attitude in the community, people's family history, their housing situation, how high the alcohol taxes are in their state, whether they, spend a lot of time exercising or have, a high amount of happiness, or they watch a lot of advertising. All these things matter. Their religion matters a lot. If you tell me somebody's kind of religious, family religious background and kind of their age and sex, you can often make a pretty good guess about, whether they drink alcohol or how they view it. The other thing we have to think about along these same lines is the difference between clinical and public health approaches. And what I'm going to hopefully convince you today is that even though we need to have clinical approaches to people with diseases like alcohol use disorders, we also need to take a public health approach to make a dent in this problem. When I say clinical, I mean we're oriented around patients with diseases, and those diseases are in need of treatment. But when I talk about public health, we're thinking about the whole population. We're thinking about risk factors within the population, be they alcohol specific, like binge drinking, or maybe not alcohol specific, like living in unstable housing, whatever it might be. And we think about prevention, not just treatment. So I think you're seeing where I'm going. The emerging paradigm is that alcohol is a cross-cutting risk factor, not a disease, but a risk factor for multiple health and social problems, including alcohol use disorder, but certainly not limited to it. We also recognize that the problems don't just come from the extremes of the population. In other words, it's not just kids drinking that's the problem. It's not just alcohol dependence that's the problem. And it's not just the quote unquote hardcore drunk drivers that are the problem. So the new paradigm, we focus on, drinking more than is healthy or excessive drinking. We look at the continuum of risk, that, the idea that risk is really starting to build up before we get to the point where, somebody has an alcohol use disorder. And we've really got to focus on fixing the things that we can fix. And what I'm going to tell you is that the easiest thing to fix that has the biggest impact is changing the environment in which we all may live. So next I'm going to talk about fixing the environment, and I'm going to focus in on alcohol control policies, because that's my area of expertise, and that is, I think, when you take the public health approach that I'm talking about, that is the key to the public health approach. Well, what are policies? Policies are typically laws that are passed, or they may be the regulations that attend laws. But this is the nice thing for this conference is that policies, for the most part, are legal constructs. So they're amenable to change, and they are firmly rooted in the law. By policies, I'm talking about things like alcohol taxes, or minimum prices for alcohol, or limits on the number of outlets where alcohol can be sold. Like, do we want alcohol to be sold in every kind of store, in every kind of place all the time? So in most states, there are limits on the number of outlets, or limits on the hours of sale, or the days of sale. Then we have things I'll call on-premise policy. That was like when you're consuming alcohol in a restaurant or bar. Are there restrictions on happy hours? Like, is there a restriction on saying if paying $10 and drinking all the beer you want? And then policies about like making sales to people who are already intoxicated illegal. Then there's sort of drinking and driving laws. policies that people would be familiar with, like .08 laws and all the legislation surrounding those, ignition interlock laws, and then there's a bunch of stuff that pertains specifically to youth, the most important of which is minimum legal drinking age laws and how those are implemented and in some cases enforced. Well, you know, I've worked in this field for about 20 years now, and so because policies are effective, but because they lead to reductions in consumption, there's a lot of attack on policies because there's a lot of money to be made from selling alcohol. And when people suggest interventions that might reduce the sale of alcohol, that generates pushback. So the first thing that, you know, that I hear a lot is that policies don't work. But, you know, I'm here to tell you, and I'm going to show you some research later on, that in fact, policies work, and changing policies like raising taxes, reducing the availability of alcohol a bit by not making it available in so many places at so many hours of the day, those have big impacts. And they're actually impacts that you can measure at the population level. Like I can actually show you, listen, the number of people who binge drank in the whole population went down when the taxes were raised, or things like that. And then other people will say, well, policy, that's the kind of government, you know, nanny state, and it's really about people being educated and making their own responsible decisions. And the answer to that is that the purpose of public policies around alcohol, just like it is around, you know, taxes or any other kind of thing, is to allow people to have personal liberty, but to help guide their decisions. So in other words, if people recommend, say, drinking a little bit of less alcohol, one of the ways to kind of unconsciously incentivize that behavior is to maybe make it a little more expensive or a little bit less available. So the purpose, because alcohol is obviously a legal substance, so you know, our country or our state or our municipality benefits by keeping it legal, but also benefits by keeping it under control. Then other people will say, well, you know, why can't we just, you know, tax alcohol for people who have problems? And the answer to that is, well, these policies that are designed to, you know, to affect the whole population actually impact the high-risk groups a lot, and in some cases the most. They help keep people who are drinking in low-risk ways, low risk. And as we've discussed before, it's not just the high-risk groups, highest risk groups that contribute all the problems. I think we've already touched on these. Alcohol policies may limit freedom or choice. And I think the way that people in the field look at it is that, in fact, they promote personal choice by making the sale of a dangerous product more acceptable. In other words, before we had alcohol policies, you know, we had prohibition, which was, you know, not socially acceptable to many people, and it was repealed. But as a condition of lifting prohibition, basically states were charged with saying, okay, we're going to make it legal, but now we got to make it safe for most people who drink, and particularly for people who don't drink. So that is part of a way we can do it safely, is by regulating things. And then the other thing is the freedom argument. I mean, there's a big idea about freedom in our country, and but there's important to note there are two kinds of freedom, right? There's the freedom to do certain things, but there's also the freedom from having things happen to you, right? So we want to have people free from the fear of being run over by a drunk driver or an impaired driver. So there are different concepts of freedom. And the last thing is you'll hear is that policies cost money. But again, if it's raising taxes and things, they may actually could make the government money. They can actually lower income taxes or property taxes. It just depends what the policy is. And I think we'll skip over this slide. And maybe this one too. So in summary, I'll make the case for alcohol policies. They can prevent or reduce multiple types of alcohol problems across the entire population. The good thing about them is that they do not rely on persuasion, willpower, health consciousness, or a sense of civic responsibility. And they can be cost efficient and, in fact, can be cost saving. Many policies, not all of them, but many policies, including some of the ones that I've mentioned, have strong evidence of effectiveness from multiple different study designs. And as I mentioned, they can yield population changes for the full spectrum of drinking patterns. So they can be beneficial for people with an alcohol use disorder, for binge drinkers, for underage drinkers. And again, they reduce multiple types of problems. So I'm going to talk a little bit about the work that my research team has done to look at what we call the state policy environment. So most policy researchers might research the impact of changing one policy, like the impact of, say, stopping the sale of alcohol at midnight, or something like that, or they would study the impact of the change in a tax. But what we need to do is remember is that in each state or municipal area, there's usually many, many different alcohol policies in effect at one time. And how do they relate to each other, and what is their cumulative impact? And so that's what led us to develop the alcohol policy scale for US states, and it goes by, for each state and year gets a score. Very briefly, what we did was we identified effective state level policies. We include 29 in our scale. We then rated the efficacy of each policy relative to the other ones. So we kind of give a higher weight to policies that are known to be particularly effective, and then not very much weight to those that are minimally effective. We then develop a way to assess how the policy is actually put into place, and then we add up those policies, 29 policies, after weighting them by their efficacy and how well they're actually implemented. And we come up with this thing called the APS score. So this is just an idea to give you, there's quite a bit of variety between the states. And the longer bars are ones with more stronger, more restrictive policies. So Utah, Oklahoma, and this somehow come out blurry on the screen, but those states, for example, Pennsylvania had more restrictive policies, whereas I think it's North Dakota, Florida, and Wyoming are at the bottom. And so they have the lowest policy scores. Now, in our studies, what I wanted to show you is that we've looked at the impact of, what would be the effect of a 10% increase in that APS, that alcohol policy score, and a variety of measures. And what we find is, and what you show there is the adjusted odds. That basically means in scientific terms is like, what is the likelihood of having a particular outcome? So for like at the top, if you live in a state that has a 10% stronger policy environment, that 0.92 means you're 0.92 as likely to have a youth be a drinker. So in other words, it's about an 8% reduction in the likelihood that any individual youth will drink alcohol. So it's about, and then we see very similar. So for youth binge drinking, again, it's about a 7% reduction in the likelihood. We also look at the relationship of 10% stronger policies for binge drinking among adults, for self-reported alcohol impaired driving, for being in an alcohol involved motor vehicle crash death in youth or in adults, or involving low BAC. What you can see here is that 10% increase results in an 8 to 10%, or increase in a stronger policy results in an 8 to 10% decrease in the likelihood of all those outcomes. And there's more. There's lower risk of cirrhosis of the liver if you have a stronger policy environment, of alcohol-involved homicides and intimate partner homicides, a lower risk of alcohol-involved suicides, and actually a higher risk at the very bottom there, that if you live in a state with a strong policy environment, you actually have a 15% higher likelihood of being able to achieve remission from alcohol dependence. So stronger policy environments make a big difference for people that have, had substance use problems, or worked in the field, or, worked in as a physician as I have. you know that the environment makes a big difference. You know that people's kind of circumstances and the number of drinkers they're around and the overall environment makes a big difference. And so in some ways, you know, maybe our research isn't that exciting, but I think our research has really helped make this pretty clear. Now, one problem we have is if we look at, you know, I've showed you what we think the impact of policies are, but if you look at the changes in policy subgroups over time from 1999 to 2018, you can see that for most of those, these are different groups of policies. Most of them have stayed flat. We haven't really increased the strength of our policies, except for that dashed line at the top, alcohol impaired driving. So most states have been quite active in implementing new alcohol impaired driving policies, even since 1999. You know, because of that, we've seen reductions in alcohol related crashes. But one of the things we have to remember is that, you know, alcohol involved motor vehicle crashes account for less than 20% of all the deaths due to alcohol. So while it's great that we've done a good job of implementing evidence-based policies to reduce impaired driving, we really haven't done it with policies that affect 80% of deaths. And let's look at some specific policies that we know from, not just from our research, but from, you know, like literally hundreds and hundreds of research projects and things that make a big difference. Alcohol taxes. Alcohol taxes in US states erode with inflation because they're based on a set amount per unit volume of alcohol. They're not based on a percentage of the price like a sales tax would be. So if they're not increased with time, they erode with inflation. But anyways, this slide just shows for alcohol taxes for spirits or liquor, that's the line at the top, for wine and for beer, have all declined by about 35% in inflation adjusted terms over the past 25 years. So that's not good from a public health standpoint. And actually it's not good from a raising tax revenue standpoint. And the other thing you can see is, I just want you to know where that line ends, because what we did in this study is we translated all of these figures into the amount of tax per drink. So for like a shot of whiskey, the average state tax now is about only a nickel. And for wine and for beer, it's less than 4 cents per standard drink. I bet most people didn't know that, because most people hear from the alcohol industry that taxes are too high. So I bet most people in this audience would not think that paying a nickel for a shot of whiskey or a beer is very much in terms of taxes, particularly compared to the overall price. And then the other thing that you can look at is whether or not taxes, for example, cover alcohol-related costs. And the answer is that they don't. They don't come close. They cover about 15 to 20% of costs on average. So if you think about it, compared to what, you know, if you live in, I don't know, if you live in the state of Georgia, whenever somebody buys a beer in Georgia, the state has to spend a lot more in costs than they take in tax revenue. So I've talked to you mainly about policies, but I also want to talk about, you know, other things that get discussed in the context of addressing alcohol problems, just so you have a kind of a fuller picture. So people will often talk about the importance of personality traits or certain psychological factors or demographic factors like race or age, so forth, in terms of being associated with alcohol-related outcomes. And I would agree that these are established risk factors. The problem is with things like personality traits and psychological factors, they're very difficult to modify or very difficult to change. And if you remember at the beginning, I showed you a grid and said, public health value, what's valuable for addressing in terms of public health is stuff you can easily change. Now, it's not that nobody can ever change their personality but you know, it's generally hard to do it, right? You know, you can go and have many years of therapy or homework on yourself, but it's not easy to change your personality traits. And the problem with, even with that, it's like an individual level intervention. So it's very resource intense. Well, demographic factors like saying, oh, younger people tend to drink more, or this or that race tends to drink more. Well, these are things we can't really fix, right? So, and plus we know that alcohol taxes or effective policies work for all ages and they work for all races and ethnicities. So, and the other thing is that even if you find a subpopulation who's often at more risk, it's important to remember that they're probably still only a minority of the total risk in the population. Educational interventions to reduce drinking. These are, I put in quotes, easy, right? Because it's pretty easy to set up a little, an educational program in a school for the most part. Most people assume that they're effective, and they tend to be popular things because they don't involve, it's relying purely on kind of persuasion or knowledge. But again, if you in public health, I think it's generally widely accepted that the evidence shows that educational interventions, particularly by themselves, are not terribly effective. Again, because they're not applied, you have to keep, putting the program in place and paying for it. They don't tend not to have much of a population level impact. They might affect the school or the particular community where it's done, but it's kind of, these are not things that are easily to distribute to the whole population. The effects of educational interventions degrade quickly. It's sort of like after a week or two or a year, you have to redo it or it doesn't really stick. And so for those reasons, educational interventions tend to be very cost inefficient. Treatment is obviously important for many people, but I think we've mentioned some of the problems. That is that most risky drinkers are not actually dependent and wouldn't qualify for sort of inpatient treatment. The evidence of effectiveness of treatment, it's important to remember, comes from studies of people who are actually motivated to engage in treatment. So they're willing to enter studies. And so maybe compared to people who are like less motivated to enter treatment in the first place, they probably won't expect the same benefits. The medications we have for treatment of alcohol use disorders also are not game changers. They make maybe a small difference, but they're not, a cure-all. And I think we've also talked about that there's problems with how much treatment resources are available and of interest to people. Screening and brief counseling interventions are a much milder form of treatment, if you will. They're meant to be done even in the primary care provider's office, or can be administered by social workers. Their evidence of effectiveness is for people who drink too much, but they're not really probably enough or effective for people who have a severe alcohol use disorder. But again, here, even screening and brief counseling interventions have only a modest effect on participant drinking. It hasn't really been well studied to determine how much of a long-term effects it has on downstream harms, like having an alcohol-related problem in 5 or 10 years. They're very hard to implement in clinical practice. I used to work in a small hospital, and I was in charge of implementing a screening and brief counseling intervention program, and it was difficult. And again, so I think it's important to remember that some of these things are important, but are limited. Now, genetics is something we've all heard about in the context, most likely all of us have heard about in the context of alcohol problems. And however, here, again, the heritability for alcohol use disorder, for example, is at most 50%, and it's probably quite a bit less. And why do we think this? We think this because we've done studies of separated twins, and the twins may come from parents with alcohol problems, and then the twins can either go to households without them, or there's all different combinations. But genetics is probably overrated because there's a lot more things that run in families besides genes, right? There's a lot of the behaviors. when we do these big fancy new genetic studies looking for statistical associations of genes with alcohol problems, we haven't really found many genes. And so some people call it, they think it's genetic, but it's, quote, missing heritability, like we can't really find out if it is or not. Anyways, even if we knew what gene or genes were involved in the likelihood of drinking too much, there's no gene therapy that's available. So what can you do? And even people who know that they're at high genetic risk for other problems besides alcohol, those studies have shown that just knowing that tends to have a limited impact on changing people's behavior. So in conclusion, alcohol causes big medical and social problems, including and especially mental health related issues. Alcohol use disorder, parens, i.e. alcoholism, is definitely an important problem, but the broader concept of excessive drinking or drinking, in ways that will impair you or can harm your health is a lot broader than alcohol use disorder. Point 3 is that treatment is definitely part of the solution for some people, but changing the broader environment is critical to make a big difference. So we really need comprehensive strategies with alcohol control policies as the critical part of that solution and the critical strategy. And we didn't get into this too much, but policies that target the whole population and that increase the price of alcohol and reduce its every moment of the day physical availability are the most effective types of policies. So with that, I'll wrap up my taped remarks. Thanks for hanging in there, and then I guess I'll be answering questions at the live session. Thanks again.
Good afternoon. This is Joel Ainsworth from Echo Northwest, and I'm joined by my colleague, Andrew Dyke.
Hello.
Today, we're going to be talking a little bit about the work we've been doing for the Oregon Health Authority around the excessive or the economic burden of excessive alcohol use in Oregon. So the work that we have done and are currently doing for OHA really consists of 3 main pieces. The first piece is just an overall literature review, kind of looking at the current state of the economic and social science literature, focusing on these components of measuring economic burden to see what's changed, what's the types of reports that are out there, looking at the efficacy of alcohol tax policies, and then really framing a policy scenario for them that will ultimately feed into their policy work and potentially a legislative package that they would put together around alcohol pricing strategies. So before we get into our analysis, I just wanted to provide a couple of slides to give some context as to why we're doing this work. And I think the first and foremost reason as to why we're doing this work is that Oregonians consume a lot of alcohol. And so if we look at the slide here that I'm currently showing, this gray bar that's horizontal represents the US average consumption of gallons per capita between 1970 and about 2019 or so. And this blue line that we see is consumption relative to the average. And so if we look at Oregon historically and certainly in the recent trend, what we see is that it's more often than not that Oregonians consume higher per capita consumption than the US average. And certainly as we get into the 1990s and further into the 2000s, we see a deviation and a growth movement away from the average as that consumption per capita climbs in Oregon. And right now, the difference between the US average and Oregon is about 3.4 gallons per capita. Really, I think growing out of the explosion that we've had in microbreweries, wineries, and more recently distilleries, that's just sort of created an access to different types of alcoholic beverages that up until recently haven't been available in other parts of the United States. But another component of this is to really understand how these harms are distributed. And one way to look at this is across subpopulations. And what this chart shows is alcohol-related deaths in Oregon by subpopulation. As we can see, there's certain racial and ethnic groups where alcohol-related mortality tends to be more concentrated, specifically the AIAN population, whites and African Americans. And this chart is per 100,000 adjusted for age. The one caveat I would say with this particular chart is that there are a lot of data issues, classification issues on death certificates as it relates to AIAN population. And so although we do think that some of the harm is, the mortality is concentrated in that population, we do need to be mindful that there are some real issues with the underlying data that we need to just keep in mind as we interpret this chart. Additionally, and this chart's a little messy, but additionally, the harm is not evenly dispersed or evenly represented around the state. And what we see is that when you adjust for age, that rural areas in Oregon tend to have higher rates of alcohol-related mortality than the urban areas. And specifically Harney County, Southwest Washington, Klamath County, some of these areas where you see elevated rates of alcohol harms related to or compared to some of the urban cores in the Willamette Valley. So this brings us to our work, which starts by measuring the economic burden of alcohol abuse or excessive alcohol use in Oregon. And so when we go through the literature, we look at the prevalence and specific counts of incidents, look at the per unit costs for 2019, we come up with a number that's around 4.8 billion, which is a very large number, I think, as we all know. So to put some of this into context, $4.8 billion is the revenue of some pretty well-known companies in 2019, Delta Airlines, Airbnb, American Express. So really, it's one way to think about it is it's the value of the revenue for some pretty large firms. But to bring this back to Oregon, which is helpful for me to put this number into context, is that $4.8 billion is pretty close to the entire value of the economy of Corvallis. And so this is just a one-year number, right? So when we talk about $4.8 billion in economic burden, we're essentially talking about something close to the total economic value of Corvallis, the university, HP, the federal government and state governments, all of the functions that are out there year after year after year. One of the reasons that economists are interested in the harm of excessive alcohol use is, one, as we just mentioned, it's a really large number, but it's also how that cost is distributed across society. And so at a high level, we sort of put this into two different buckets. There's the private cost, which is about 46% of the total cost of economic harms. And that's really the cost imposed on, the private cost essentially imposed on individuals through lost earnings, or costs imposed on employers through lost revenues. So we kind of frame this as labor productivity, but really talking about reduced and lost earnings for those individuals that are either users or experience some type of harm that affects their employment. The other piece that is somewhat unique to alcohol is the large public costs. And part of this is simply due to all of the different aspects that excessive alcohol use touches in our society. Everything from criminal justice to healthcare, health and human services. It just really reaches a broad facet of our state and is sort of represented through our state's expenditures. And so this public cost really is the cost imposed on all of us as Oregonians that is directly attributable to excessive alcohol use. And maybe to put this public cost into context, often we we use a lot of different jargon, but we'll sort of frame it as externalities or really as costs imposed on other people. But the research typically tends to narrow that focus. And this survey here, I think, provides useful context for thinking about how those different harms might sort of affect people that aren't users themselves, whether that is being in a passenger with somebody that's drinking or some other type of risky behavior, being assaulted, or family or financial problems. And so these are certainly important and embedded in the work that we've done. But for this analysis, we've taken a slightly broader approach. It's kind of a cost accounting approach where, again, we sort of look at the costs represented through agency expenditures. And there's benefits and costs to this. On the benefit of that is that we're really trying to get at what's actually spent on harms related to excessive alcohol use. There are some limitations that we'll talk about a little bit later on. The other reason that we care about this public component of the economic burden of excessive use is how those harms are distributed across our society. And again, we talked about this a little bit through the mortality piece, that it's not equally distributed across race and ethnicities, and it's not equally distributed across geography. And what the research tends to show is that alcohol harms tend to fall disproportionately on individuals who experience low socioeconomic status. And there's a variety of indicators that we pull in here, some which may be seemingly unrelated to excessive alcohol use, but may have some contributing factor as to why somebody may choose to drink in excess or may experience a disproportionate share of harms. And the four characteristics, or the four contributors that we list here, although it's broader than that, are really limited employment, housing instability, access to healthcare, which can sort of mitigate some of those harms related to alcohol use, and then the social networks, which can be a contributing factor to drink, or may be a contributing factor to experiencing a disproportionate share of harm relative to the average. So kind of bringing this back to our work, again, we find that the total cost, public-private cost combined, is about $4.8 billion in 2019. So that, when we sort of compare that to Oregon's economy, to sort of the total value of all of our goods and services produced within the state, that's about 2% of our GDP in 2019. So if we look over to the right side of the screen here, we see that this kind of cuts across several different social and economic structures. And this labor productivity piece at the top really is that, again, that private cost to individuals. But then we've got almost 30% of the cost comes from criminal justice and motor vehicle crashes, incarcerating individuals for offenses, victimization. And we've got healthcare, that's about 15% of the cost, and that is tends to be related to the chronic care, although there is some measurable costs of acute care that's embedded in that. And then education and treatment, and then the social welfare. And social welfare, again, is a broad category, but we're really, in this case, in this context, primarily talking about costs related to health and human services provided to either users themselves or victims of excessive use. So as we were trying to think about how we tell this story about the disproportionate harms, there were a lot of categories that were really hard to disaggregate by race, ethnicity, by geography, by all of those. Mortality, we could, criminal justice, healthcare, some of those others, we really just had a hard time doing that. But as we were sort of exploring this, one of the things that did pop out to us was that in these subcategories of costs that are embedded in the slide that I showed you before, we do have these very real measurable costs that are imposed on victims. And so as we were sort of looking through our different categories of economic costs, what we found is that about 1/3, $1.6 billion of the economic burden are costs imposed on victims. And though there is some likelihood that there's some overlap here between users and victims for property damage and fire, we really think that the overwhelming majority of these costs are imposed on people who may not be users themselves, but are victims of excessive alcohol use. So before moving on, we have to do the obligatory caveats. The first one, which I think is important, is that this is just a static view, or it's a snapshot of economic costs of alcohol in just 1 year. And of course, this is kind of a stock versus flow question, right? And really what we care about from a planning purpose is the life cycle costs of the individuals as their drinking patterns change over time, and their costs are likely to interact with different facets of the state's agencies or public health infrastructure as they move through their life. So this is an undercount in some respects, in that we're only looking at 1 year, but it's I think it's an important baseline to build off of. The second, because we're not looking at that narrow subset of externalities that I provided in that table, we're looking at agency budgets and their share of costs that go to alcohol-related harms. We need to be mindful that as we see those harms go up, it may not be a sign of inefficient spending. And what I mean by that is that if we choose as Oregonians to invest in things like healthcare or increase investment in mental health or treatment services, that may not be a bad thing. Even if we sort of redo this number 2 years from now and it's 5 billion, that number could be a sign of increased investment, which could actually be a benefit. And so we need to both look at the total cost and ultimately go back and look at the prevalence rates as well to make sure that those are moving in the right direction relative to the costs. And I think the third piece here, which is also important, is that there is a lot here that we can't measure. And we want to be mindful that those costs, some of which just can't be measured with our methodology, are important and should be considered as we think broadly about the total economic burden. Some of those might be family financial matters or other things. It's just that didn't show up in the data that we have available to us. So that data stopped in 2019. So before we move into the next section, I think we just wanted to talk a little bit about where we are and where we think we might be going. Heading into 2019 compared to recent years, we did see a pretty big jump there in the share of Oregonians that said they were binge drinking. And of course, we can't forget 2020, which was pretty traumatic for Oregonians everywhere, from politics, wildfire, and of course, the COVID lockdowns, the deaths, everything that came with the traumatic experiences of 2020. And of course, heading into 2021, what we see is that from a high level economic indicators perspective, we do see some positive signs to the extent that the economy was a contributing factor. We see evidence that we seem to be coming out of the pretty severe but short recession that we had. Some of the leading indicators that we had been using to sort of track different measures of risk and health related to alcohol consumption and other indicators that we use in our work do seem to be sort of coming back down to baseline. They're certainly down off their peak. They're elevated from where they were prior to COVID, but they seem to be trending in the right direction. So employment, housing instability, and mental health seem to be moving in the right direction. So these are all really good things coming out of 2020 and sort of midway into 2021 now. I think for us, some of the remaining concerns that we have is because of some of those experiences, pretty extreme experiences, I think for a lot of people, that led to some pretty extreme changes in behavior. And some of this is related to policy decisions about increasing alcohol access on premise versus off premise. But really, we see this big divergence in sort of, risky drinking behavior that started in 2021 or 2020 and seems to be persisting into 2021, although we're still waiting for some of the data to come out. I think for us looking ahead, I think to the extent that this behavior remains well anchored in the Oregonian population, we just need to be mindful that although we do see some positive signs heading further into 2021, that we may still expect to see some need for greater mental health treatment services as some of this heavier drinking behavior persists. And so with that, I'm going to hand it off to my colleague, Andrew Dyke.
Yep, thanks, Joel. So this last section, the last slides we'll talk you through here is really based on our analysis of alcohol excise taxes specifically. And so we can go to the next slide, please. So just a little bit of policy context, or is what we're trying to do with this, is not provide a definitive answer to how all possible interventions that affect price or access to alcohol might affect the various things you see on the right, but really to look at a very specific the effects of a very specific method for increasing the price of alcohol, and that is through the Oregon excise taxes on beer and wine. So we did look at the effect of changing these prices based on the literature. What we did not do is an analysis of all possible, again, interventions that might increase prices, such as minimum unit pricing, or all possible interventions that affect access, or importantly, the impact of programming that might mitigate the harms of excessive alcohol consumption, or educate and prevent alcohol consumption in the first place. So we're looking at an increase in excise taxes, and we looked at three different things. One, tax revenues, how they would be affected by an increase in taxes, excise taxes. Based on the literature, what might the effect on consumption be as a result of these tax increases? And then finally, taking those changes in consumption into mind, how might the tax increase affect the harms imposed by alcohol on the economy and on society more generally? So here's the context, alcohol taxes in Oregon. A couple of comments. Again, we're looking at Oregon's excise taxes. It's not all of the taxes that you're paying when you buy alcohol, whether it's beer, wine, or spirit. There's a federal excise tax. In other states, you will find sales taxes, et cetera. We're focused very much on the excise tax. What this chart's showing is a couple of things. One is that these taxes vary pretty dramatically across different beverage types. These numbers are all based on a standard drink that's 12 ounces of beer at about a 5% alcohol by volume, 5 ounces of wine at 12 to 13% alcohol by volume, and for spirits, 1.6 ounces of 40% alcohol spirits in a mixed drink or straight. And you can see that wide variation in excise taxes. For beer, Oregon's tax is less than a penny per drink. That's 45th from the top in terms of states. Tax on wine is a little bit higher at 3 cents per drink, putting Oregon about in the middle of the pack of states. And then a much higher 26 cents per drink based on spirits, and that's second in the United States. And you'll note the equivalent word there in italics, and that's because Oregon does not explicitly impose an excise tax on spirits, but through the Oregon Liquor Control Commission and the state-controlled liquor stores, the state effectively sets prices, which implies a certain level of taxes, and that's what that 26 cents per drink comes from. So what we did with our analysis, and this is still draft, but was to impose a specific tax increase on beer and wine. And what we did is we said, well, what would happen to prices, consumption, revenue, et cetera, if we increase those two excise taxes to the level of the federal excise tax? And in both cases, for beer and wine, the federal tax is higher than the Oregon state tax. And what that works out to is, in percentage terms, a pretty big increase. The increase in the tax on beer would be about 600%, for wine about 60%. But there's more to the price of beer and wine than taxes, obviously. So in terms of price increases, it's about 4% increase in prices for beer, 3% for wine, but a very large tax increase in percentage terms. And next slide, please. Okay, so what does the evidence say we're not going to try to explain this picture to you. This is what you get if you ask an economist a question. More likely than not, you're going to end up with a picture with all kinds of lines and arrows moving around. We didn't want to drag you through the econometric weeds of the studies and the various estimates that we're relying on, but instead really focus on the high-level conclusions we're drawing from our review of evidence, all the work that went into the cost estimates that Joel walked you through, and come up with some qualitative statements for the most part about how that increase in excise taxes would affect the various outcomes that we're looking at. So to get to the meat of that, the next slide. First point here, largely about the effect on tax revenues. What the literature has shown consistently over a long period of time, numerous studies, is that consumers are relatively insensitive to price changes. Now, if you're interested in raising revenue, that's a good thing. You impose a tax on beer and wine, and if consumption doesn't change a whole lot, you raise a lot of money. It's unfortunately less useful for nudging behavior, which comes into play in the next few slides. But by and large, consumers are relatively insensitive to price changes. So based on this insensitivity, we can estimate the tax revenue derived from that increase in excise taxes, increasing those taxes to roughly a nickel per standard drink, only 4 cents for wine. But that tax increase would raise about $50 million per year in recent years. And because of that small behavioral response, it's pretty clear that alcohol taxes can provide a stable revenue source, although it's important to recognize that consumption is cyclical and tends to move in predictable directions in response to economic conditions and other factors that we can see and that Joel alluded to. In addition, any tax should be tied to inflation to stabilize revenues. That nickel a drink for beer 20 years from now is going to be a lot less impressive in terms of the behavioral response and in terms of revenue generated than a tax that's indexed to inflation. Next slide, please. So I think we're kind of unfolding these and giving away the next slide in the prior slide. Want to look at the effect on consumption in this case. Here, we're using similar literature and the same sets of data. Our current draft estimates suggest that increasing the beer and wine excise taxes to very roughly a nickel per standard drink, 4 cents per wine, would reduce drinking by about 4 drinks per capita. That's about 0.9% on an annual basis. Not a huge change. In addition, it's important to recognize that there are some pretty significant differential effects across subgroups of alcohol consumers. And in particular, the research tends to show time after time that changes in price, and that's what a tax increase does, it does not appear to affect risky drinking behaviors, binge drinking, excessive consumption over a long period of time, drinking while pregnant, etc. It's a different kind of effect. And even more importantly, perhaps, for thinking about the effects on harms that we'll get to in a minute, recent studies show that substitution effects across beverages may offset the intended consumption effects of targeted tax increases. For example, if we were to increase the tax on beer and wine, a predictable and expected outcome would be an increase in consumption of spirits. Now, again, from a revenue perspective, that might be considered a good thing. You're increasing sales at the OLC store, LCC stores, increasing state revenue through that avenue. But from a behavioral perspective, it's less impactful. And in addition, even if we have a general increase in alcohol prices, the effect on consumption might not be what we would expect because consumers have proven very willing to substitute sort of down the quality ladder in that as prices go up, rather than drinking less, they tend to drink lower quality or less expensive products. Next slide, please. So here's just an illustration of how that plays out. What you're looking at is a chart that plots the price sensitivity of consumers by their intensity of drinking behavior. Lower intensity consumers of less alcohol are on the left. Higher intensity drinkers are on the right. And note that it's really those right-hand groups, the top 10%, the top 5% of drinkers that we're most concerned about in terms of the economic harms. Most of those harms are imposed by the heaviest drinkers. And as you can see from the chart, the price sensitivity is quite a bit less for those groups than the consumers at a lower intensity that are less problematic from an economic harms perspective. And the next slide. And I think, again, I've given away my punchline, but our conclusion based on the preceding analysis is that in terms of the effect on social costs, price increases alone are unlikely to drive large reductions in alcohol-related social harms, even if we were to impose a broad-based increase in alcohol prices by taxing beer, wine, and spirits. But we just looked at the chart, and research suggests in other contexts is that most of the harm imposed by alcohol is due to the risky behaviors that are largely unaffected by prices alone. In addition, there are structural social issues that affect the harms related to access to healthcare, et cetera, that affect the harms that are not going to be dramatically affected by increases in price. So that's not to say that tax policy is unimportant. We do see tax policy as an important tool for a comprehensive harm reduction framework, but it's not a replacement for other interventions in a more comprehensive approach to reducing alcohol harms. And next slide. So what are the conclusions we draw from this? As you saw earlier, Oregon's alcohol excise taxes and thereby total taxes on alcohol are low relative to the social cost of consumption and relative to those in other states. So increasing taxes would better align Oregon's beer and wine tax policy with the implied tax policy for spirits, align Oregon's tax policy better with that in other states, and align the costs of consumption better with, the direct financial cost of consumption in terms of price with the social costs of consumption more broadly. As we saw also in the preceding slides, higher is not necessarily always better, particularly for targeted tax increases. We would expect substitution effects and avoidance behavior methods for avoiding paying increased taxes. Driving across the river to Vancouver, for example, will increase as prices go up. And the bottom line there that I've said several times is that we would expect relatively small changes in consumption as a result, particularly to targeted tax increases, but also to more general increases in taxes. Finally, last point here, tax structure does matter. We've talked about a very specific change in taxes. Other types of taxes, such as location-based taxes, taxes specific to ethanol content, minimum unit pricing, such as the policies that OLCC has recently implemented, might better target that high-risk behavior that does drive a large share of the economic harm caused by excessive alcohol consumption. And so I think bottom line there is that it's important to consider a comprehensive framework, as we said in the prior slide, for reducing harms, rather than focusing too much on a single policy intervention. And with that, we'll close the slides.
Hello, my name is Rebecca Pearl, and I am a Vice President of Partnerships and Initiatives at Vital Strategies. We are a global public health organization dedicated to tackling the most difficult public health issues, from preventing epidemics to fighting the leading causes of disease. Harmful use of alcohol feeds into those diseases and is a public health problem that requires a population-wide focus, but it's not always addressed in that manner. I'm going to talk about a policy report that Vital created on this issue as part of a series of reports on non-communicable diseases, also called NCDs or chronic diseases. And then I'll turn the floor over to my colleague, Nandita Murakutla, who will speak about a second report on alcohol subsidies. This presentation will be about 20 minutes long. Next slide. I'm just going to give you a minute to read this slide. I have worked in tobacco control for much of my life, and while tobacco is an insidious problem, it's a product that kills 1 in 2. It doesn't disrupt societies in such a violent and acute way as alcohol. I also want to say, as you may know, that the harmful use of alcohol most commonly referred to in the US as binge drinking, is a growing international issue and one that has unfortunately become worse during COVID. Next slide. The World Health Organization estimates that globally about 3 million people die each year as a result of harmful alcohol consumption. More than half of these deaths are from non-communicable or chronic diseases such as cancer and heart disease. Many millions more suffer as a consequence of their own or someone else's alcohol use. Alcohol, as mentioned, causes violence, injuries, and child abuse, and it plays a role in susceptibility to diseases such as tuberculosis and COVID-19. The economic toll amounts to hundreds of billions of dollars each year. Next slide. Alcoholic beverages have been produced and consumed by humans for millennia. Alcohol is also considered by many societies to be central to celebrations and social cohesion, to weddings and baptisms and other rites of passage, even to cementing deals. But despite being a leading cause of NCDs, alcohol's burden remains a low priority among countries. And unless alcohol policy is given more attention, the harmful use of alcohol and its consequences will continue to grow. I think one of the reasons the urgency is missing is that while many people who are well educated and in positions of power, perhaps like yourselves, or who work in public health, look down on tobacco and unhealthy foods such as McDonald's or soda, but they still appreciate cocktails and wine with dinner, and this colors views. Next slide. Just to talk a little bit more about the burden. 1 person every 10 seconds dies as a result of alcohol-related deaths. Alcohol is the leading risk factor for premature death and disability for people between the ages of 15 and 49. And youth who start using alcohol before the age of 15 are 6 times more likely to develop alcohol dependence or use alcohol in unhealthy ways later in life than those who start to drink at age 21. Next slide. A couple more key messages, some takeaways. So it's important to spell out that the economic costs of alcohol dwarf any positive economic contribution. And many societies are many communities and societies are unaware of the scope of alcohol's harms, especially the disease burden due to cancers. When it comes to cancer, there's no safe level of alcohol consumption, and we're realizing this more and more. Next slide. I want to speak a little bit now about the alcohol industry and its tactics. The alcohol industry has the financial and political power to block and derail sound public policies that threaten its profits. And across the world, the alcohol industry uses aggressive marketing tactics that can encourage harmful alcohol use and has drowned out public health messages. Voluntary self-regulation of alcohol marketing, which is an industry favorite, is not a substitute for legal regulation. Next. Now, this is not a case of a few bad actors that we're talking about. Yes, there are some local breweries and cideries that in different communities, like in Oregon, but like the tobacco industry, the alcohol industry is dominated by a small group of multinational companies that control more than half of the world market. And the alcohol industry uses advertising rather craftily to accomplish 2 main goals: to lure and recruit new and young customers, and to normalize and promote alcohol use in new markets and increase global consumption and profits. Next slide. I'm going to keep returning to tobacco themes here because they're relevant for the alcohol industry, because they use a similar playbook of tactics to the alcohol industry. For instance, they use sophisticated million-dollar marketing that's often geared towards youth. They promote self-regulatory systems and voluntary codes like drink responsibly campaigns or get a ride home to head off legal regulation. They target poor and young populations in developing countries where legal policy to control use are often lacking. They also fund and publish pseudo and false science. They use front groups and trade associations like restaurants and hospitality to make their arguments. They employ huge lobbying operations to undermine policy, and they use corporate social responsibility to win favor, encourage goodwill, and discourage policy. Next slide, please. Now, I want to talk about some particular populations. When one starts to drink is important. As mentioned before, youth who start using alcohol before age 15 are more likely to develop alcohol dependence. And there is a real concern that youth alcohol use is commencing earlier, as young people are being targeted more by sophisticated alcohol advertising campaigns and new products that are quite appealing to them. Next slide. Young people are particularly susceptible to alcohol messages because, frankly, they often lack the control, judgment, and cognitive maturity to understand the sophisticated ways that advertising is manipulating them. Alcohol advertisements create false expectations about how alcohol will make people feel and be perceived. Advertising promises, for instance, those things that are important to young people: being happy, glamorous, successful, brave, fun, popular, sexy, hip, and liked. And all this advertising serves another purpose too. It normalizes alcohol use everywhere, from sporting events to any kind of social gathering. Next slide. Let's talk about women for a second. Traditionally, women in most cultures do not drink, but advertising targeting women has proven successful. And as a result, alcohol use by women, especially those of higher socioeconomic status, is catching up to alcohol use by men. Now, they say that women who drink like men will die like men, but alcohol may have an even more negative effect on women than on men, because women's bodies are generally smaller than men's, with more body fat and a different physiology that makes them more prone to brain, heart, and liver damage from alcohol. Consumption of 1 drink per day increases the risk of cancer in women by as much as 10%. And breast cancer is among the cancers linked to alcohol, which there are at least 7. The industry also targets LGBTQ people and minorities. Next slide, please. So, talking a little bit more about the cancer burden, there is a strong scientific evidence of a causal relationship between alcohol use and multiple types of cancer, including cancers of the head and neck, mouth, esophagus, liver, breast, and colon. Worldwide, up to about 30% of the disease burden due to specific cancers in those over 50 years old is attributable to alcohol. And these burdens just are not widely known. Next slide. A major impediment to public health-oriented alcohol policymaking is the public perceptions around the benefits of alcohol consumption. Despite substantial evidence that alcohol is a determinant of poor health, some older studies have suggested that some moderate alcohol use in some populations of men may be associated with a lower risk of heart disease. These early findings have distracted from clear messaging about the public health risk of alcohol. And more recently, in light of new findings that link cancer and alcohol use, some countries have begun to tighten their guidelines around drinking. Next slide. I want to call out a couple of countries who've gotten right and been able to reduce their burden. Recent research shows these policies have reduced alcohol consumption across Ireland. They've been able to embark on minimum pricing there, on regulation of alcohol marketing and advertising, on health labeling, and enforcement powers for health officers to enforce laws on the sale, supply, and consumption of alcohol products and reduce death and disability. Next slide. Thailand's also done some good work. The Alcohol Beverage Control Act there bans direct advertising and promotion of alcoholic beverages and sets a minimum price for alcohol use at 18, which sounds normal in the US, but is really quite rare across the world, these minimum ages. The law also requires products to carry warnings that drinking can hinder the ability to drive, that they're bad for pregnant women, and that restricting alcohol sales should be, and they restrict alcohol sales to certain hours and days. Next slide. So what do we do? Well, Alcohol consumption is a public health problem that requires a population focus. The best way to minimize the social and health harms from alcohol is to lower consumption overall. The death, disability, and injury burdens caused by alcohol are largely preventable. And we actually know what works to tackle the harmful use of alcohol. We just need to do it. Next. The three agreed most effective methods for reducing the harmful use of alcohol are now part of a technical package called SAFER, created by the WHO, World Health Assembly, with technical help from Vital Strategies. These include increasing excise taxes or using minimum pricing, enacting and enforcing restrictions on the availability of alcohol, and comprehensively restricting exposure to alcohol advertising, especially to young people. Next slide. I'm going to keep returning again to the lessons of tobacco because there are some things in tobacco control that have been very well studied, and we now know that they work for alcohol too, including some of those things we mentioned, like taxes, like raising the purchase age, like bans on marketing, like regulating the availability and insisting on clear package warnings or clear bottle warnings, often in cans. Okay, so what to do? Well, we suggest a three-pronged approach to reduce the burden of harmful drinking. Next slide, please. We would like to see civil society, one, advocate for high-impact policy solutions at the local, national, and international levels. We would like civil society to educate the public and policymakers about the health, social, and economic impact of harmful alcohol use and the need for policy. And we'd like to hold governments accountable for global and national commitments to reducing alcohol-related harms. Next slide, please. We'd also like to see governments comprehensively implement these WHO SAFER interventions and take the lead in implementing policies that reduce the harmful use of alcohol. Next slide. And we want the World Health Assembly and the United Nations to provide technical assistance to support national governments to strengthen their policies and regulatory approaches, and to provide regular and timely status reports on alcohol harm and alcohol policy developments. In fact, this year, a new global strategy for alcohol that will run from 2022 to 2030 is expected, and Vital Strategies is working on this. I'm very sorry I'm not with you in person, but I welcome your questions, so please feel free to get in touch with me through the conference organizers. Thank you very much.
I'm Nandita Murukutla, Vice President for Global Policy and Research at Vital Strategies. I'll be presenting today findings from our latest report, The Sobering Truth: Incentivizing Alcohol, Death, and Disability. Alcohol, like tobacco and fossil fuels, is a commodity that harms human health. We describe incentives that go towards unhealthy industries as perverse because financial incentives for these industries go against the fundamental interests of society. These are incentives going towards industries that harm health and harm societies, and therefore we consider them perverse incentives. In Sobering Truth, we describe findings from a narrative review that we just concluded on the financial incentives received by the alcohol industry. Harmful alcohol consumption is a major public health concern worldwide. In all continents across the globe, in high and low and middle income countries, harmful alcohol consumption is proving to be an epidemic. Each year, more than 3 million people die as a result of the harmful use of alcohol, and harmful alcohol consumption costs societies. For example, in the United States alone, $249 billion a year are lost in healthcare and other social costs. There have been a number of global commitments and pronouncements to address the harmful use of alcohol. Technical packages like SAFER describe a range of interventions that can be implemented to protect against the harmful use of alcohol in countries. These interventions include strengthening restrictions on alcohol availability, advancing and enforcing drink driving countermeasures, enforcing bans on advertising, sponsorship, and promotion of alcohol, and raising prices on alcohol through excise taxes and pricing policies. And yet, as we describe it in our report, the alcohol industry benefits from a range of financial incentives. These range from development assistance, tax breaks, tax rebates, marketing deductions, production subsidies, and incentives that are offered in the form of international trade agreements. Hence, on the one hand, there has been generally poor implementation of alcohol policies, poor implementation of the technical policies that are the policies that are described in the technical packages like World Health Organization's SAFER package. And yet we find evidence for governments giving economic incentives to a multi-billion-dollar alcohol industry. In our report, we provide a number of case studies that describe development assistance. For instance, since the 1990s, the European Bank for Reconstruction and Development has provided more than $422 million in development assistance for investment in breweries. And yet many of the countries that are receiving this development assistance in Central and Eastern Europe face an alcohol epidemic. We describe examples of tax breaks. During the 2014 World Cup in Brazil, FIFA required Brazil to waive US $475 million in taxes on any profits made by FIFA and its commercial partners, including AB InBev. And yet in Brazil, binge drinking is reported by 51% of alcohol drinkers. We find evidence of marketing deductions, and this despite the fact that it is recommended that countries enforce restrictions on the marketing, promotion, and sponsorship of alcohol. The US federal government, for instance, provides marketing deductions, tax deductions for business expenditures, including on advertising and marketing. And we report in Sobering Truth how the top 10 alcohol producers in 2017 alone were exempted from paying taxes on $1.5 billion for beer advertising. And yet between 1999 and 2017, alcohol-related deaths more than doubled in the United States. We describe examples of tax rebates that are offered to the alcohol industry. In 2012 alone, the US federal government provided $230 million in tax rebates to Bacardi in Puerto Rico and $199 million in tax rebates to Diageo in the US Virgin Islands. And in all of these places, we find a significant alcohol burden, including binge drinking and rising alcohol rates. We report examples of production subsidies. In 2002, the Ugandan government offered production subsidies for local sorghum for beer produced by a Ugandan brewery of SABMiller. And yet Uganda has the 7th highest rate of alcohol consumption in Africa, and alcohol use is the leading risk factor for years of life lost in that country. We also report the international trade agreement practices that are used to benefit the growth of alcohol production. The UK government worked to remove pricing regulations on beer worth more than US 80 million in sales for SABMiller. And in India, per capita alcohol consumption has been growing, as has been growing the societal and health costs from harmful alcohol consumption. And so in conclusion, our report describes the number of incentives by which alcohol production and consumption is promoted. Incentives most often go to companies that are multi-billion-dollar corporations themselves with headquarters in high-income countries. And this is the case even as countries struggle to meet their health needs, they are finding health harmful commodities continuing to be promoted. And so in conclusion, we call for policy coherence to prevent NCDs. Our report describes how fiscal policies are crucial to prevent NCDs, and phasing out incentives to promote incentives that promote health harmful products is crucial while investing in social programs. It's crucial to make fiscal policies and finances work to prevent NCDs. Our report is available at this website, and we're available to answer any further questions or requests for information. Thank you.
Well, thank you for joining us again. This is the live panel session for the day one morning side of the Law and Mental Health Conference. I'm Jason Renaud, the program coordinator for the conference, and I have with me Andrew Dyke and Joel Ainsworth from Echo Northwest, and Dr. Naimi, who gave us the first presentation and just a load of information. You just dumped a load of data onto our heads, and we're all kind of just wobbling a little bit. Thank you so much. That's terrific information.
Sorry to, doesn't sound good dumping something that making people wobble, but I think you're saying something nice, so thank you.
We paid money for this. Thank you. We want it. Give it to us. And you're bringing some, as we talked a few months ago, some heretical information to this treatment side, that treatment is not the only solution.
Do you want me to comment on that?
Sure.
Yeah. Well, I think the way I would maybe put it is that treatment is part of the solution, but it's not the whole solution. And I think there tends to be, in general, a sort of a divide between the prevention and the treatment side. And I think most people that, I think the bottom line is that we cannot easily treat ourselves out of substance use problems. What we really need is strong environments that are supportive of people not getting into those problems to begin with. So I view these as complementary things. I mean, in other words, stronger public policies, taxes and that sort of thing, can prevent treatment, and as our research has shown, can actually help people achieve remission from alcohol use disorder. So policies, I just think this needs to be viewed as an integrated whole, and part of this is kind of expanding a bit beyond the traditional kind of biomedical model that the problem is the disease and the cure is treatment. And I think that's something we can all kind of agree on, that it's important that it's not that alcohol use disorder is not a disease, but it's a much bigger picture about the causes and the prevention and the cures of it.
So I'll throw this first question out to all three of you, and this comes from Elise out here in Oregon. Do you see any connection between the data for alcohol use for a community or county and whether the county is dry? A county that doesn't drink or doesn't sell alcohol. Dr. Naimi, do you have any information about that?
Oh, sure, yeah. Well, there are relatively few counties in the U.S. that don't allow the sale of alcohol at all. They tend to be more in southern states with strong evangelical Protestant bases. So those states tend to have fairly restrictive alcohol policies. There's also some information about the effect of having bans on indigenous Indian reservations, and those. So I guess the simplest way to put it is that restrictions on the supply of alcohol are effective. A ban is an extremely, is an extreme form of a restriction on the supply of alcohol. And the fact is that prohibition was a failure as a policy, but in terms of things like liver cirrhosis and those sorts of things, that they went down quite dramatically during prohibition and spiked up again shortly after prohibition was over. So I just think that the issue with bans is that they're not really politically feasible in most places. But in general, I would say that restrictions on supply are crucial. So not having every street with alcohol outlet and not keeping, the bars open all night long, those types of things are effective.
So that's so interesting that it's not just, there's so many modalities for this regulation, so many options for a policy maker to look at. Andrew and Joel, did you look at retail outlet availability?
We did not. That was not directly part of our most recent study in any case, but I do agree that bans, I mean, that's a very extreme form of access control and a very blunt sort of policy tool. And, as we saw with prohibition, ultimately, too much of a blanket ban will lead to unintended consequences that are often very negative. But as you may have seen in our slides, we do argue for sort of that comprehensive, sort of holistic approach to mitigating the harms from alcohol that Dr. Naimi was advocating, and that you can't do it with price controls alone. You can't do it with bans as a blanket. And you're not just going to get there with treatment, but need to consider all of the different dimensions of control, whether it's prices, access, treatment, education, et cetera.
And Andrew and Joel, your report was created for the Oregon Health Authority and commissioned many months ago before this last legislative session. What's the status? You've issued the summary, but there's something more coming in the fall.
Yeah, so it was sort of a two-phased approach. The first phase was focused primarily or exclusively on just trying to quantify the harms caused by excessive alcohol consumption in Oregon, building off of other similar state level and national studies that had been completed in the past. And we sort of updated that data and came up with some, I think for people that are new to the field, fairly eye-popping numbers in terms of the harms. Phase two that we started to get into with our slides, but is just a look at specific tax options and how those might affect sort of the revenue picture in Oregon as well as consumption. And that work is still in progress. And Joel may want to speak to the timeline for that work.
I think when we last talked with OHA, we were looking at, I think, a September timeframe to have the final report done.
And your big number, the 4.8, that matches Dr. Naimi's number pretty closely.
What was the 4.8, Jason? I missed that.
That's for the cost of excessive drinking here in Oregon.
Okay. And it was 4.8 what? Billion, okay.
On an annual basis.
Oh, interesting. Did you guys calculate that on a per standard drink basis by any chance?
We can back our way into that number, but we started from a ground up calculation looking at prevalence rates, et cetera, and then unit cost to get up to the 4.8 million.
Well, that's always an interesting thing to do because it helps people understand it better. I don't know what you guys think, but most people have absolutely no idea what the alcohol taxes are in their state because I don't know specifically for Oregon, but well, I live in Canada now, but I'm from Massachusetts. Like, for example, beer is taxed on this like charming unit of measure called a barrel of beer, which I can't even remember myself what it is. But if you look at the taxes in Massachusetts and it says, oh, this is X dollars per barrel, and you're like, huh, okay. And then you translate that into a per drink basis. In Massachusetts, the tax on a 12-ounce beer is less than a penny, 0.9 cents. So I think this is a good thing for, and I love like weaving this in talks because people are just shocked. The median state beer tax across the whole US is 3 cents per 12-ounce beer. So that's the excise tax, the volume-based tax. So it's not just, so maybe that would be something you guys could consider doing because you can calculate, you have the access to the amount of ethanol, can convert that into standard drinks. But anyways, I think it's an interesting communications tool. And most people, when they hear what the taxes are in their state, are pretty interested by that.
Yeah, that's right. And we do intend to go a little further into that with the second phase of our work. But yeah, Oregon, I think, is a little bit below Massachusetts in that the tax is, what, 0.6, 0.7 cents per standard beer. Wine tax a little higher. Both of those taxes are relatively low compared to other states. And it's a liquor control state, so there's no real comparable spirits tax. But the implied tax, the cut that the state takes, is actually on the high end. So we have a sort of a divergence where we have very high implied spirits taxes and relatively low beer and wine taxes, and both out of alignment in terms of the sort of the marginal social cost of those drinks.
Yeah.
Is there a state that's doing this right? That has lifted these taxes to match?
We did a study where we basically calculated not only the excise tax, and again, that's the fixed amount per unit of volume, which erodes constantly with inflation. But a lot of states apply the sales tax to alcohol, and then some have other alcohol-specific taxes. But we modeled this for all of them. We don't find that any state, if you compare the cost per standard drink in a state for all types of alcoholic beverages, and you compare that to the CDC cost estimate per drink, we don't find any state that collects more than 40% of the cost back. So essentially, now that doesn't include the states that are where there's a state monopoly, because the implied tax isn't quite the same as a tax, and it's a bit complicated. But I mean, the bottom line is that most states are selling alcohol at a subsidy to tax. They're basically subsidizing the sale of alcohol. I mean, taxpayers are paying more in alcohol-related costs than they're receiving in relief from their income or property taxes, is another way to look at it. So one might question whether that's a good use of public revenue, if you want to think about it that way.
Joel and Andrew, do you have an idea about what the cost of a drink would be if it absorbed that full 4.8 billion?
I think I did calculate those numbers. I think we were looking at low twos per drink for a beer, and then high twos for a glass of wine. And that's on a per drink basis.
Yeah. I think nationally CDC estimated it, and that there are data available by state. It's dated compared to what Andrew and Joel are doing, but it comes out to about a little over $2 per drink across all the beverage types. And then, of course, not all of that money. So about 40% of that figure is paid by state and local governments in the form of various like legal costs and those sorts of things. So it's not, some of those costs are borne by the drinker, him or herself. So even if when I said that I think it was 40%, that's only of the portion of the costs that are kind of paid by government or by the taxpayer.
So that's politically, that's a pretty high bar, but that's not inconceivable.
Well, yeah, I mean, politically it might be inconceivable. The point is, though, that most states are selling alcohol at a massive loss to consumers. And so even, kind of any sort of raising of the taxes, even if it's not, I wouldn't expect politically it could come close to those levels, but that would take a tobacco type situation. But the point is that most people, even from who are kind of libertarian leaning politically, would take interest and so raising taxes or possibly minimum prices, which something we should talk about if we have time, but can go away towards kind of reducing the public subsidy for drinking that occurs in states.
Well, that's a question that has come up in our chat. What do you think about minimum pricing? Is that implementable?
Well, Oregon just passed the first minimum pricing real minimum pricing policy in the United States. Did you know that?
I haven't caught up on
Okay.
recent session
Well,
yet,
it's
but tell us.
a very low minimum. I'm not actually, so I'm based in Canada for the past year. I'm the director of the Canadian Institute for Substance Use Research. But my colleague, Tim Stockwell, actually testified. And I think this is just for spirits because it's done through the monopoly, but they've essentially put a floor on the price at which they will sell spirits. And I can't remember, it's a very low amount per standard drink. It's somewhere around a little over 50 cents, if I'm not mistaken. But anyways, minimum pricing is something that's it's actually quite common now in Canadian provinces, and it's been adopted in Scotland, and I think will be in Ireland. The idea here is that, you know, the cheap alcohol tends to be the most overconsumed alcohol. It's the alcohol often that's consumed by people who are drinking heavily or younger people because they tend to have less money. So anyways, cheap alcohol causes a disproportionate share of harms, not because the ethanol is different, but because people who are planning to drink a lot will cost substitute and get the cheapest stuff they can. So basically the idea behind minimum pricing is that it puts a floor or like a lower limit on how much you can sell alcohol for on a per drink basis. So the idea there is, I mean, in Europe, industries tend to like it more, right? Because for one thing, the premium brands tend not to be selling the very cheapest stuff. So they're happy not to kind of compete with the kind of the race to the bottom brands. And the other thing is that it doesn't raise the price on most of the products like a tax increase would. So, and then the other thing is that you actually generate more revenue. So this is an example of something where you can actually raise more revenue and improve public health. That revenue can actually be either kind of sent back to the government, or the alcohol companies themselves can keep the difference, right? So in other words, if you mark up the cheapest stuff to a little bit higher level, that creates additional revenue. So there'll be a little bit less consumption. I think, you know, Andrew and Joel they're probably much better economists than I am. I'm barely an epidemiologist. So, but anyways, the idea is that you can generate more revenue, and then you can actually have some of it go back. So I think it's a really interesting concept, and it is actually being used by your northern neighbors in a number of provinces, and increasingly in Europe. And I think it's kind of has a lot to recommend it.
Joel, Andrew?
Yeah, no, I think that's exactly right. And we make a little bit of this case in our report, but you know, minimum unit pricing, it's relatively new, relatively, you know, less implemented compared to certainly excise taxes, sales taxes, et cetera. But one of the things very clear from the economics literature is that on the one hand, yes, people are sensitive to price when it comes to alcohol, but one of the ways they demonstrate that is not necessarily first and foremost just giving up alcohol, but really substituting, you know, when prices go up, substituting less expensive, potentially lower quality products from the consumer's perspective for those higher priced products. And so simply imposing, say, a sales tax or an increase in the excise tax has some effect on consumption, but it's perhaps not as big as we might like. And the effect, sort of assumed effect of this minimum unit pricing is to sort of put a floor, as Dr. Naimi mentioned, on prices, and it prevents some of that substitution away from more expensive to less expensive products, because the least expensive products have become more expensive.
Joel, any comment?
No, nothing beyond what Andrew said.
Okay. So another question from the chat. I think this is for Dr. Naimi. Could you comment on the relation, and this is from Mary here in Washington State. Could you comment on the relation between early childhood trauma and later problems with alcohol and drugs?
Yeah, I mean, there's an important relationship. I'm not an expert on it, but I think that early childhood trauma is one of the vulnerabilities that can predispose people to drinking too much. or developing problems. So I think so I think on a broader level, that's sort of the most I feel comfortable saying. I don't know the specific statistics on how much increase the risk is. But I would kind of, in terms of coming back to alcohol policies, the whole purpose of alcohol policies is to prevent people who are vulnerable from getting into trouble, right? So, and one of the things, so that would include groups that have known, higher risk of developing problems. And then it also includes they wind up with a problem. So I think it's a really important thing. And there's a lot of work where I worked before at CDC on the adverse childhood experiences study, for example, looking at in rates of substance use. And the issue is how we prevent those adverse childhood experiences. So that, again, is a broader conversation, but it's an important one. But like how we sort of build a better environment overall, not just for alcohol, but for kids growing up or things like that.
Thanks. For Joel and Andrew, is there a way to take the tools that you developed for your survey and use those on other states, or is this just Oregon specific, what you've done?
Well, I will say, so it wasn't a survey so much as, a compilation of external data sources and applying findings from the research to the Oregon-specific data. And I think, as Dr. Naimi alluded to in a couple of times, this work, it wasn't particularly novel in the sense that the CDC has been coming up with state-level estimates of the costs of excessive alcohol consumption for some time. The most recent were a few years old, so our charge with the OHA report, the Oregon Health Authority report, was to update to the extent possible those data and bring to bear, potentially better data, because the CDC is sort of taking a national look, and it's not a bad thing. They do great work, but it's sort of a cookie cutter approach state by state. And our specific study was able to update some data sources, refine some estimates based on local conditions to come up with that $4+ billion number on an annual basis. But the answer is yes, it's absolutely applicable to other states. It's just, there's a little bit of groundwork to do to understand the local context, figure out what data sources might be more readily available at the state level from state agencies, and the CDC would have the ability to access with their more national study.
And will you be able to do this this work in future years, so we'll have a comparison of change?
Yeah, well, and Joel, I hope you can correct me before I go off the rails here, but I think one of the ultimate goals the Oregon Health Authority is interested in having some information that's updated on a more regular basis. And so the ability to do that is, of course, contingent on updates in the data sources and so on. And then, of course, improving the estimates based on new findings as the research, as the literature develops.
Joel?
I think that's right. Ultimately, the goal is to use the state level estimate for OHA to help build their sort of internal policy package. But I think, future estimates are, again, contingent on the availability of the data and the desire to sort of keep some of that updated. There are ways that agencies have been updating these numbers, adjusting for CPI, et cetera, and whether or not the OHA wants somebody to go back in and update all the unit costs, I think is a question for them.
Mm-hmm. Good. A question for Dr. Naimi. You mentioned FASD, and that turns out to be a new diagnosis for. Is that new? Some of our
I think not in medical circles, no, but it's I think a lot of people are used to just hearing about FAS, which refers to a full-blown clinical spectrum that involves not only neurological problems, but a certain constellation of physical findings and these sorts of things. But I think what we've known for a couple of decades and is that the vast majority of people who have head damage from alcohol do not have full-blown FAS. But a lot of, particularly they'll be lacking some of the extreme physical, manifestations of FAS, but they will have things like learning disabilities or cognitive difficulties, and particularly things in the neurological sphere. And I think this is important to understand because, for FAS, there's a way for a lot of people to kind of sort of relegate that to the subset of the very heaviest drinkers during pregnancy. But I think there needs to be a wider appreciation of the impact of, for example, drinking to the point of impairment or intoxication during pregnancy and early in pregnancy. And I think when you look at the percentage of, for example, in Oregon, of women of childbearing age who may, binge drink several times a month, doesn't make them alcoholics by any means. In fact, makes them pretty common. But when you also then factor in the idea that the median time to pregnancy recognition often is 5 weeks, and that may be longer among people who tend to drink a bit, then a lot of times people can might cause harm to a developing fetus very early in the pregnancy without knowing about it. So anyways, the concept behind FASD, it's not a concept. The idea is that there's a spectrum of things that go into the effects of alcohol on a developing fetus.
And is it possible to map the societal costs of something like FASD?
Well, I think CDC has done it, but I'm not really, I'm not too familiar with it. And I think there are other estimates from around the world of people that. Yeah,
that's right. And I mean, like any area of investigation, there's uncertainties and so on in the research, but we do have in our report some, we break out the cost of fetal alcohol syndrome, both for medical care and special education related to fetal alcohol syndrome, which is a relatively large component of the total, the non-trivial cost. So I think there are a lot of uncertainties, but it is possible to quantify those costs, and we did build that into our number as well.
And you point that any increase in excise tax should go toward treatment. Is that the case?
Well, I think treatment, education, other efforts at prevention. It's not just treatment for substance use disorders. There's sort of, I think, a much broader spectrum. But I think,
but not pouring it back into the general fund and just doing whatever, filling whatever hole is around.
Yeah, exactly. From the perspective of sort of an optimal tax policy, taxing alcohol, you can sort of raise. I don't want to get too far into the weeds or the wonkiness of this, but you can raise taxes to sort of get the price people are paying for alcohol better in line with the total cost, not just the retail cost, but the costs alcohol imposes on society. And once you do that, it's sort of a logical step to allocate those resources to mitigating the costs. So yes.
Great.
I have one comment. Can I add one comment, Jason?
Oh, please.
Which is that there's a whole kind of political question around earmarking, right? So if you're if your interest is in passing a bill, let's say to raise taxes or whatever it is, in some cases earmarking it for something specific like treatment can be effective. It may not end up being as desirable to policymakers, however, who might be trying to address a budget shortfall. So I think it very much depends on it very much depends on the political situation in the ground for people who are either trying to pass the tax increase or trying to lower taxes or block a tax increase, right? So it really depends. If you can say, listen, we're going to use this tax increase to fund it so that everyone with a in Oregon with a certain grade point average can attend college for free or something, that might be attractive also. So I think I understand the idea of earmarking for treatment because it's kind of like the idea of killing two birds with one stone, but it also kind of circumscribes the use of money. So I think these are often political considerations end up going into this as well.
So one of the core values of the disability movement and growing more and more in the mental health and the addiction movement is this idea of policy design, nothing about us without us. That the people with the lived experience have to be at the policy table. In your research, and for all three of you, research and your data collection, how has that voice been represented?
Well, I'll take a stab at that. One of the important alcohol-related outcomes that people look at is alcohol use disorder or dependence in the old parlance. I think there's been this really striking complete disconnect, quite frankly, between the people who have addiction and policy. So I think this is a big gap that needs to be overcome. So I would almost turn the question around, which is, how do we engage the treatment community or people who are in need of treatment? How do we get them to be stronger advocates for policy change? Maybe that's provocative, but at some level, I see this as a major obstacle with alcohol. But again, all those people who are like drinking heavily on the weekends or from young ages, these are the people who are destined to, let's say, or are tremendous risk of developing an alcohol use disorder. We need to start intervening before somebody meets or has the good fortune to run into somebody who's going to give them a diagnosable medical condition, where we know that there's so many more people that are running around at high risk of problems that have either yet to meet criteria for an alcohol use disorder or have yet to be formally diagnosed with one. So that's where I really think we need to up the game between policy advocacy and treatment advocacy, because I think they're all part of the same idea.
Andrew and Joel?
Yeah, well, so I think because most of what we did relied on existing research and then sort of bringing the data together and so on, our work suffers from the same flaws that historically research has generally, in that we're all getting better, many fields are getting better, but there are voices that have not been heard, not been made sort of prominent enough in the research. So to the extent that those lead to biases and problems with the findings, our numbers are result from that. But I think, as Dr. Naimi was suggesting, what's important is making sure that those voices are at the table. And I don't have a specific example, but in terms of policy design, if we're looking at this, a more comprehensive approach to alcohol control, not just taxes or not just increasing funding for treatment, it's important to have those, the disability community, the treatment community, et cetera, at the table to think about the implications of the policy for practical purposes, as well as hypothetical improvements in outcomes.
That's great. I mean, you've rung the bell, and now it's up to others to come and make use of that. So thank you. It is very difficult to get the treatment community to be involved in advocacy. We're seeing a little bit more of that now here in Oregon, but it has traditionally been, the feeling has been that if we raise our voices, we might get even less of a seat at the table, and there might be some retaliation. So that's changing now that the treatment industry is becoming more professionalized and better represented.
Right. Well, also people with lived experience. I would just add one other thing is, like, if you look in, the reason why this is so important is that the people who are in need of treatment or the treatment community, sometimes they're actually, as much as they are sometimes marginalized, they're actually one of the more vocal groups, whereas you see very few community groups if you compare like alcohol to tobacco. Their Mothers Against Drunk Driving still exists, but they tend to shy away from big ticket policy interventions, and it's increasingly over the past 1 or 2 decades really narrowed down to the very kind of driving specific policies. So if you look at tobacco, there'll be a range of kind of community organizations that again are interested in the prevention side. So I think one of the reasons why it's difficult is that people who are in need of, like, there's very little policy advocacy in terms of community organizations in the United States, or either national or at the state level, or there's a relative less. So I think this is a really critical area to focus on in the future. And yeah.
And that fits right into your second tier, Dr. Naimi, this group of people who might have trouble with drinking but are not alcohol dependent at this point. And do you foresee that there's some future for, I just haven't seen it. Churches don't talk about this. Community groups don't talk about this.
Yeah.
It's really absent from our public health dialogue.
Yeah, the way that I look at it, or the way that other people in public health look at it, is that kind of drinking to get drunk is the fundamental building block of alcohol-related problems. So, what I would call binge drinking, or drinking to the point of impairment, that's a strong risk factor for, beating up your loved one, for neglecting your kids, for developing cancer, an alcohol-related cancer, or for that matter, for developing an alcohol use disorder. So, and I think if we think about like drinking too much, or drinking to the point of impairment, or binge drinking as the fundamental building block of all alcohol-related problems, and then you think, wow, raising taxes, making alcohol a bit less available, and sort of curbing marketing, these are the most effective strategies to reduce drinking to that fundamental building block. So so that's how it all fits together in my mind.
Great. Joel and Andrew, any response to that comment by Dr. Naimi?
Yeah, and I think this brings up another related issue. You mentioned communities, churches, et cetera. I think it's in terms of voices at the table, it's also important to bring vulnerable populations. I'm thinking BIPOC, people of color, communities of color. One of the interesting, I think to some people, not disconnects, but counterintuitive things you see in the data is that some communities, some non-white communities, have alcohol consumption levels that are on average lower than the sort of more affluent white populations, but the drinking behavior for people that do drink is on average more risky. So from that perspective, approaches to mitigating some of the harms maybe need to be tailored a little bit differently in culturally specific ways, depending on which population we're looking at. And in addition, as we point out in our report, the experiences of, say, healthcare, criminal justice, et cetera, are obviously very different depending on your race and ethnicity. And the BIPOC communities tend to experience worse outcomes across these systems, when something related to alcohol comes up. And so there are disparities there that policy needs to address as well.
One of the most striking charts in your presentation, Andrew, was the chart which expressed that just an enormous amount of effect in the American Indian, Native American population. Talk a little bit more about the collection of data and how to think about that.
Yeah, and I'm going to turn it to Joel. He put that chart together. So
great, thank you, Joel.
Yeah, so that was focused on mortality by race ethnicity. So it was, I believe, it was an age-adjusted rate from Oregon death certificate. So that's not our data. That comes from the state of Oregon and OHA. I mean, I think the one thing that I would say is that for the AI-AN population, we certainly see a very large number, which is consistent, I think, with what we see in other areas of the literature. But we also need to be careful because I think there are classification issues around death certificates about who is AI-AN. So we know that it's a problem, but we need to sort of be mindful of some of the underlying data issues there.
And when we look through the lens of the majority population, we lose track of the dramatically different effect that this substance has on Indigenous people. And out here in the West, we see it, every day. It's just a terrible, terrible thing that we've done.
Yeah, I think that's exactly right. And certainly should be, yet another call for, we need to get better with our data collection and really understand, we don't want data that always has to come with the asterisk that it's caveated that there are these classification problems. Ultimately, that should be a charge to improve data collection to the point where you can say confidently this massive disparity is real.
Great. Dr. Naimi, any comment on Indigenous peoples and alcohol?
Yeah, I think there's a couple of points. One is that most Indigenous people, the percent of them who drink is actually lower than whites, but the percent who drink more is higher. That I think that with respect to, and I wouldn't want to blanket, but with respect to alcohol and indigeneity, there's a relationship of if you use it, there's high rates of problems. I think one of the important things to remember, though, is that the issue is that even greater than that is the disproportion in terms of victimization. So in other words, if we talk about the secondhand effects of alcohol, so suffering harms from somebody else's drinking, again, Indigenous people are one of those groups that tends to suffer disproportionately from other people's drinking, not just other Indigenous people, but in general. In general, poorer people who are not necessarily more likely to drink than more affluent people, but for whatever they do drink, they're at higher risk of suffering alcohol-related harms. Maybe their health insurance isn't as good. They don't have, quite the same social safeguards built in that other people do. So I think this all goes to the idea that alcohol consumption is basically driven by largely white colonialists. And we've set up a system that's very beneficial for commercial entities that sell alcohol. And that comes at the expense of vulnerable groups, whether it's people who've had childhood trauma or other things. So the question is, as a society, is that alcohol consumption and the sale of it is legal, but do we want to kind of invest in the kind of policy safeguards and treatment resources and other resources to minimize harms to vulnerable people? And some of them, as I mentioned before, will be easy to tell that they might be more vulnerable based on personal history or there's some other factors, but a lot of people it's not. The question is, how do we balance the sale of a commercial product with the health and well-being of our citizens? And that really gets back to people who are vulnerable for whatever reason that might be. So far it seems like we're willing to tolerate pretty high levels of mayhem and death, not just in vulnerable people, but in the general population. And there doesn't seem to be a lot of momentum these days in terms of policymakers who are willing to kind of buck the economic interests and try to put in more of these safeguards.
So last words, guys. This has been a real pessimistic panel. Any words of optimism? Any signs of light?
Well, I'll take a stab. I didn't mean to. I actually, sorry, Jason. I listen. I think it's really exciting. There's actually, because alcohol is a legal substance, there's lots that we can do to intervene and to reduce harms. And we've seen tremendous progress in areas like impaired driving, because states have really taken an active interest for a variety of reasons. That issue is kind of glommed on, and we've seen tremendous progress. And we kind of know what works for reducing this fundamental building block of problems. So I think there's lots of reason for optimism, at least in terms of tools that are available.
Yeah, so economics is the dismal science. So I should probably stop right there. But I think, sort of stepping a little bit beyond the realm of alcohol policy, I think particularly within Oregon, but across the country, steps towards decriminalization, harm reduction of not just marijuana in Oregon. Psilocybin mushrooms have been, next year you'll be able to go get therapy from a licensed therapist. Treating these substances that people seek out and use and always have and probably always will, but treating it from a public health, a more coherent public health perspective in terms of harm reduction. That seeing that I don't know if we'd call it a sea change. Maybe Dr. Naimi could say yes or no, but I think that movement is positive and does speak well towards some societal shifts that might lead towards more coherent approaches to some of these really large problems.
We'll be hearing in this afternoon from some of those persons battling at the state legislative levels here in Oregon, up in Alaska, and out in Minnesota. So we'll be hearing some firsthand reports from the battle zone.
That's great. And I know there's a lot of activity going on in Oregon, and Oregon also has a first class, one of the, if not the preeminent state public health agency. So I'm optimistic. Sorry, despite all the negativity. Or
that's fine. Oregon Health Authority is a great sponsor of this conference, and we're glad to have their support. So thanks, guys. Thank you very much for your presentations and for participating in this panel. And good luck with your future work.
Thanks for having me.
Yes, thank you. Glad to be here.
What is Connect Oregon? Connect Oregon is an online network that enables healthcare and social service providers to coordinate with each other to better serve communities in Oregon and Southwest Washington. Kaiser Permanente, Oregon Health Leadership Council, Care Oregon, Pacific Source, Health Share of Oregon, and others have partnered with Unite Us, a technology company that provides the platform for the network. Health is more than what happens in the doctor's office. It's physical, mental, and social health, including making sure people's basic needs are met, like food, housing, employment, transportation, and more. The network helps track which services are being provided and by whom. Let's look at some examples to see how it works. During a doctor's appointment, the doctor learns that Mr. Cruz is struggling to pay his rent. The doctor asks Lily, a patient navigator, to help Mr. Cruz. Lily uses the Unite Us platform to find a local resource for rental assistance. Lily asks Mr. Cruz for his consent to send a referral to the local resource. After Mr. Cruz gives consent, Lily makes a referral to network partner Northwest Pilot Project, adding a few notes in the platform about Mr. Cruz's situation. Through the platform, Northwest Pilot Project is notified and accepts the referral, then contacts Mr. Cruz. The platform notifies Lily that Mr. Cruz's referral was accepted and that he's getting the help he needs. Let's look at an example where community organizations can collaborate to better serve their shared clients. Northwest Pilot Project is working with Mrs. Jones on a housing issue when Sam, the case manager, learns that Mrs. Jones is struggling to get enough nutritious food. Sam uses the Unite Us platform to search for a network partner offering food resources. Sam finds that Meals on Wheels People provides home-delivered meals in Mrs. Jones' neighborhood, so Sam makes a referral to Meals on Wheels People. Meals on Wheels People receives the referral and is able to get meal delivery for Mrs. Jones within a few days. What happens when a resource is not available or a network partner is at capacity? Network partners can update their profile at any time to indicate available resources and can reject a referral. This informs the organization sending the original referral that the need is not yet met and to keep looking for resources. Referral status is tracked by the platform to help users understand the demand and available supply of resources in real time. It's also possible to send referrals to multiple organizations for the same client. This is called a batch referral. Once the referral is accepted by one organization, the remaining referrals are withdrawn. Referrals and all data tracked through the network can help inform advocacy for policy solutions to improve health equity over time. Our vision is a comprehensive network that connects healthcare and community organizations to provide support and services to people throughout Oregon and Southwest Washington. The more organizations join the network, the more useful it becomes for everyone. Your expertise and partnership are needed. Join Connect Oregon today.
Providence Behavioral Health on managing anxiety.
These are really unusual times, so it's really natural for people to be feeling more stress and anxiety. While our body's response to stress is actually adaptive and healthy, when activated for prolonged periods of time, what we start to see is negative consequences. The positive thing is that by being able to manage our stress, we are able to heal and recover and return to baseline.
If you're feeling overwhelmed with anxiety, stay connected to your social supports. These are difficult times, and you are not alone. Please do not hesitate to reach out to your primary care physician who can put you in contact with a behavioral health provider. We are here to support you during this time.
In times like these, it's an opportunity to come together, strengthen as a community, and come out better on the other end.
If you need support for your emotional and mental wellness, find behavioral health resources at providenceoregon.org/behavioral health.
Thank you for the opportunity to join you today, albeit still virtually. I'm grateful to be part of this important conversation about mental illness, alcoholism, and addiction, and how to best support individuals in recovery. Substance use disorder and addiction were on the rise before the pandemic. Nearly every family in our country has been touched by this unrelenting illness, including my own. Much of the policy focus over the past several years has been on opiates, but our discussion and our action needs to be broader. I've spoken with families across the district I represent in Northwest Oregon who have been devastated by the loss of children and parents who couldn't secure the treatment they needed to save their lives. The last year and a half has compounded these difficulties as we have been tested on our ability to respond to multiple emergent public health and economic crises. As we've dealt with the pandemic, its economic fallout, unprecedented wildfires, and reckoning with our country's systemic racism, it's been increasingly important to hold the line on the progress that we made before March of 2020 and simultaneously take immediate, bold action to save lives. It's important to note that addiction doesn't just tear apart families, it has a significant effect on our economy. For too many, going back to normal after the pandemic isn't a realistic option. Millions of people are still trying to regain a lost job or endeavoring to find a new one that pays a living wage. Parents, especially mothers, are struggling to find affordable childcare. Safe housing continues to be out of reach for too many, even full-time workers. These stressors, on top of the isolation we have been forced to endure, have pushed people to their breaking points. And as you know, 40% of the $4.8 billion cost to industry and commerce in Oregon from alcohol is in the form of absenteeism and lost productivity. 40%. I talk with employers who desperately want reliable employees, and I talk with employees who desperately want to be productive and earn a good salary and provide for their families. We can be doing so much to make this not just a hope, but a reality for our workforce by fully funding treatment and prevention services and by making sure they're available to everyone in our communities. That's why the work you're doing and conferences like this are so important, to refocus and refine approaches that we know work and to explore new ideas that allow us to see solutions with fresh eyes. And talking about these issues in an open and transparent manner makes a difference in our communities. When I held a series of roundtable conversations about substance use disorders a few years ago, one of the most common concerns was overcoming the stigma of addiction and normalizing treatment and support. There's been so much suffering and damage in our communities in the past year, much of which I'm afraid we still don't know about. It will take years to fully understand the effects of addiction and alcoholism on people's lives during the pandemic, which is why it's more important than ever to immediately increase access to affordable treatment and prevention services. Access to healthcare and financial support through the Affordable Care Act and emergency relief legislation have maintained an important safety net for people who lost jobs or got sick. And I'm proud to have fought for such game-changing investments to send out a lifeline during the pandemic. But we know it's not enough. Congress must strengthen mental health parity protections, including covering treatment for substance use disorders, and continue to push for universal health care for all. I know that substance use is a complex problem, and addressing it requires all of us working together at every level of government. I appreciate your efforts to serve your clients and to draw attention to the bigger systemic problems we must fix. Thank you again for the opportunity to say a few words and to welcome you to today's panel. I'm grateful for your continued commitment to these important issues, and I look forward to our work together to achieve stronger, healthier communities.
Hello, I'm United States Labor Secretary Marty Walsh, and I'm pleased to welcome you to the 2021 Law and Mental Health Conference. I want to thank you for your commitment to helping people with mental illness and substance use disorder. This issue is personal for me. I struggled with alcoholism as a young man. until I got the treatment and entered recovery. That made all the difference in my life. It's the reason I'm able to serve our country today in President Biden's cabinet. And it's why I've always made mental health policy a priority. As a state legislator, I work closely with providers to secure funding and facilities. As mayor of Boston, I launched the nation's first municipal office of recovery services. And now as labor secretary, I'm fighting to get working people access to treatment and support that they're entitled to. The Department of Labor is the primary regulator for private sector employee-based health insurance. I take that responsibility seriously. From day one, I've made it clear that mental health is a priority. We've created a task force on the Mental Health Parity and Addiction Equity Act. With more dedicated staff and resources, we're identifying violations and working to increase compliance. We're going to be reporting our findings to Congress, and we're coordinating with agencies across the federal government. State and local government have had an important role to play, along with the healthcare providers and legal advocates. And on many issues, you have been leading the charge. There's no doubt that untreated substance use disorders impose a heavy cost on individuals, families, workplaces, and governments. So we have to work to strengthen every point of the continuum of care: prevention, harm reduction, access to treatment, and support for people in recovery. And if we're going to be successful, we all need to be talking and working together. The pandemic has been a tough time for many people with mental health or substance use issues. The stress has increased, and so did the isolation. And I want to thank everyone who worked hard to reach people in need with telehealth and other resources. Now, coming out of the pandemic, we can and we must do more. This is a moment that challenges us, and it's also a moment for great hope and opportunity. More Americans than ever are talking about their mental health. They understand the struggles that others go through. And there's a wide agreement across society that people who are ill deserve treatment, not punishment. This is a culture shift that we've been working over many years. Let's seize this opportunity to make it complete. Let's work together to build a future of compassion, strength, and hope for all. Thank you.
Hello and greetings from Michigan. My name is Mike Tobias. I'm coordinator for the Michigan Coalition to Reduce Underage Drinking, and I appreciate the opportunity to speak to all of you today for about 30 minutes. Just if you've never been to Michigan, we have a great state, and I encourage you to come out and visit us. I've never been to Oregon, but with any luck, I'll get there, maybe go salmon fishing, but I hear it's a great state too. But the Michigan Coalition to Reduce Underage Drinking was established in 1996, and this was in response to the Robert Wood Johnson grants that were being given out. And although Michigan didn't get a grant, all the partners came together and formed the group, and then now here we are 25 years later. So I've been with the organization in some capacity for over 20 years. And the last 11 years, I've been the coordinator for the Michigan Coalition to Reduce Underage Drinking. Here's just a brief overview of some of the things we'll be talking about today. And this slide just talks about some of the things that kind of guide the work that we do in Michigan. And so I'm sure some of you are, probably a lot of you are familiar with these resources. But these are hyperlinked. If you're not familiar, you can click on those links and get more information about them. But the next few slides will talk a little bit more about the community guide. So I'm not going to read this to you, but you can take a look at it. And there's a summary of the community guide recommendations that we always give to any policymaker that I meet with. I'm usually given a summary of these community guides to give them an idea of how we operate. And then inevitably they usually ask, well, so what do you do? Do you do presentations for schools? And I said, no, not really. Try to explain to them, again, why we're meeting, talk about these policy issues. The guide has 21 different topics last time, and the two that I focus on the most are the excessive alcohol consumption and motor vehicle injury. But some of you may do other work in other areas, so it's a really good resource for folks to be aware of, and really encourage you to check it out. So here are some of the recommendations from the community guide. About these are the things that they've kind of looked at that really reduce excessive alcohol consumption. You'll see there's 4 items there that they have strong evidence to support these strategies and policies and things. And then there's sufficient evidence on the other 3. Here's a kind of the rankings of the prevalence and intensity of binge drinking among U.S. adults. And you'll see that I've got a handful of states in there. As far as prevalence of binge drinking, you see North Dakota's ranks number 1, and Tennessee is number 50, and then you see Alaska, Michigan, and Oregon in between there. And the reason I chose Alaska and Oregon is I'll be on a live panel with the folks from Alaska and Oregon on July 19th, so we hope that you join us for that. And then you can see the intensity of binge drinking. Again, looks like Arkansas is 1, and then you've got Alaska, Michigan, and Oregon, and then you've got Washington and Washington, D.C. tied for 50. To give you, and I just put the highest and lowest in there to give you some perspective of where the other states ranks. So again, 24.9% down to 10.9% on binge drinking prevalence. But then the intensity of drinks, Arkansas at 8.3, and then the other groups there at 6.2. So a little bit about Michigan consumption trends. This is per capita in gallons, and this is going from the time range of 2010 until 2019 for those 10 years. And so you can see that beer is declining probably. It's the only one that's declining is beer, and then wine, spirits, and mixed spirit drinks is increasing. So now here are some of the current issues that we're dealing with in Michigan, and most of these have been ongoing issues for a little while, I guess with the exception of the last 2. But extending alcohol sales to 4 a.m. Right now, current closing time in Michigan is 2 a.m. We hope that it stays that way. But there's been many efforts the last 6 or 7, probably 12 to 14 years, 6 or 7 straight legislative sessions to expand the sales to 4 a.m. There's been many different versions of the bills over the years. The most current version is probably in some ways one of the worst. I think it's a $250 permit, but there's no other kinds of special. In the past, there's been security requirements and a higher fee, and some of that money going to law enforcement in the community. But this is a little bit more wide open. It's local opt-in, so local governmental units would have to approve it. But of course, if some local government does and others don't, we feel it'll kind of create like some magnets, and people from the region will just kind of flock to those places, and therefore you might actually see more increased drinking and driving. They framed the issue in the context of COVID because the on-premise licenses have been struggling so much that they want to, as a way to get more people in the doors because we have longer time to do that. We've been at reduced capacities for a while. We might be at full capacity now, but that's kind of the way they frame the issue. But another big challenge they have is finding workers also. So I really think you're going to have trouble finding workers that are going to want to stay until 4:30, 5 a.m. now. But this passed in about March, passed the House 61 to 47. And so the vote, there's some success there. The vote was much closer than what the vote was in December. In December, the vote was 77 to 27 in the House, and then it kind of stalled out or they ran out of time, and so the Senate wasn't able to take it up. But the sponsor reintroduced that bill in February of this year, and they kind of fast-tracked it, passed the House in mid-March or so. But again, it's kind of stalled out on the Senate side. It's in the Senate Regulatory Reform Committee meeting. So we're not exactly sure why, but we're just glad to see that it's kind of slowed down a little bit. We have another set of bills that are going to keep our BAC level at 0.08. Michigan, I believe, is the only state in the country that has a sunset on their 0.08 BAC level. So if the legislature doesn't take any action, it'll revert back to 0.10. Obviously, we don't want to see that. I'm sure somebody recall that the National Traffic Safety Board made some recommendations back in 2012 or 13 that all states should lower their BACs to 0.08. Utah was the first state in the country to do that a couple of years ago. I believe New York has a pending bill right now. This bill was introduced last legislative session, but it didn't go anywhere. But the sponsor who is sponsoring bills to keep the BAC at 0.08, his strategy is let's pass the bills that will keep it at 0.08, and after that goes through, then I believe he's going to introduce another bill that would lower it to 0.05. And so we know it's going to be a tough lift, but we think it's important that he keeps doing this, get more awareness out there, and we'll see. The next item is again reintroduced. The sponsor that wants to lower the seller's age of alcohol from 18 to 17. They did have a hearing on it at the House Regulatory Reform Committee meeting recently, and it appeared there's a lot of support for it at the committee level, but they haven't brought it back to report it out of committee yet. But again, that's something we're watching and concerned about. From looking at alcohol policy information systems, I believe the majority of states are 18 or older to sell alcohol. And of course, this is probably something I believe Oregon has a thriving craft industry, and we do too in Michigan. There's been a lot of increase in craft breweries, distilleries, and wineries. According to the Michigan Brewers Guild, Michigan has over 300 breweries, and Michigan ranks 5th in breweries, microbreweries, and brew pubs. And then the number of craft distilleries throughout Michigan is growing at a rapid pace. That's from the website from the Michigan Craft Distillers Association. We have a lot of wineries as well. Then, of course, there's been a lot of legislation designed to help the bars and restaurants during the pandemic. And so those are just two examples of some of the things they've done. But they've passed, bills to help the on-premise folks. The last two in July, just before the 4th last year, the legislature was scrambling to pass these social drinking districts and these cocktails to go and expanding delivery a little bit in Michigan. So of course we didn't want to see that, but like most places, I believe, most states, I believe, have these, or it seems like they do, because I see a lot of articles of these social districts. So we have that now, and there was a bill that was just introduced and kind of fast-tracked that would make these permanent. They were sunsetted for December 31st of 2024, December 31st of 2025. And seeing those long sunsets, we felt pretty confident they're going to probably try to make these permanent, but we didn't necessarily anticipate that they were going to make them permanent so quickly. It was introduced and assigned to the Senate Regulatory Reform Committee meeting, but I believe it was discharged. Like I never saw it on the agenda for the Senate Regulatory Reform. Then the next thing I know, the Senate voted on it, passed to the House voted on it. So, I don't believe it's law yet, but it's really fast-tracked, made its way to the legislature, I believe. And again, we never saw it on the agenda, so we're, kind of disappointed to see that. I'm sure they didn't do anything against the rules, but so I don't know. I guess I have to look into why it was discharged from committee or when they decided to do that. But it just seems like it was not very transparent, the process. We have some, we've been dealing with what we call non-traditional liquor licenses in Michigan. It seems like, and this has probably been going on for, 10 years, quite a while, but it just seems like it just keeps going. But we're seeing a lot of new, different kinds of places that want to get into selling alcohol. And so we're seeing more of these, what we call non-traditional places. Probably hair salons would go on there too, but more fast food restaurants, painting with a twist, dog parks, dollar stores, coffee shops, even a Bed Bath & Beyond. Some of those stores have had some, off-premise sales. And then zoos and ice cream shops. We've had some zoos. We have zoos right now currently that are licensed. I'm not sure how many, but I don't believe there's too many zoos that are licensed. But in the last couple of months, a zoo outside of within Battle Creek, I believe, applied for a liquor license, and the Liquor Control Commission, in their wisdom, denied it, and we were pleased to see that. And then also, the zoo did come back on appeal, and then the Liquor Control Commission did grant them some liquor licenses, but there was more regulation on those places. And so the zoo just wanted to be able to people to buy drinks and just kind of walk around the zoo with their drinks. They wanted like a roaming cart that would sell drinks, like at a like a baseball game or somebody's selling you beer, going up and down the aisles. They wanted somebody to push a cart throughout the zoo selling alcohol. Well, the commission granted the liquor licenses to the restaurants, but I believe stipulated that they have to stay at the restaurant site and cannot circulate throughout the zoo. So that was kind of a partial victory. And the commissioners spoke about hearing from the prevention community about our concerns. And some of our concerns were we just think that, there needs to be some alcohol-free places. If children, all they see is places where people are drinking, what message does that send? We see zoos as a place that's more family-friendly and kid-friendly. And again, as a person in long-term recovery, I think it's important to have some alcohol-free places. Not necessarily that I'm going to be tempted to drink, but I can't say that other people who are struggling with addiction won't be tempted to drink, or in early recovery, that sort of thing. So they did hear our concerns, and they, initially denied the liquor license, but ended up giving them a liquor license. But I'll just say that the Liquor Control Commission, this commission right now, is much better balanced, looking at our public health issues than I'd say previous commissions. And so we're very, glad that we have Chairman Gagliardi kind of leading the effort there. We also have a liaison. One of the administrative commissioners is now a liaison to our organization, Geraldine Lasher. So we're very happy to have her as a liaison. So we probably have the best relationship we have with the Liquor Control Commission right now. In the 15, 20 years I've been kind of following them. The ice cream shop issue, we've had 2 ice cream shops in the last couple of months come before the commission for asking for a liquor license, and the commission denied both of them. At least the first place denied for sure. Have not seen that come back on appeal. The second place, which was just about 2 weeks ago, I believe they denied it, or if they didn't deny it, they held it because they had a lot of concerns. So we're glad to see the commission kind of vetting these issues carefully. These next couple slides talk about our McCRUD advocacy plan, and they're busy slides, but hopefully you can see them okay on your screen. But this is our current MLCC advocacy plan, so working with the Michigan Liquor Control Commission. By statute, the Liquor Control Commission has to have these semi-annual hearings. And so it's typically in March, so one was on March 18th, and then one is coming up on Wednesday, September 22nd. And so our goal was to try to identify 12 people, to kind of individuals or organizations to be represented there and to give public comments. And so we got a lot of people there at the commission meeting, and it's been easier to participate in these things because it's remote now due to COVID. They just went back to face-to-face meetings, but they are keeping the remote option, which we are very glad, because it's difficult for some people to travel to where these are. But anyhow, we had 12, our goal is 12, and we had about 25 folks that attended the March hearing. And I think about 7 gave public comment. So we didn't quite get the public comment goal, but we had a lot of people attend it. And I'm hoping that those people who attended the first time will feel more comfortable giving comment in September. So over here under kind of column 2, each Tuesdays and Thursdays at 10:30, the Liquor Control Commission has these administrative licensing meetings, and they typically approve or deny liquor licenses. And so I'll try to monitor those best I can. These are where I've discovered those issues about the zoo, about the ice cream shops, Total Wine. They had a special hearing about Total Wine coming into Michigan. People had a lot of concerns about that. But it's at these meetings where I hear about some of these things. And these administrative licensing meetings, they always have a public comment time at the end of the meeting. And so whenever if the commissioners raise an issue that they're concerned about, looking at some of the public health and safety issues that we're concerned about, like they might say, I'm a little concerned about giving liquor licenses out to an ice cream shop. I always jump on for public comment to try to reinforce that and say, yes, since Mike Tobias, McCRUD coordinator, I'm concerned about giving out liquor licenses to ice cream shops as well. Thank you for weighing this issue carefully and so forth, but try to reinforce what they're saying. But anyways, Tuesdays and Thursdays, you can see we have a handful of people, Kathy and Paige and Barry and Paige, who are going to help monitor these meetings because I can't always make them, and kind of report back. And then the appeals hearings, this is when there's been a denial of a liquor license or somebody's upset with the violation they received. They can appeal it, but these are on Tuesdays and Thursdays at 1 p.m. And again, you can see the folks that help monitor those meetings. There's no public comment for these issues, but it really, I believe, listening to these hearings gives you a better understanding of the rules and regulations. And also, I think you get a sense of the current commission's commitment to public health and safety, because they do vet these issues carefully. They do want to make sure that somebody has a good plan in place if they're going to rescind a decision about a revocation or suspension or something like that. And then 4 is just kind of like, again, from those administrative licensing meetings, that's where we're going to probably find a lot of different issues that are going to pop up, because they also give a lot of updates at the administrative licensing meetings. And so again, there might be opportunities for us to advocate for something that comes up with the Liquor Control Commission. Like I said, this next slide is a little bit busier. This deals with more of the legislature. And so on the left-hand side, you can see this is our plan. And I'll say this is the first year we've actually tried to put something down in writing for the most part. We've had, well, I guess we've had other things right, but this is just kind of a different format that we're going to. And again, we're trying to create opportunities for community coalition leaders to participate in the process. And so we offer a lot of things. But anyhow, a bill's introduced. We would like to, identify an advocate in the sponsor's district and have that advocate contact the sponsor to get more information about the bill, what it's about, why it was introduced. Make sure they understand it, because it's not always clear to me when I read a bill what they're actually trying to do. So oftentimes I'll contact the sponsor of the office and try to find out exactly what they're doing. And then the advocate hopefully reports back via email, or we have a monthly alcohol policy issue meeting. And so they can report back at that meeting to discuss whatever bill it is. We're going to monitor it, determine next steps. Then we try to identify people that can lobby, take positions, testify, those sorts of things. So we have a handful of people there. And there's more than this the name that comes on there. But we identified these people through a short survey, Google Forms survey. And I really need to send out that Google Forms survey to our broader contact list to see if we can identify more people to help participate in this process. These next, right here is the House Regulatory Reform Committee meeting, and right here is the Senate Regulatory Reform Committee meeting. And both of these meet on Tuesdays. Typically the House meets about 10 or 10:30, kind of changes here and there, and the Senate usually meets about 3 p.m. And you can see the chairmans of these and the committee members. And then in red, you see those are the names of some advocates in those districts, or that serve those districts. And so we're encouraging these folks, these community coalition leaders primarily, to talk with their senators and representatives about all these issues that we just talked about before, about alcohol taxes, BAC, the concerns about going to 4 a.m., concerns with social districts and cocktails to go and expanding delivery and some of those things. But we have an Excel file, and we have 110 House districts and 38 Senate districts, and we're trying to identify advocates in all those districts. And we probably know of people in those districts, but it's trying to get them to get involved in the process and understand that it's important to meet with their lawmakers on a regular basis to talk about these things, because we just don't have much standing really in the legislature. I think they just kind of see me or a few of us as just kind of people that, are always speaking out against something that they want to do. So we just need broader people and more people to talk with their lawmakers about these issues. So again, that's what we're kind of doing on the right-hand side, identify people to contact lawmakers on a regular basis regarding these issues, and then some people might make some good messengers or people that would be willing to contact their lawmakers would be coalition coordinators, chairs. I think there are 12 sectors. If you have a chief of police who's very involved or a pastor that's very involved, then, maybe they would make a better messenger than you. But again, you can see the folks in red, people in recovery, telling their stories could be very helpful. But again, we're just encouraging people to meet with their lawmakers, build that relationship. It's not a one and done kind of a thing. We want it throughout the 2 years, talking with them about these issues. So some different challenges of doing policy work that I'm guessing some of you can probably relate to as well. But this, people are always worried about getting in trouble, crossing over the line to lobbying and that sort of thing. And yes, I believe they should be concerned a little bit about it, but I think we worry way too much about getting in trouble and crossing over the line. So I don't know how to get around that. We've had numerous, trainings on lobbying, difference between lobbying and advocacy and education. I mean, just numerous, I've probably had 100 hours of that topic, and I think it's always going to be a little gray. So we always encourage people to, whoever you report to, you should have that conversation with that person, because we've also had situations where a funder, we argued back and forth on whether or not what we were doing was lobbying or advocacy. And in the end, the funders kind of said, we don't care whether it's lobbying or advocacy. We don't want you doing this work. And so then we had to make a decision on, do we back away from this initiative or not? And in that situation, we had to. We felt it was in our best interest to back away since they were providing probably 95% of our funding. But again, we were convinced that it wasn't lobbying necessarily, but it didn't really matter. But this is always an issue. We're not very light. It's hard for us to be fluid and light and move quickly because we have a lot of different issues we're dealing with. And so they don't have to post legislative meetings very early in advance. So you don't know what's on the agenda until the last minute in some cases. So they only have to give 18 hours of notice. These meetings, like I said, are on Tuesday. So usually I'm kind of watching it on Monday. Sometimes I'll think if it's a really important issue I'm watching, I'll look on the weekend to try and see if it's there. But we just don't know when the bill's coming up on the agenda. Again, we don't have really good relationships with the chairs of these committees, so they're not too helpful for us. And then sometimes we have disagreements within our own organization about, again, best way to proceed. Is this letter to the editor crossover line to lobbying? Are you doing grassroots lobbying now? And so some of those issues come up and you have to resolve those. And it's hard enough to do this work, let alone to have to kind of go back and forth with your own organization, your coalition about what the best way to proceed is. Again, we're not very advanced in getting our message out, so we've been trying to find somebody that's better at social media to try and leverage that. But really just kind of sending out an email alert is kind of the most frequent way that we try to contact people and mobilize people. And that, and just actually picking up the phone and calling them if it's somebody that's an advocate in a committee member's district. I think nothing beats getting on the phone and calling these folks, say, hey, please contact your senator. This bill is before them right now at committee. We're trying to stop this right now. And usually if you take the time to call people, they'll do it. It just takes more time. And again, we're managing multiple things. Alcohol is very socially acceptable, so that's always an issue. There's always other, drugs that get a lot more attention, I'm sure you're aware of. This comment, I can't just live up there. I can't stay up there. This one of my colleagues just said that to me in the last couple of weeks about, some bills that were coming up on agenda again. He's like, he lives about a good hour away to Lansing. And he's not very tech savvy because you can actually right now, I believe you can still testify remotely. So it's been the last year and a half, it's been easier than ever to testify because you have that remote option as long as you're comfortable with the technology. But, his point's well taken. There's so many things coming at us all the time, from from something that Cassie Torrey did a presentation in Michigan, she said that, Michigan's one of those, we have a lot of legislation that goes through, I guess, relative to other states on alcohol. I can't remember how you measure that, but we do have a lot of things coming at us. Again, we're mostly playing defense. It's hard to play offense. It's hard to get bills introduced that you want to see happen when you're always trying to address kind of these bills out there that are going to expand access and availability. The fact that I have 4 different funders, I got 4 different kind of pots of money that I answer to. And so it's not all just, when I was hired in 2010, I was a MCRUD coordinator full time, and now it's pieced out into 4 different funders. I have different responsibilities, so that makes it very difficult for me to help coordinate and mobilize and do this work. Here are some tools and resources to engage community coalition meetings, our coalition leaders. Like I said, we have monthly alcohol policy issue meetings. Sometimes we have special meetings to talk about issues of concern like 4 a.m. sales, like a zoo game liquor license, those kind of things. I do a lot of one-to-one meetings with people about, trying to engage them, contact their lawmakers, or call them about specific or issues. We offer interactive dialogue calls on different topics. So those are the 3 topics we've had so far. Social host laws, Michigan's strategic plan to reduce underage drinking, social districts and cocktails to go. Michigan's fortunate we're one of a handful of states that has an alcohol epidemiologist, and they've created some different fact sheets that kind of correspond to some of the legislation. So we have, the hours of sales brief, blood alcohol concentration, alcohol license quota system, and taxes. And those are on our website. We've done a brief survey on taxes in the past, and we asked likely voters whether they support going to a 0.05 BAC. Unfortunately, the support for that was pretty low, about 32%. Taxes has always been a majority, 60% or so. Then we also did a MCRUD lawmakers survey, and we didn't have a lot of participation, but we got a lot of good information. And so youth contacted their state lawmakers and talked to them about taxes and BAC and closing time, some of those things. And through those conversations, we were able to identify lawmakers that support or oppose these things. Again, now we want those same youth and coalitions to go back to the lawmakers to have further conversations about, okay, I see that you support lowering the BAC to 0.05. Are you willing to be a co-sponsor or introduce legislation? So we feel really good about a lot of information was garnered from that survey. We plan to replicate it and do it again and get more people involved. Just a quick special thanks to Jason and Liv. They're somehow connected to the conference. Liv did a really great job on helping me prepare for the presentation and helping with deadlines. And Jason was the initial contact that kind of gave me an understanding of the conference, about what they're doing. So thanks to them. Mary Franks is our alcohol epidemiologist. She helped prepare some of those slides in the beginning on the state rankings and some of that information. And then MJ is an intern with Prevention Network and the Michigan Coalition to Reduce Underage Drinking, and he also helped assist pulling this information together. But thank you. There's my contact information. I hope you join us on July 19th for the live panel, and I guess I'll see you later. Bye-bye.
Hi there. Thank you all for joining me today. My name is Tiffany Hall. I'm zooming in from Anchorage, Alaska, and I want to acknowledge the Dena'ina people on whose unceded ancestral lands I am lucky and grateful to live, work, and raise my family. I'm the Executive Director of Recover Alaska, an organization working to reduce excessive alcohol use and harms across the state. We do this at the system level through advocacy and policy change, increasing access to care, leading a statewide alcohol misuse prevention alliance, and social norms change, reducing stigma and celebrating recovery. Today, I'll be talking about alcohol taxes, what we've learned, and the steps we took to pass an alcohol sales tax in Anchorage last year. I'm going to start with a couple fast facts about alcohol to ground us in the importance of reducing its negative impacts by any and all means necessary. Alcohol is the third leading preventable cause of death in the United States. An estimated 95,000 people die every year from alcohol-related causes. These deaths have been steadily increasing over the past 20 years, up from roughly 36,000 in 1999. Equity matters and disparities exist. Alaskans are dying from alcohol at a rate over twice as high as the national average. Alaska Native people are dying at a rate nearly 10 times higher. Suicide is the leading cause of death among Asian American adults, and problem drinking is rapidly on the rise in this population. But they are the least likely to receive treatment and are seen as a low-risk group due to the myth of the model minority. LGBTQIA folks are overrepresented in alcohol use disorders. Many people know alcohol is related to liver disease and fetal alcohol spectrum disorders. Many people do not know that alcohol is also related to heart disease, stroke, diabetes, mental health disorders, fertility issues, and is a carcinogen. The estimated association with breast cancer is an approximate 30 to 50% increase in risk from having 1 to 2 drinks a day. Drinking alcohol in moderation means 2 drinks or less in a day for men and 1 drink or less in a day for women. Drinking less is better for your health than drinking more. Anything you hear otherwise is likely funded by big alcohol. There are some adults who should not drink alcohol, such as people who are pregnant. There is no safe level of alcohol during pregnancy. Or me. I'm a person in long-term recovery from co-occurring alcohol use and anxiety disorders, and it's better for everyone, especially me, if I don't drink alcohol. Teens aged 12 to 20 drink 11% of the nation's alcohol. 65% of youth obtain alcohol from friends and family. The number one thing you can do as a parent or trusted adult to reduce underage drinking is talk to your child about alcohol. Not once, not twice, often. Make it part of regular conversation. Don't tell them they can't have it because you said so. Tell them young people can't drink because their brains are still developing until age 25, and alcohol and other substances can so easily rewire them. There is no evidence that allowing your children to drink in your home will make them less likely to binge drink at college. There is research showing that the younger a person starts drinking, the more likely they are to develop a disorder. Alcohol consumption has increased significantly during the pandemic. Nearly a third of households that drink alcohol increased their consumption due to stress from COVID-19. So, why an alcohol tax? In short, because they work. An alcohol tax does not ban alcohol. It simply collects revenue to recoup some of the costs to the public for alcohol misuse. Not only do alcohol taxes reduce drinking, but they also reduce some of the harms of drinking, such as the incidence of vehicle crashes, especially among young adults, sexually transmitted diseases, and alcohol-related mortality, such as liver cirrhosis. The alcohol tax is essentially a user fee. Those who do not drink pay nothing. Those who drink in moderation pay little. And those who drink to excess would pay the largest portion of the tax. This deters youth, who are price sensitive, from attempting to purchase alcohol. And it also deters heavy drinking, as it makes the price per drink slightly higher and promotes more moderate drinking. The evidence base has been established over 4 decades of nationwide research and is detailed in multiple reports, including empirical studies of United States alcohol tax increases. As a public health strategy, taxes are endorsed by all the leading authorities. What are alcohol taxes? There are 2 ways that government taxes alcohol: excise taxes and sales taxes. Excise taxes are levied on the amount of liquid, typically a per gallon tax. Rates can vary based on alcohol content. They are paid at wholesale by manufacturers and distributors, not retailers. They are typically vulnerable to inflation, and the value collected over time will decrease unless it is indexed for inflation, which is rare. So write it in if you push for an excise tax change. Sales taxes are levied on the value or the retail price and are paid by the customer at the point of sale. Sales taxes are not vulnerable to inflation. Some places have a general sales tax. Some include alcohol in this, or give alcohol a separate rate, or add an alcohol sales tax on top of the general sales tax at a local level. All of this is pretty locally dependent, so you'll have to look into what's true in your own state. In addition, there's a federal excise tax on alcohol, as well as possible state-level excise taxes on alcohol. Federal alcohol taxes haven't been raised in 30 years, despite being one of the best public health policies to reduce alcohol-related deaths. Like all excise taxes, they have lost significant value over time. Additionally, Congress recently made a temporary alcohol tax cut permanent in 2020. Just to show you what I mean about indexing for inflation, you can see these numbers from Alaska. We last increased our state excise tax in 2002 to 60 cents for a 6-pack of beer, depicted by the red line. We still collect just 60 cents, while the price of that 6-pack has increased over time. The blue bars indicate if that tax had been indexed for inflation. We would be collecting 82 cents on the 6-pack. The alcohol industry knows all of this. They know how much money they're saving. They know how much money the public is saving. They know that taxes will reduce excessive drinking, but they need excessive drinkers to make their cash. They're not getting rich off the people who are having 1 drink a night, maybe 4 drinks a week. They're getting rich off the people who are drinking 10 drinks a day. 30% of American adults 18 and up don't drink at all. Another 30% consume, on average, less than 1 drink per week. The top 10% of drinkers are consuming 75% of our nation's alcohol, nearly 74 drinks each week. Excessive alcohol use is often or only talked about as an individual choice and a personal moral failing. This stigmatizes the disease of addiction while also not beginning to address the systems of harm like poverty and lack of adequate housing and access to education, systems like white supremacy, patriarchy, and colonization. I'll save my thoughts on that for another presentation, but solutions to combating big alcohol must be grounded in the same firm beliefs as the fight for equity: fiery activism, relentless hope, and unyielding resistance. You have to act as if it were possible to radically transform the world, and you have to do it all the time. The work of being an advocate for public health against big alcohol is so daunting. They are incredibly powerful. They have legislators in their pockets and people drinking up whatever they're putting down. But the evidence is clear that an alcohol tax is one of the best things we can do to reduce death and disease related to alcohol. So in Anchorage, we got to work figuring out how to take on the alcohol industry and pass a tax. And my strongest tool ended up being data. We started polling in 2016. The governor of Alaska at the time included an increase to our state's excise tax in his preliminary budget, and we immediately did some sampling by region to see where we'd have partners if the tax got traction in the legislature. It didn't, and it did begin the semi-annual warnings I received from our state's largest alcohol industry that they would have $500,000 by the end of the week to fight us if we ever considered a tax. But we learned something critical. The majority of people polled were strongly in favor of increasing an alcohol tax if funding went to treatment and prevention. People were also somewhat or much more likely to support a candidate who favors the alcohol tax. We continued to do polling both statewide and locally in Anchorage for the next 5 years. We used 5 different pollsters to ensure we didn't have hidden biases and to ensure that we would have data a person would trust no matter where they stood politically. We kept getting the same results, that the majority of voters were in favor of an alcohol tax, and yet we kept losing. Creation of an alcohol tax in Anchorage failed 8 times at one step of the process or another, including a loss in 2019. The mayor of Anchorage at the time was in charge of that one. We had supported their team with everything we had, all of the data and information we'd been collecting, but we didn't own the political action account for the campaign, so our hands were kind of tied when it came time to run the campaign and get the thing to pass. And it failed 54 to 46% at the ballot box. After that vote, right after that vote, we did an after-action analysis of the campaigns, the yes and the no. The biggest difference was funding. True to its word, the alcohol industry quickly raised over $340,000 for their anti-campaign, including multiple donations from Big Alcohol in the lower 48. Meanwhile, the mayor's campaign fell flat and raised just $32,000, despite many of us looking for ways to contribute and participate. The mayor teed it up and then essentially just set his team up for failure by not championing it through the end. Right away after the vote, Recover Alaska gathered all of our partners and the potential partners, asking who was in, given how close we got with basically no campaign. Who would lend their time, strength, connections, energy, and asked if they wanted us to lead or someone else. We had over 30 partners in the room saying, yes, we want to do it. Yes, you should lead it. So we got to work. We did some polling directly after the vote. We broke down the data by voting district and cross-referenced it against other progressive initiatives and candidates to see where we had failed or where we could make up some ground. We were trying to understand what would keep the yes votes and what would sway just enough of the soft no votes. We asked things like if a sunset on the tax would change their minds, or mandatory evaluation reporting, or property tax relief, whether it mattered to them that alcohol taxes save lives. We asked where they get their news. Then we targeted the population that was on the fence. The population that told us in the polls they were in favor of a tax, but on voting day said no. The population that ended up being swayed by the industry's marketing campaign. We called on our friends. We called Vinnie DeMarco, Michael Sparks, David Jernigan, and Bruce Livingston. We asked for help, and I encourage you to ask for help. It is out there. All of those folks I mentioned were so willing to talk to some random person calling them from Alaska for help. But there is plenty of help and support out there, and people are so willing to lend their expertise and experience. We ended up loosely following the 6 steps for effective advocacy in Maryland, which is well documented and I highly recommend. We polled again, asking where people wanted the funding to go, and left no possibility off the table. A key piece to Recover Alaska running the campaign is that we didn't have a dog in the fight for revenue. We would fight tooth and nail for a tax, even if all the money went into a hole in the ground, because the tax itself is the public health win. This made us a compelling advocate and open to all partnerships. Did people want the money to go to schools, or for roads, for prevention, for flowers in town square? In Anchorage, people wanted the funding to go to prevention of child abuse, sexual assault, and domestic violence. Also high on the list among the population we were trying to sway were police, treatment, and homelessness. Remember, some folks were voting yes no matter what, some folks were voting no matter what. And we were trying to capture those folks who were on the fence who we could potentially sway. Then we needed to find our local champions. We had considered gathering signatures to get it on the ballot that way, but we learned that in Anchorage, if we did that, we couldn't dedicate the funds. And that was one of the most critical pieces of the campaign. So we needed strong assembly support in order to get the issue on the ballot just 1 year after it had failed. So again, I relied on my data. I told our champions exactly how we were going to win. I told them that their constituents want this. And I told them that if I don't have enough money raised by the night of the assembly vote, I would ask them to vote against it. That was my commitment and accountability to have $200,000 in the bank, with plans for more on the way. I have to say I included this photo because when I did a search for stock images, this one came up, and I think it kind of hilariously looks similar to our 3 assembly champions, as an aside. So I talked through our ideas about revenue with them, and I let them make the final decisions based on assembly priorities and to ensure that they felt empowered and bought in to really lead the initiative. Because of a line in Anchorage's charter that states that any new taxes would need 60% of the vote at the ballot box, we needed to include a charter amendment in our proposition language, which meant that we needed a supermajority of the assembly to pass it rather than a simple majority. So super assembly of the majority meant a simple majority of the people, and vice versa. I'm telling you this because I just want to highlight that there are a number of local specific rules and regulations that come with doing a local alcohol tax, but the juice is worth the squeeze. So just do your research and figure out these limitations up front. Parallel to ours, another organization was working on a general sales tax, and they had initially done a better job of outreach to the community and getting community councils on board. They had some money in the bank before we did, but they didn't have a sponsor on the assembly, and they didn't realize that the Budget Advisory Commission couldn't put things on the ballot. So their months of work were washed down the drain in one failed assembly vote. So for a local tax or state level for that matter, find your legislative champions first, or for an alternate route like signatures, or you're sunk before you really get started. We also made sure to look into things like which other cities or boroughs within Alaska were already taxing alcohol to preemptively negate the claims that people would stop drinking in Anchorage and drive over an hour away to another town, or that it would really negatively impact tourism. So once our assembly sponsors finalized our 3 buckets for funding, we then polled again, asking how people wanted us to talk about those issues, which words and framing we should use that would get us those swing voters. Who was the right messenger? Could we get a local celebrity? Would that matter? We also asked how effective the industry's campaign was. Which of their messages from the prior year had sway power? Which ones should we respond to and how? And which should we just let go of and stick to our own talking points? This also led us to a few other aspects we wrote into the proposition to give us the best chance of winning without negating the public health impacts of the tax. So we made clear it cannot be increased and dedication cannot change without a vote of the public. There will be mandatory annual reporting on what happens with the revenue. None of the new revenue can supplement current funding, so there would be no municipal shell games. And another assembly member had proposed and passed a detailed process for public participation to help determine exactly where the revenue would go if Prop 13 passed. These ended up being our key talking points at our many, many, many presentations. We hired a group to run our campaign, led by previous Senator Mark Begich for his fundraising connections and his ability to spin words. While my instinct is to combat falsities with facts, his experience said to stay on our statements and make statements that are truthful, whether or not they're really related to the question. So when they said, "We don't trust the government spending this money," we said, "We're changing the city charter. We're dedicating the revenue so they can't mess it up." The charter change was really about getting the simple majority, but this talking point kind of helped kill 2 birds with 1 stone. We garnered many partners across subject matter and sector, such as the Alaska Children's Trust, our primary partner, the Firefighters Union, Brown Jug, a local liquor store chain, as well as nurses and teachers, an Alaska Native Justice organization, and a faith-based community. We had a volunteer op-ed czar who is working with leaders from every viewpoint, drafting letters and getting them in the paper every other week. We used every connection we had to try to get us earned media alongside our paid campaign. We had a volunteer analyzing polling data every possible way that could be imagined, and other folks who were throwing fundraising and fundraising house parties. Anyone who wanted to give their time and energy and funding, we accepted and put them into the fight. Some partners were giving their own presentations and highlighting the aspects of Prop 13 that was important to their own mission in order to get their supporters on board, or they were setting up opportunities for me to present, right up until the week I was pregnant and due to have my daughter, who, by the way, was on the outside by voting day and stayed up all night with me to watch elections come in. This does bring up a good point about having a solid team. My daughter Margaret was born 3 weeks before voting day and 5 days before Anchorage went into hunker down due to the pandemic. So I was 100% out of the picture, and I didn't worry at all. This effort was so much bigger than me all along, and by then the champions were in place to see it across the finish line. I can never take all the credit for this alcohol tax, and it was only because of all of those other champions leading the way that we had the success that we did. We set up a separate account for all of our donations to go to. We would have loved to find a 501c4 partner, but none were willing or able to take up our cause. So we set up a separate account for that, and we needed a chair for the campaign whose name people would hear every time an ad ran saying they approved it. One of our toughest audience that had the potential to sway were elderly conservative voters in the faith community who didn't like taxes, but also didn't care much for alcohol and who distrust the government. So we found a spokesperson for that demographic, a conservative, elderly, white male doctor who was against the tax the year before, but changed his mind because of how we were dedicating the funds. A delightful man named George Rainier, who I'm very grateful to. We also chose our face of the campaign based on polling data and the aspect of safety and prevention. A mom with young kids. We were lucky to get Holly Brooks, who's also a local celebrity as an Olympic cross-country skier and a strong advocate for girls in sports. Just another thing important to note, polling, research, and education can all be funded free and clear by any funding source. We are allowed to run educational campaigns alongside lobbying campaigns and can use things like dollars from private foundations for this. We just need to study up on local needs around recording and reporting. And nonprofits are allowed to lobby. They are allowed to tell people how to vote. They're allowed to talk to legislators. It just has to be under certain dollar amounts, depending on the level of government, and has to be recorded and reported. But there is a lot of fear around that in the nonprofit industry, and it is really inhibiting. And I think one of the things that's holding us back as a sector. So I would encourage you all to meet with your local office and figure out what is true in your location, how to do the reporting, and how to teach your other fellow nonprofit folks how to do that as well, or whichever organization type or sector you're in. And some of these laws can vary locally, and ours aren't written down in a very clear way, meaning that we got different answers from the Alaska Public Offices Commission every time we called. And eventually we got pinged for lobbying in an educational ad on Facebook, and we had to pay a fine. That error made front page news, and multiple colleagues called me to say, welcome to the fight. You know, we don't know anyone who's run a campaign worth running who hasn't been fined. So just to say that it feels scary, but it's not the end of the world if it happens. And again, all of it is worth it. And then it was voting day. On April 7th, 2020, after 8 failed attempts in the past 25 years, Anchorage passed a 5% retail sales tax on alcohol. It took effect on February 1st, 2021, to avoid complications of figuring out how to start a new system at the bars on New Year's Eve at midnight. And it's currently on target to bring in at least $11 million. Likely more. Celebrate your wins. Even if you don't win, celebrate all that you learned so that you can try again. People's blood, sweat, and tears are worth recognizing, and treating people to baked goods or yoga class passes or whatever your remaining budget will allow is definitely worth it. The icing on the cake for us came afterward, getting to lead a coalition of nearly 200 stakeholders, intentionally inviting Indigenous and Black leaders and other leaders of color, the LGBTQIA+ community, and people with lived experience of homelessness, poverty, and addiction to establish a citywide theory of change for how to spend the revenue today for the biggest impact tomorrow. The tax will raise roughly $12 million annually, and revenue will go to a mobile crisis intervention team able to send mental health professionals to certain emergencies rather than the police. It will go to prevention of child abuse, sexual assault, and domestic violence. It will go to homelessness services and to treatment for substance use disorders. And it will go to a new position, a chief equity officer for Anchorage, to begin dismantling our systems of oppression. Some people might push back on that as falling outside of our three buckets, but a strong case can be made that race-based disparities impact every single issue in this theory of change. And if we don't start addressing them, we will never see the long-term impacts we're all working toward. Like many campaigns, to pass an alcohol tax, you have to change hearts and change minds. My biggest takeaways from the campaign were polling. Polling won us the election. It got us our assembly champions by proving their constituents wanted this. It got us funding from diverse sources. It earned us new partners. It perfected our messaging, and it got us the votes. Second, decide your must-haves up front and then let go of some control in order to build stronger and more equitable partnerships. And third, it has to be an all-hands-on-deck priority. You have to want it more than you want anything else throughout the entire campaign. You have to be relentless. I mentioned earlier the huge power of big alcohol and the drive it takes to stay focused. This work of being an advocate, especially for people who are unseen, who are generally relegated to windowless church basements and hide in anonymity, this work is heavy and filled with trauma and lonely. And it's so big. Alcohol is ever present and its harms are ubiquitous. It feels intractable. No one takes on big alcohol because it feels so incredibly impossible. But in 10th grade, I wrote a paper on Muhammad Ali, so I know impossible is nothing. He said, impossible is just a big word thrown around by small men who find it easier to live in the world they've been given than to explore the power they have to change it. Impossible is not a fact, it's an opinion. Impossible is not a declaration, it's a dare. Impossible is potential. Impossible is temporary. Impossible is nothing. Thank you so much for your attention today and your work year-round, and for any interest you might have in an alcohol tax. The more we can create them and raise them around the country, the better. Please feel free to reach out to me with any questions and follow Recover Alaska on social media to stay in the know about our upcoming events and initiatives. Take good care.
Good afternoon, everybody. I'm Mike Marshall. I'm the co-founder and executive director of Oregon Recovers, and I'm here to talk to you today about our efforts in the recent Oregon legislature to address Oregon's addiction crisis, address our alcohol crisis, and address really a taxation crisis. So by way of introduction, as I said, I'm the co-founder and executive director of Oregon Recovers. I bring over 30 years of experience in the nonprofit advocacy world and political campaigns. I was John Kitzhaber's campaign manager in his last re-election as governor of Oregon. I was involved in the marriage equality work for many years. More importantly, however, I'm 13 years clean and sober. I'm a person in long-term recovery, and probably one of my greatest accomplishments. And it's through that lens that I have been brought to this work. The last thing that's not on this slide is I'm also recently a board member of the U.S. Alcohol Policy Alliance, and that's really informed and helped in the work we're doing here in Oregon relative to what is going on across the country. My goal today is just to talk about what just happened here in Oregon. We are probably the tip of the spear in the country, I think, relative to taking on the alcohol industry around pricing as a mechanism for prevention. But also as a mechanism to fund addiction recovery services. So I'm going to talk to you about the facts that mattered and maybe reference some of the ones that seemed to have no impact whatsoever. Talk about our strategy going into this session, and then what actually happened. And then, as I like to say, losing forward. It's something we learned in the marriage equality movement for 20 years. We lost and lost until we won. And I just recently celebrated my 3rd wedding anniversary. So what I should say at the outset is that we lost pretty much every piece of legislation we moved forward, and the alcohol industry really pushed back the boundaries on, or pushed back the limits on access to alcohol in a really unprecedented way under the guise of COVID. and with the support and advocacy of a core set of legislators who I would say do not understand how much their advocacy at odds with their core set of values, because it was primarily Democrats and not Republicans, progressive Democrats at that. So we'll talk a little bit about that today as well. In order to sort of understand where we're coming from on this, Oregon Recovers is not an alcohol-related organization. Our mission is to build a new system of care. Oregon has a fractured and incomplete system, and hence we're not delivering the level of services we need to the folks that need them the most. And so we've spent 4 years since our launch in 2017 advocating to build a new continuum of care that recognizes addiction as a chronic condition. Alcohol is a key part of that, as we're going to talk about today. And the alcohol industry has been a key part of keeping Oregon from building the system of care that it needs to in an effort to increase their bottom line, as we'll talk about as well. Our theory of change was to build the political will within Oregon to address Oregon's addiction crisis, because addiction is so highly stigmatized, and because there's not been an organized constituency to address it. The alcohol industry has been able to have no opposition in their ongoing efforts to keep alcohol cheap and readily available, despite the fact that we are supposed to be a control state. We also are, the second part of our theory of change is to build a political will, but then also build consensus around a plan of action. No one is in charge of addressing Oregon's addiction crisis. And as a consequence, there's no plan of attack. But our theory of change from the very outset 4 years ago was to build the political will, to create a plan, and then address the fact that Oregon has the lowest beer tax in the country, the second lowest wine tax in the country, and that alcohol is the leading contributor to high addiction rates, as well as a whole host of other social problems that Oregon has struggled to address. We're a broad coalition of healthcare companies, treatment providers, recovery centers, but more importantly, of thousands of people in recovery, their friends and family, and then the people that work for the treatment providers and the healthcare companies have a real vested interest in seeing us end Oregon's addiction crisis. We've built quite a broad coalition of over 50 funding organizations and over 2,000 donors, and I'd say close to 5,000 or 6,000 people have participated in our policy roundtables and our events over the years. From the outset, we recognized that we needed to be storytelling, that we needed to bring to legislators, reporters, and the public the facts they needed to know in order to reform the system. And the facts are pretty basic. We have the third highest addiction rate in the country, according to SAMHSA, the federal government. We rank 47th in access to treatment, and previous years it's been 49th or 50th. What people don't recognize is that alcohol kills 6 people a day in Oregon compared to 1 to 2 drug overdoses. That's over 2,000 people a year. That's 7 times the worst year of the AIDS epidemic. And yet nobody has been talking about that fact. And what additionally we need to be cognizant of is that within that addiction rate, we have the third highest addiction rate, but we have the 5th highest level of people addicted just to alcohol in the country. That is significant. It's also a set of facts that prior to Oregon Recovers coming along and telling that story, most policymakers just were not cognizant of. Again, no one in charge at the state level, no one prioritizing solving this problem at the state level, either in the legislature or in the governor's office. This is the most alarming statistics. In the last 20 years, Oregon has moved heaven and earth to build its craft beer industry, its wine industry, now its alcohol industry and cannabis industry. And yet during that same period of time, we saw a dramatic increase, a 34% increase in alcohol-related fatalities. Imagine if any other product caused that level of death, and you can be sure that there'd be a much more robust response. It's the price of all of this that's really, really significant. And that really wasn't recognized either. And the work we did from the outset relative to making sure that the state had a plan of action was to work with the Alcohol and Drug Policy Commission to develop that strategic plan. And in that strategic plan, they laid out that in fact, untreated addiction is costing Oregon $6.7 billion annually. Less than 1% of that money is actually going into prevention. And it's important to recognize that pricing of alcohol is probably the most cost-effective or the most effective prevention measure that's available. And again, we have the lowest beer tax and second lowest wine tax in the country. As a consequence of our advocacy, I want to believe the Oregon Health Authority, prior to the February legislature, looked into this issue as well. And they had Echo Northwest, a very reputable bipartisan legislative or research organization, look at the economic cost of excessive alcohol use, binge drinking. And they came out right at the beginning of the legislative session with a study that was incredibly alarming in that excessive alcohol use. So I think for women, that's more than 3 drinks a day. For men, it's more than 4 drinks a day, perhaps 4 drinks in a certain period of time, which is pretty excessive for those of you who drink. But that the economic toll is $4.8 billion annually. And I should point out here that prior to this study, the alcohol industry claimed that they were a net $2 billion contributor to the Oregon economy. When Oregon Health Authority released this report in February at the start of the legislative session, all of their documentation, their correspondence jumped to say that they were a $12 billion $12 billion benefit to the economy without any substantive or even identified source for that information. I think what's really important is to look at this and see that over almost half of that is in lost worker productivity, but the other half is in real fixed costs in terms of the direct hit on our healthcare system, the direct hit on our criminal justice system, and the direct hit on our social services system. So this is really, really substantive, and yet not one committee held a hearing on this report during this past legislative session. And I think that's very telling about the culture within the legislature relative to this issue. Hold on here, sorry about that. Apologies, I'm having some trouble getting my, there we go. Did I skip anything? No, there we go. The other role that we have played, important role we have played, is helping policymakers, legislators, local city council members, county commissioners understand the correlation between Oregon's addiction crisis. Again, we have the 3rd highest untreated addiction rate in the country, and the correlation between our criminal justice system, our homeless problem, and our foster care system, all of which are potent and ongoing political battles in the state relative to figuring out what the solutions are relative to this. But absent actually addressing our addiction crisis, we're not going to have create meaningful change. And I just want to point out that we have the 3rd highest youth incarceration rate, and if you go out and visit McLaren Correctional Facility, where young men in the state are housed, they will tell you that 75% of them were drunk or high when they committed the crime they're incarcerated for. And 75% will tell you they come from intergenerational addiction. In other words, their parents, their grandparents were addicted. And more than 2/3 of Oregon's addiction rate is related to alcohol. Whereas meth and opioids are a problem, it always comes back to alcohol. We have the lowest beer and wine taxes in the country. I would say we really don't have beer and wine taxes. The beer tax has not changed since Ronald Reagan was president, not even adjusted for inflation. It's less than a penny a beer. It's like 0.7 cents a beer. Wine is even less, slightly more, but what's need to point out here is that even though it's 3 cents a glass, 75% of Oregon wineries don't produce enough wine because there's an exemption, produce enough wine to pay the excise tax because there's an exemption of any winery that produces less than 40,000 barrels a year doesn't have to pay it. And the first 40,000 barrels for those that produce more are tax-free. And spirits are owned and sold by the state, but we have some of the lowest baseline products on the bottom shelf alcohol in the country. We know that pricing as a form of prevention is hugely impactful. Maryland was the last place that actually was successful in raising, as statewide, raising the alcohol tax in a meaningful way. And as a consequence of moving it from 6 to 9%, you saw a 17% reduction in binge drinking, 26% reduction in underage drinking. I'm bringing all these facts forward because I think the facts really speak for themselves. You would think that as a consequence of this information, that here's clearly a solution that legislators would run towards trying to address that $4.8 billion hit annually on the Oregon economy and the fact that it's really disrupting Oregon families. And yet that was not the experience in this last session. Another argument relative to how the current tax system is harming Oregon is an argument that was made late in the legislative session, but that is against the backdrop of everything that's going on in this country. And that is that by taxing, virtually not taxing our beer and wine and alcohol industry, which are primarily white-owned businesses, but that the net effect of the absence of revenue to build a system of care disproportionately impacts people of color, then there is a strong argument to be made that the current tax structure, whether it was designed to or not, is about protecting the interests of white business owners at the expense of people of color in Oregon, and that's the very definition of systemic racism. So we came at this session after laying the groundwork with creating a strategic plan with the Alcohol and Drug Policy Commission, working for 4 years to try and educate policymakers and the public, but not anticipating COVID and the way it was going to limit the legislative session. We decided to come at this not just head on in terms of talking about pricing as a prevention measure and raising the price in order to reduce harmful consumption and move it into paying for a new system of care, that we needed to approach it from multiple perspectives. And so we introduced several bills. In addition, the primary bill we introduced was the Addiction Crisis Recovery Act. And that was designed to raise the retail price of alcohol 20% so that we could reduce harmful consumption, primarily within binge drinking and underage drinking categories of folks, reduce that by 10%, which would generate over $500 million in new revenue within the tax system that we could then direct towards implementing this new system of care that the state, that we have gotten the state over the last 4 years to design. But we also wanted to make sure that we were taking on the alcohol lobbyists, that we were creating multiple opportunities for legislators to be educated about alcohol. And so we had a bill introduced that would have created a task force to look at requiring that consumers be educated as they buy alcohol, that they're informed about the fact that it's a carcinogen, that it's toxic, and it's highly addictive. Currently, all alcohol is labels about pregnancy, but we wanted to expand that level of education to include the fact that it's a carcinogen and an addictive substance. We introduced a bill to reform the Oregon Liquor Control Commission. Currently, the 7 members pretty much represent exclusively the alcohol industry interests. We had a bill that would require the 2 of them have a public health background with a primary focus in behavioral health. And then lastly, we had a bill that would break up the monopoly that the 13 beer and wine distributors in the state have in an effort to pit the restaurant owners and the small breweries and wineries to pit them against the beer distributors and try and break their coalition. Was not successful in that, but I'll talk about that in a minute. From the outset, we we lost the messaging. A 20% increase in the retail price of alcohol was in an effort to reduce harmful consumption by 10%, was basically going to mean that a beer would go from being half a penny to 21 cents. But that's a 2,800% increase. And the other side had all kinds of money and all kinds of communications consultants. They were ready for us. And they had some real allies in the press who weren't very well informed about this issue. Portland Business Journal headline was, the best. It was clickbait online. The article never said that it would take the tax on a single beer from half a penny to 21 cents, which we know from polling is overwhelmingly popular. But legislators only heard that 2,800% number. And so we lost the messaging battle right from the outset. And as a consequence of that, we came up with a compromise very quickly, which we always knew we were going to have to compromise on the amount. But we decided to actually try and compromise on the process. And so to take it out of this COVID legislative session and instead require that there be a task force created by the legislature that included legislators, that included 5 representatives of the alcohol industry, and then all of the state agencies that are involved in the regulation of alcohol, as well as public health, as well as advocates like Oregon Recovers. And we kind of called their bluff because many of the alcohol industry folks were going to their legislators and saying, we know something has to be done. We know the price has to go up, but 2,800% increase is the wrong idea. Again, losing sight of the actual amount. But it, and there was some significant traction on that as well. But at the end of the day, we lost that, and I'll come back to that. The first bill that fell by the wayside was trying to break up the monopoly that the beer and wine distributors have. They have control over the breweries and wineries in a sense that they control the marketing of their product and the placement of their product in stores. And so if they don't do what the distributors want, the distributors will not market their product effectively. There was no interest in the beer and wine industry for taking on the distributors publicly. And so the sponsor of it said, without their support, we couldn't do it. The second bill that fell by the wayside was the one to actually educate consumers about the dangers of alcohol. You'd think that would be a no-brainer. However, the chair of the committee that was going through said, you guys are going to get your 2 commissioners on the OLCC. They'll do that education. You don't need this bill. So he killed that bill. And then he voted against the OLCC bill, but we still got it to the House floor. It had bipartisan support, but it also had bipartisan opposition on the floor. Many progressive Democrats with breweries and wineries in their districts voted against it. And then it made it to the Senate. No one opposed it. A bunch of organizations across the political spectrum supported it. Great public hearing on it via Zoom, unfortunately. And then one weekend, even though we had all the votes lined up, the sponsor of the bill got news that in fact it had been killed, that the beer and wine distributors had turned the arms of several key Democrats in the Senate, and it died just an anonymous death. And it again is a reflection of COVID, but also Oregon's 150-year-old system that allows decisions like that to be made in private. The legislative task force thing moved forward, got to Ways and Means, got recommended out of behavioral health, out of the Ways and Means subcommittee. It had the support of the speaker. We'd lined up support in the Senate, but the 2 co-chairs of Ways and Means, one of whom is a doctor, but who takes the most money from the alcohol industry, and the other who doesn't believe in any taxes and therefore did not want to let there be a conversation about taxes, and they killed the bill. Again, I want to stress that the person who killed the bill was the person who takes the most money from the alcohol industry. In 2020, a year before the session, the alcohol industry gave $700,000 to 59 Oregon legislators. And that was what we were up against in advance of this session. So needless to say, all 4 of these bills died different types of deaths, but and as a consequence of 40 years of unprecedented alcohol industry lobbying and largesse in the political system. Not only did they defeat those 4 bills, but it needs to be noted that they were successful in a dramatic expansion of access to alcohol. They made permanent cocktails to go, which is we had been able to defeat in the 2020 legislative session. They gave a tax break to local distilleries that takes money out of the general fund. While it's a small amount of money, the notion that we have the 5th highest alcohol use rate in the country and an addiction crisis, and we're giving tax breaks to distilleries tells you something about the cognizance of legislators of the real issues, the challenges that the state is truly facing. The legislature increased the size of personal wine shipments to people's homes, and now allows beer to be sold at any convenience store that has a beer, wine, liquor license, so that 7-Eleven on your corner can now sell kegs. We truly have abandoned the notion that Oregon is a control state. And literally we did, because the other bill that went through the legislature was to change the name of the Oregon Liquor Control Commission to the Oregon Liquor and Cannabis Commission. They dropped the word control. And I think that is really indicative of policymakers and the power of the OLCC, the current commissioners, the power of the alcohol industry, and the ignorance of policymakers that the OLCC is there to control the sale of alcohol, not to promote the sale of alcohol. And we saw during COVID that they bent over backwards to sell alcohol. We saw in this legislative session that they were very much aligned. The OLCC was very much aligned for the most part. There were some exceptions, but mostly aligned with the alcohol industry. So what do we learn in this session? Well, first off, that COVID really diminished our political power. I said at the outset, our theory of change was about developing the political will and the political power to really create systems change, which includes taking on the alcohol industry. Our power is based on putting people in the front rows of committee hearings, having them walk the halls during a legislative session in t-shirts, doing constituent meetings. And while we could do much of that via Zoom, the power of that was not felt by the legislators. And they, in fact, were making many decisions behind closed doors or behind closed tablets. And so whereas the established lobbyists for the alcohol industry, after 40 years of political largesse and personal relationships, they had way more power of the session than we did. We clearly did not allocate enough resources for communications and bringing on a strong communications team. We lost the message battle right in the very beginning. That could have been avoided. And so that's a mistake on our part. We need to secure the support of significant stakeholders like the CCOs and the insurance companies and the healthcare companies and the doctors, because they're the ones with a financial stake in seeing the impact of alcohol diminished on families, on people, and on businesses. And they chose not to get into the game. And I think that was in large part because the decisions were being made within their lobbyists and not with their chief financial officers and their CEOs who understand that alcohol is a huge cost driver in their systems. The most profound lesson is that we, with policymakers and reporters, we need to re-educate them as opposed to educate them. They do not understand that alcohol is a toxic, addictive carcinogen that costs the economy $4.8 billion annually. And that's because they have a favorite brew pub and they went to a great wedding at a winery and that's where they go on the weekends. All of these lovely perceptions of these manufacturers of this substance that even in moderation is harmful, but certainly in excessive amounts is causing huge damage. And we have a solution to that that's not going to impact their financial bottom line. But why would they want to raise their taxes if they can continue to pocket as much of their profit as possible? So we need to re-educate our legislators and not just educate them. And lastly, we need campaign finance reform. The fact that the other side gave out $700,000 before the session was clearly why they prevailed in this session. But not all is lost. And in fact, in these sort of David and Goliath efforts, you have to take the long game. My final slide is not moving forward, but we have educated some new legislators, and they're really pissed off at the way the alcohol lobbyists acted in this session. We have a whole set of journalists who are much better educated and won't write compelling headlines that are inaccurate because they think they reflect this really positive industry. We know their best arguments. They're thin. They don't have good, sound economic arguments relative to the economy of Oregon. And as we bring more facts and data forward, they seem to be seemingly incapable of responding to that, or actually agreeing that they're not paying their way in terms of the damage they're doing to the state. We have, as a consequence of this, a much stronger statewide coalition that understands how alcohol impacts the missions of those different organizations. And we've begun to be a part of a national coalition to address the alcohol industry's incredible march forward relative, under the guise of COVID, to push back access to alcohol, increase access to alcohol rather. And lastly, we did have a win in the legislature in that the sponsor of the legislation, Representative Sanchez, was able to get in the final budget bill a budget note that created a full-time staff person to look at a variety of tax policies, but including alcohol tax policies. And so that's a win in the sense that that work has not been done at the state level for most of the last 40 years. And so it's our responsibility to try and make that happen. That's what we were up against. It's just the beginning. It's not the end by any stretch of the imagination. We're stronger today than we were before. We've learned a lot. But alcohol has to be addressed at every state level. The harm it's causing to our kids, our families, our workplaces is just unprecedented. And we have to begin to, just as they did 40, 50 years ago to take on big tobacco, we have to begin to build a national effort that is state-based, that takes on big alcohol. My contact information is here. I would love to hear from anyone who's interested in being a part of this effort here in Oregon, or who has criticism of what we've tried, or of any of the arguments or facts that I've presented today. I'd love to hear from you. Looking forward to later being on a panel to answer any online questions that people have. So thanks everybody for listening.
Hey, folks, thanks for your attention and welcome to the afternoon session of day one of the Law and Mental Health Conference. I'm Jason Renaud, the program coordinator, and I'm joined today by the three session presenters you just saw, Tiffany Hall of Alaska, Mike Tobias, Michigan, and Mike Marshall here in Oregon. Thanks, folks. Great presentations. Man, I learned a lot.
Thanks, Jason. Great to be with you.
Yeah, glad to be here. Thank you.
So let's
I
jump
learned
right
a lot
in.
too.
Yeah, I think this can be a great conversation between the four of us. And you guys, you know each other. You're all part of the United States Alcohol Policy Alliance. You're working together with lots of other states. I just noticed Michael Mumford is on the line from Georgia within the conference. tell us, how is this growing? How are you cross-pollinating this kinds of information and learning from each other? Anyone want to take that?
I'd say one way, I guess, for learning this information, I know Tiffany is part of this, but one thing that's been helpful for me is just in the last year or so, a new group kind of emerged during COVID called the Alcohol Action Network. And the U.S. Alcohol Policy Alliance is involved with that effort as well, but they meet more or less bi-weekly, and they share a lot of information, what's going on across the country and different alcohol policy issues. And so that's been really helpful for me.
Is that available for just people to join?
Yes.
So if someone's interested in state policy development and state legislative action, that would be a good starting place.
Yeah, I think it would be.
Yeah, I think that would be a great starting place. And they give a lot of kind of tutorials or trainings on like what the subject is now, and then have people talk about it. That's definitely been a great resource this past year. I think that the pandemic has really opened up a ton of these virtual groups all talking about the same thing. I mean, I know Mike Marshall also has a monthly call, I think, of folks running recovery organizations where we talk about policy. I know I've gotten to also start sitting in on the NIAAA has maybe their quarterly sessions that I definitely never could fly out to DC for an hour conversation, but I can tune in online for an hour conversation. And I also have just found that everyone in this field seems to be very open to personal calls and emails. And if they can't help or don't know the answer, then they've always made a connection to somebody who does. I feel like the alcohol policy world is pretty small and also very willing. And so I would just encourage folks to look into, also reach out to U.S. Alcohol Policy Alliance. Like we have a lot of evidence and research, as well as a lot of these connections. So I would just encourage people to reach out. That's my best advice.
Having been on some of these campaigns years and years ago and experiencing their lonely demise, this is all new. And this idea that there might be help elsewhere is just, that's a fantastic development.
Yeah, Jason, if I can, I think that's really true. And I agree that COVID, well, it was hard probably for every organization lobbying at the legislative level because it shut down real communications and grassroots power in a meaningful way. It has allowed us to get connected. A year ago, I didn't know Tiffany and Mike, and yet we spent an awful lot of time together as part of the board of the U.S. Alcohol Policy Alliance. And then Tiffany and I are on these national calls with recovery organizations. And I think that's the progress I see being really made is that recovery organizations are starting to get into the space of alcohol policy. And it's not that they haven't wanted to be there before, but it's just such a formidable opposition. The alcohol industry has just shut down every conversation at every state for the last 15 years because we've been very isolated in our efforts to do it. And because of the opioid epidemic, the perception is that opioids are the problem or meth is the problem. And when alcohol has been, will be the problem at the core of our addiction crisis. So it's been terrific in that, you know, when we set out here in Oregon, we designed several pieces of legislation that I talked about, but we also convened a national advisory board of some of the best academics and practitioners like Tiffany. She's just been through this in Alaska, as we just all heard so eloquently, very successfully, but over a period of time. And so I've learned so much from her in the last year as we've tried to move this thing forward in Oregon. And that's only growing. I think if anyone from the alcohol industry is tuned in and watching, I'd urge you to start to compromise because I think a giant is wakening up. And you may have all the money, you may have all the financial capital, but we have all the moral capital. The facts, sadly, are on our side. They're not on the alcohol industry side. And if we just have to create a platform together to really make sure people understand that.
And you're all optimists. I mean, this is
Gotta be.
what's also really different is that, people like me tried to do this in the past and it just went sour.
Just want to. When I was watching Dr. Namey's presentation, I thought he is really optimistic, and I thought to myself, I'm going to remind myself to be really optimistic myself, because sometimes it's not always so positive, I guess. There's a lot of hard work, and again, in Michigan, we're playing defense a lot, and victories might not be as often as we like, or we have to kind of maybe even redefine what success is. But like I said, we're fighting a good fight in Michigan. And like Tiffany said in her presentation earlier too, I just want to say back to your first question, how do you stay up to date? And she said, I think you should call your friends or whatever. But like she said, the alcohol control field is very small, and so people are very willing to talk to you, researchers or whoever, or just advocates across the country. And just today, I was talking to somebody in Minnesota, getting ready to join them on a Minnesota Prevention Association meeting coming up later this week. We got started talking about place of last drink and how they're going to try and get a speaker to talk about that, which I've been very interested in. So hopefully I can join them for their October meeting if they get the speaker. But anyways, it's a small field. So talk to your friends, reach out to people.
One thing that's also new is that in the past we had relied on medical associations and church groups and coalitions of treatment providers. And this seems to be much more recovery centered. This seems to be a very different, coming from a very different place. Talk about that a little bit. How does the experience of recovery from alcohol or drugs change how you do advocacy?
If I can, number one, it gives us instant credibility, right? When I go and testify in front of the Oregon legislature and I sit down, I introduce myself as the executive director of Oregon Recovers. I then introduce myself as someone in long-term recovery for 13 years. And every single time, it doesn't matter how many times I've been in that hearing, some of the members will clap, which means all the lobbyists that are sitting in there waiting their turn to testify, shut up and listen. Why are the legislators clapping? And you have the floor. And while we, no issue is simple. I mean, the alcohol industry does contribute to the economy of Oregon. It just doesn't pay for what the harm it does. And we need to find that middle balanced place. And so there's some degree of authority on their side, but we bring, there's three commodities in the transaction of power: financial capital, political capital, and moral capital. And I think recovery-based organizations lead with moral capital, which is limitless, whereas financial capital and political capital are each finite. You spend your political capital, you have to rebuild it. You spend your financial capital, you might be able to go back and get it. You spend your moral capital, and it comes right back to you in that moment. So we just need to figure out how to leverage that more to build the political capital we need to make the legislators make the decisions that honestly they should be making.
Tiffany or Mike?
I think, one thing that I would add, I really like those three types of capital, Mike. I'm going to write it down. One thing that I would add is that for me, it really helps with my personal stamina and has also given me a lot of tools that I need to know how to get back up and keep fighting. And that might be true for folks who aren't in recovery. I don't know, that's not my story. But even though I don't necessarily call the same people who I used to call when I was really struggling with alcohol, I know how to call friends for help. And I know how to build support around me to take care of me as well as to help take care of the issue. And I know that hard things are doable because I did a really, really hard thing when I made the decision to stop drinking and continue to stay sober. So I think for me, that's a really big part of it. But I'll also say that Recover Alaska, before I was there, was getting involved in advocacy. And in fact, the Recover Alaska was started as a project of a private foundation. And one of the reasons they moved out of that foundation to make Recover Alaska an organization is because they wanted to do more advocacy and they couldn't really and stay true to the foundation's mission. They had to split that out and they decided it was time to have us be our own organization. That's when I was hired as executive director. And that decision was made without somebody who is in recovery in charge of the organization. So I think that they would have been in the fight regardless of whether the executive director was in recovery. Maybe that went into why they hired me, but certainly not all the applicants were in recovery. It wasn't a line item of, it wasn't mandatory for the job. And so I think part of it is also that all of the statistics were there, all of the data and research is there, like Mike was saying. And it's just getting enough people who are aware of those health impacts, the financial impacts in the room to say, okay, I guess it's time to really do something about this.
So could we get a understanding, what is the difference between lobbying and advocacy? Where do you draw the line there?
I think it depends on who you ask, but I mean, I think I mentioned this in our presentation. It's been really difficult to mobilize people because particularly the community coalition leaders are worried about crossing that line into lobbying and getting in trouble. But my understanding of it is you have to have lobbyable officials involved. So you're talking to a policymaker who's a decision maker, maybe pending legislation, and then kind of a call to action, those kind of components. But again, so I've heard people say you have to have all three of those components, which might be the case, but I always have a disclaimer for folks in Michigan. Always talk with whoever you report to, I guess, to make sure they have a good understanding of what you're going to say or do, because I don't want the people to get in trouble on their end. But I think it's my understanding it's got those three components of lobbyable officials, pending legislation, and a kind of a call to action. And there's grassroots lobbying too. And again, we had some disagreements in my own organization about a letter to the editor about whether or not it was, I don't know if they were really questioning whether it was lobbying or not. Maybe it just was getting too close to the line or they didn't like what was said in there. But we had some disagreements about what should go in the letter or the letter to the editor on those issues. But I always encourage people to talk to their supervisor about what's allowable. And if you're going to be certainly representing an organization, you better be clear that you have that authority to represent that organization.
Jason, from my perspective, advocacy is where, we want systems change in Oregon. We want to build a new system of care to address Oregon's addiction crisis. And so that's a long-term conversation of educating the public, educating legislators and policymakers, mayors and city council members. So it's moving a concept forward that talks about systems change. Within it, we have House Bill 3377, the Addiction Crisis Recovery Act, and we go to legislators and talk specifically to them about what's in House Bill 3377 and why they should vote yes on it. So lobbying is a part of advocacy, but advocacy in my mind is the larger effort to create an outcome that isn't limited to an incremental piece of legislation.
Tiffany, you talked about this a little bit in your presentation.
Yeah, and for me, it definitely is a learning experience. I was doing mostly state level advocacy and lobbying my first few years with Recover Alaska. And so then I, like what Mike Tobias said about those three factors, like what made it lobbying versus education, because I can spend as much time as I want educating lawmakers. Right. And then as soon as I tell them, please vote yes or please vote no, that's kind of where the switch is. And so I always have to be really careful tracking my time. And then I got to learn that it's different at the local level also. And this is, I think, where Mike was going with the grassroots lobbying. So when we were doing the educational campaign that kind of went alongside the alcohol tax, the Yes on Prop 13 campaign, that's where we got pinged. The alcohol industry kind of turned us in and said, we think this is lobbying. And, our lawyer didn't think it was, and the public offices was pretty vague about it while it was happening during the campaign. But then afterwards they said, okay, we think that this particular one went over the line. So then we had to pay fines for that particular ad, whereas the rest of our educational ones were still fine. So I feel like it is a kind of blurry line. I still don't know exactly for when we're telling the people, like the general masses, you know, like this is why an alcohol tax is really good for the community. This is these are the lives it will save. This is the money it will save. And when that counts as lobbying and when it doesn't, I think it really depends on who's working that day, unfortunately. But I would just recommend, like Liz said, just reach out again and again to whoever your controller is in your state to thread that needle.
Jason,
So let's, oh, go ahead, Mike.
Just wanted to say something that I didn't get to talk about in my presentation earlier, which is when thinking about your organizing strategy, it's important to think about this question in the context of not just what is actually legal, but what are people comfortable with? And one of the sort of reflections I've had for Oregon Recovers, as a recovery-based organization, we spent the last 4 years talking about the need for a system of care that includes prevention, a new paradigm around intervention that's not based in the criminal justice system, treatment on demand, and recovery support. But because we're all people in recovery, we never expanded on prevention, and we never became a leading voice in Oregon on prevention. And most certified preventionists, people that do alcohol prevention work for the county, a county in Oregon. And so they're not organized as in a political way relative to, or political is the wrong word, in a legislative way, right? They don't, because as county employees, they're not comfortable going to the state legislature and lobbying on something, even if they have an association. And plus prevention is so underfunded here, there's not many of them. So the long and the short of it is our response to that is we recognize we need more voices shoulder to shoulder with Oregon Recovers. And so we're working with the U.S. Alcohol Policy Alliance to create an Oregon Alcohol Policy Alliance that is made up of addiction doctors and other folks that are really authoritative voices on alcohol. And then we're also looking to a number of moms who've lost their children got involved in our efforts this time. And we want to build that group out because they have, as I referenced earlier, an amazing amount of moral capital, but they can also go forward and talk about prevention and what they needed in hindsight, what they would have liked to have done with their children when they were still young to better educate them about alcohol. And so while the certified preventionists maybe can inform that conversation, we need to find folks that will really raise that issue. Because when we came to our friends in the legislature and said, you know, we need a new system of care is what we've talked about for the last 3 years. All of a sudden now we're talking about increasing alcohol pricing in an effort to reduce harmful consumption. That was a new concept to them. Even though tobacco, they're very well informed about the parallels there. They just couldn't absorb it after having taken all this money from the breweries and the wineries and being such advocates for it. So Rome wasn't built in a day, but I think anyone watching who's thinking about this is think organizationally, think how you're organizing and make sure that you have multiple entities that can draw, can be shoulder to shoulder in this conversation. Because if it's just Oregon Recovers against the 400 breweries and the 800 wineries, and then the 13 beer and wine distributors that actually hold all the power, there's more of them, right? I can testify once, they can testify 1,100 times. So we have to figure out, we have to create an organizing strategy that recognizes the boundaries some people feel around this advocacy issue and help build up those entities.
So you mentioned tobacco, and the tobacco legal changes happened after a couple of decades of very strong national big frame messaging that no amount of nicotine was safe to use, and now we have from the CDC, Tiffany tells us that no amount of alcohol is safe to use. What are the messages that work? Mike, you talked about alcohol as a carcinogen. Is that a new message? Did you find that worked?
So what I found was people didn't believe it or didn't know it. And we know that over 50% of Americans don't know that alcohol is a carcinogen, that moderate consumption, and then it's one of the leading causes of breast cancer in women. But we actually had a House member who she was a chief co-sponsor of our bill. We didn't ask her to be, she just signed on when she heard about it because she just thought it's crazy that we have the lowest beer and wine tax. Nurse practitioner. She got so much grief from the breweries and the wineries that she withdrew her name off the bill, and then called the press and said she hadn't read it and it was the wrong approach. And she completely threw the other chief co-sponsor under the bus. And when I called her, and I understood that she's new and she was in tears, and like I'm empathetic to the pressure she was under, and I don't have the same sort of political pressure to bring to bear. I couldn't threaten her with an opposing, someone would run against her or anything like that, at least not in a way she would believe. But I said to her, a nurse practitioner, it's a toxic, addictive carcinogen, and because she was arguing that moderate consumption is good and that we had framed this as it's bad. And I said, no, actually it's not. It's a carcinogen. And she didn't believe me. And she's an active nurse practitioner who's worked for a treatment provider in the past, and a smart woman. I really like her, but just, and it goes to what I said in my presentation about the need to re-educate people versus educate people.
Tiffany, Mike, what are the messages that you're finding that really stick?
Well, I don't know that I'll get to that in a second, but to answer the first question kind of about, the toxicity of alcohol, not only do people not believe it, in part, I think because Big Alcohol is very good at doing their own research and getting it out there really widely that says it is good for your health. But what's more is that people don't really care. So we did a bunch of polling that said, if you knew that an alcohol tax would save lives, would you be in favor? And people didn't care. And if you knew that it reduced underage drinking, or if you knew that it was a carcinogen, and people just didn't care. And in a different poll we were doing around health marketing campaign, we asked a bunch of different questions about perceptions and beliefs around alcohol. And people did know that it was associated with liver disease and FASDs or birth defects. And then those are the top two, and then less about anxiety, depression, stroke, heart disease, fertility issues, cancer. But still, even in a room full of people who work on alcohol specifically or on related issues, suicide, violence, sexual assault, we held a conference and we asked them to rate the importance of different messages to put out. We did some around treatment works, recovery is possible, and then different kind of positive social norms around underage drinking, and that most youth don't drink alcohol before they're 21. And even in that room, the health impacts were the least prioritized messages. So I think part of this, for me, I've been trying to grapple with this the past couple of years, and I think part of it all goes back to this idea that alcohol use disorders are the fault of the individual, and that it is not a community problem, it's not a societal problem, that it is a personal problem. And if they get cancer, that's their own fault kind of deal. And I think part of that is because of how it's framed by Big Alcohol, and because of how ubiquitous it is everywhere. Alcohol is everywhere. It's in all of our movies, it's in all of our songs, it's in everything you see and do. And I think a lot of that, what works and what doesn't about messaging, is that people don't want to feel like it's our collective problem. They want to always be able to place the blame. And so that's something that we've tried to really keep in mind as we think about messaging and what might work.
In Michigan, messages around reducing underage drinking or drinking and driving, those kinds of things seem to get a little bit more attention, but they don't always policymakers don't make the connection though, or don't necessarily believe that, as an example, if you raise alcohol taxes, these things will go down. Well, it won't really go down, will it? I mean, and we don't have the specific data like in Michigan. We haven't done like an alcohol tax study to say how many lives could be saved. We just know in broad terms that, increase the price of alcohol through taxes is going to save lives, reduce injuries and deaths. We can't say, based on a report that somebody did, it'll be, 35 fewer deaths or something like that. But I don't think people believe it. But it's easier in general from the rally around drinking and driving measures, or around, reducing underage drinking, some of those things.
Jason, I'm so thankful that Tiffany's on here, because she's done the arc. She's gone from losing to winning. And so we really need to listen to what you have to say. But it reminded me of in the marriage equality effort back when I first got involved in 1999, we did polling, and we tested the ultimate winning argument, which is it's about love. And in 1999, the broad public perception was that being gay wasn't about an emotional connection. It was a sexual orientation, and rights and benefits was what got us closest to winning, but it never got us there. And over the arc of 10 years, because of Will and Grace and because of people coming out and because of grassroots advocacy, the love argument is the one that ultimately prevailed. You know, we lost 30 ballot measures statewide. And then finally in Minnesota, they started to talk about loving relationships and we won. And then Washington State, and then it just went, but it wouldn't have worked 10 years earlier. We got there to the loving, and I wish we had stuck with loving is what I guess what I'm saying is I wish we'd stuck with the one we knew to be true. And I think that sticking with the arguments about how it impacts kids' health and how it impacts women and how it impacts families, that may not be the winning message today, but I have to believe that facts matter, and that just with tobacco, the way people ultimately moved on tobacco, that we want to make sure we don't reject arguments that are the right arguments, but we haven't laid the groundwork yet for them to be heard.
Right. Well, again, we've got all the arguments, like has been said before, we've got all the arguments on our side. Just trying to get these policymakers to go against the industry, because again, we've got the data, we've got, it's going to save lives and reduce injuries and deaths. Just all these winning arguments. It's going to raise money, and our state could use some money. I'd make the argument, but still, it doesn't seem to. The only thing I can think of is the industry has such a stronghold on it in the state of Michigan. That's why our beer tax has been frozen for 50 plus years and counting, and not indexed to inflation. That's the only argument I can come up with, because I feel like we've got all the arguments on our side.
One other thing that I would just add on, sorry, Jason, something one of the mics said reminded me of this. In DC, a number of years ago, we were talking with someone about this and like, why aren't these messages working? Why don't people care? And it kind of goes back to what I was saying about kind of placing the onus on the individual. And they said, what's your secondhand smoke? A lot of the facts that came out about tobacco were helpful. The Surgeon General's report was very helpful, but it wasn't until like the secondhand smoke argument, and that it was hurting other people who were completely faultless, who were completely without blame and didn't have, like, who cares if smokers get cancer? Even though I obviously care, I think it's a societal issue, but it wasn't until they found that every time this hurts somebody else. And so I think one of the other questions we have to really think about is what's alcohol's secondhand smoke. And I think we've also heard a lot today from people about, we know how much alcohol impacts other diseases, other, violence, all these terrible consequences, but it's not definite every single time, all of these excuses. And so I think that's one of the challenges alcohol has, is to, find the real blameless victim, I guess.
Jason, the other thing I will say is that I think the equity argument needs is very compelling. It's just very under-researched, and there's really no one making it at the national level, at the local level. But this notion of this tax structure that benefits these local alcohol industry that are exclusively white owned, and as a consequence, we're not funding the system of care, the support that we need, that disproportionately impacts people of color. That is systemic racism. And I think there were a number of Oregon legislators who were very uncomfortable with us bringing that forward, and angry, downright angry, because it took them and their values and boxed them in a corner that they wouldn't allow themselves out of. And I am optimistic that, again, from the marriage equality movement, we would lose a ballot measure by 25 percentage points, and then polling 6 months, 9 months later would show support for marriage equality jumped 7, 8, 10%. And it's because once people are out of that protective or that responsive hunch, they start to process the information, more information comes into them, and it does persuade them to change their minds. And so and the lesson there is we shouldn't give up. We should actually double down, but also recognize that those who opposed us in any given legislative session, can be there for us. We just have to keep coming back to them and getting them to absorb the facts.
Well, I urge you to stick around next tomorrow to listen to our morning keynoter, David Jernigan, who's going to pull out a whole new talk on this issue as a social justice issue and this issue as an oppression issue, specifically speaking to the BIPOC community, how marketing alcohol has oppressed generations of people. It'd be really fascinating. So let's shift and talk about big alcohol. And you've all now had some battles. How does it feel? I mean, this seems to be, from the outside looking at what you're doing, insurmountable.
I don't feel that
you
way.
guys are optimistic.
Some days.
Tiffany, do you think it's insurmountable?
If I did, I would be in the wrong line of work. I have to think that it's not. And I will say, so I didn't talk during my presentation about our state work, but we are working on a 125-page bill that rewrites a lot of our laws about alcohol because they haven't been updated for 40 years. And you can't follow the law if you read it all the way through because it contradicts itself. And so we're cleaning that up. And we've been working with big alcohol. We've been working with the largest association in the state, as well as the brewers and the distillers and a wine industry from the lower 48. And they sank the bill a couple times kind of off the bat. And then they came to the table more and started actually talking, and they made the bill go a little bit and more in their direction. But we kept in health and safety. And then there was a big dispute between bars and breweries, which was interesting to me. And actually, the year that we had the most momentum, I think, then it got killed because bars added something that breweries didn't like. And breweries, even though they're kind of a subsection of this larger association within the state, they said, hold on, people love breweries. And they had 1,000 calls over the weekend, and the bill got killed. It never was heard again, even though we had already gotten through 5 committees that year in the entire Senate. And that eroded the association's power a little bit because breweries said, wait a minute, like, we're in this fight too. And even though that was still alcohol and alcohol, it helped to erode big alcohol a little bit. And, you know, big alcohol in 2019, when we lost the alcohol tax in Anchorage, big alcohol was in charge of their anti-campaign. But the next year, they weren't. They were busy in Juneau doing state work. And they said, okay, we'll leave the Anchorage Association to handle it. And they, you know, rested on their laurels, and they used the same ads they had the year before. And they didn't really fundraise much because they thought it was going to be another easy win. And it wasn't. And so I guess I just say, like, no, I don't think it's insurmountable. I think it's hard, and I think it's going to take a really long time, as it always does. But I certainly don't think it's insurmountable. And I feel like, honestly, maybe the pandemic is one of the next steps for us on this side of the battle to have made all these connections nationwide and even internationally, and to be talking to each other the way that we are now. And hopefully that'll be kind of the first step in mobilizing a bigger nationwide effort. Gotta have faith.
Jason, I've got a wedding ring on that tells me it's not insurmountable. You know, 20 years ago, it was illegal to be gay in, I think, 40% of the states. And today, I've been married 3 years legally, and it's recognized in every state. So that's an incredible sea change. The alcohol industry has unbelievable money, right? And Anheuser-Busch funded all of the voices here in Oregon, but they never showed up once, right? It was always the breweries and the wineries. But it's going to take, number one, we need some significant funders at the national level to coordinate their funding and begin to seed efforts state by state. We need, to your question earlier about a national communication strategy that we all benefit from, because when I'm trying to talk to reporters here, but there's no national press reinforcing, or it's spotty at best, the danger that the cancers that alcohol is a carcinogen, things like that. It makes my dollar spent on communications that much more diluted than if we were doing it against the backdrop of national education. Now, the benefit we have here in Oregon is the Oregon Health Authority is soon going to launch Rethink the Drink, which is just a public health campaign to help people better understand alcohol, which is funded, I believe, with federal dollars. And then state organizations need to be deciding that this is a game we want to be in. I think a lot of recovery organizations or other coalitions have avoided it because the opposition did seem so significant, and we have to build each other up and create some initial victories so to sustain us and to recognize that we can advocate for the end of the addiction crisis. We can advocate for the end of homelessness, youth incarceration, high school graduation rates even, and not, if we don't recognize that the core central issue to all those things is alcohol, then we're never going to move the dial on these social justice and economic justice issues that I think so many people care about. And it's incumbent on those of us that are in the game right now to work hard to build that broader coalition for people to understand the link between what they're trying to accomplish and what the alcohol industry is doing to America.
And most days, I know it's not insurmountable. It just feels that way sometimes. But I always say in Michigan, I know we're going to raise the beer tax in Michigan. I know we're going to get to 0.05. What I don't know is exactly when, but we're kind of in it for the long haul. So we're going to keep chipping away and fighting a good fight. And then also what Tiffany said too, earlier in my career, I just kind of saw the alcohol industry as one big industry, but like she pointed out, I've gotten more advanced, and you do see these fights within the alcohol industry, and sometimes the public health might line up on one or the other. So again, in general, like in Michigan, in general, the Michigan Beer Wine Wholesalers Association, they support alcohol regulations like we do. They certainly support the 3-tier system because it benefits them specifically, but that's a common issue that we have. It seems like the on-premise stores we have the most problem with in Michigan, the on-premise bars and restaurants, the party stores, and sometimes we have more in common with the party stores. There's always, the big Total Wine versus the small retailer, some of those issues. But again, we've gotten a little bit more advanced, and we understand that there's fights within the industry, and sometimes we can line up on one side or the other. So, but it's not insurmountable. You just got to keep working on it, and we'll get these things eventually.
So one of the great tools of advocacy is to have a champion. Someone who is loyal, who's a great spokesperson, who can write a check, something. Each of you, would you tell me the story of a great champion you found along in these recent campaigns who you take back into battle again?
I'll start. It's been a few years, but this is shoot back in 2010, 8, 9, 10, somewhere in that range, but we're working on, banning alcoholic energy drinks in Michigan, which we ultimately got, which we ultimately feel that it led to the FDA taking action at the national level to ban these premixed alcohol energy drinks. But some of the champions were within the Liquor Control Commission. There are some key staff people who I spent hours on the phone with talking to them about these issues. And so they're really helpful to helping navigate the system and to really understand it. And then also, like, again, what was mentioned before, call your friends. Jim Mosier, who probably a lot of you might know, who's retired now, but Jim Mosier was really fantastic as an advocate. He's a lawyer and advocate, would help us, guide us, and review things and really help us. But those are some people that come to mind. And then also a lawmaker that in 2016 did introduce a tax bill for us. He was a very strong conservative Republican, but he did introduce a tax bill because he understood the issue and he had a personal story around alcohol. But unfortunately, the chamber and all the industry came out and didn't really get any traction. But we'll forever be grateful to that lawmaker who at least introduced it. So
great.
What I would say is that I have 2 checks here on the corner of my desk from a mom whose son died last year, 53 years old, died in a hotel room of alcoholism. And she testified, and she organized people to pressure a legislator who should have known better. But she just brought that moral capital and clarity to the argument that I don't understand how her own legislator couldn't just immediately respond. And we had a number of moms that came forward, and they all have powerful stories to be told. But Jason, I'm conscious of the time, and the one thing I want to say, because I think it benefits all 3 of us, is we need a litigation strategy. We need a national litigation strategy to go after the alcohol industry the way we did with the tobacco industry. And we need a litigation strategy here in Oregon that goes after the local manufacturers and the distributors who are not paying their fair share. They're good businesses. I'm sure they're good people, but they're creating incredible harm that they should be held accountable for. And I have not seen any sort of legal strategy at all going after the alcohol industry. And that's what's really missing in this fight.
That's the champion you need. Yeah. Tiffany?
Sure, I have so many. And in fact, that story makes me always think of Jeff Jesse, who ran the Alaska Mental Health Trust Authority for many years up here and has been a great mentor to me. But he used to, when he would testify, he would talk about how, whether it was, keeping bars open later or alcohol tax or whatever it was, he would always make some really relevant, salient argument that's like, we're not even allowed to push our snow from our driveways into the streets without getting fined. But the alcohol industry pours their harms and consequences out of their doors every day at 2 a.m. and we give them tax breaks. So that story just made me think of Jeff Jesse, Mike. I would say also the Alaska Children's Trust and the Alaska Black Caucus both really stepped up, either in the alcohol tax fight or right after, as we were doing the fight to determine revenue. And they're both just Trevor Storrs and Celeste Hodge Groudon. I have a quote from Celeste that says, "The sky has nothing on us." And I keep it on my computer every day because that's the kind of faith and optimism and strength that I need to keep me rallied.
Plus Muhammad Ali.
Oh, always Muhammad Ali.
Last thoughts?
I'll go then.
Get involved.
Yeah, tell these people who are watching you what they can do.
Well, in Oregon, go to OregonRecovers.org. We have the Walk for Recovery in September. Go to Walk for Recovery, the number 4. Sign up for our emails, get involved, talk to your legislator in the off season and about alcohol, not advocating for one thing or another, but try and get them, to rethink what they know about alcohol or help them understand that they need to rethink what they know about alcohol.
Mike, Tiffany?
To just go along with that, to let them know that not everybody is 100% in favor of 100% alcoholic beverages at 100% of the activities every time. Like, just to remind them that there is a voice for people who don't have hundreds of thousands of dollars to pitch at them from InBev or Diageo, but that there are a lot of real humans who maybe don't want alcohol at their zoos or ice cream stores.
Add to what Mike and Tiffany both said, build a relationship with your policymakers. And like Tiffany said, get involved. That's how I always look at it. Trying to get more people into the game is kind of the way we refer to it. It's trying to get more people involved. So I like both of those things that they said.
Well, thank you to all 3 of you for your advocacy and your participation today in making these presentations. Really provocative, really interesting. Thank you.
Thank you,
Jason.
Thank you.
Take care, you guys.
Great job.
Thank you.
Good afternoon. On behalf of the Law and Mental Health Conference, I'm excited to introduce the next Law and Mental Health Oregon Advocacy Award recipient. So without further ado, I'm thrilled as a fellow Chicagoan to welcome a true Oregon advocate, and it is my honor to congratulate David Oakes on receiving the 2021 Law and Mental Health Oregon Advocacy Award during this year's Virtual Law and Mental Health Conference. Bob Nickel and Kevin Fitz will now introduce David Oakes, founder of the Achu Institute and co-founder and former director of Mind Freedom International, and his wife Deborah Nunez, and the story of David's powerful advocacy journey beyond Oregon. Congratulations, David, on being the winner of the 2021 Oregon Advocacy Award.
I'm Bob Nickel, and I'm totally honored to say a few words about David Oakes today and to help honor him. David has been a big part of my life and just about everybody's who's been in the mental health business and has paid any attention at all to civil rights and advocacy and the Mind Freedom International. I first got to know David really more directly when I was the state mental health commissioner for Oregon, and one of the first things that I did was to start what I call the Consumer Advisory Council. Today I think it would be better called a Peer Advisory Council. But I wanted one place where people who were advocates who'd been in the system themselves could talk with me without anyone else around. So I would get straight stories. And David certainly did that. I forget what the issue was, but one personal account that I want to tell you about is that we had a particularly rousing session, and like I said, I don't remember what the issue was, but I got a call from David in the evening, and David said, "Bob, do you still love me, and are we still friends?" I think that says a lot about who David is as a whole person. He's always kept it in mind that we're all in this together. The other thing I wanted to tell you about is the influence David has had on the entire world of psychiatry and mental health. It may not be very well known that in 1998, he had an interview with Bob Whitaker. And Bob had all the conventional ideas at that point about chemical imbalances and mental illnesses. And David challenged him to look at the research. Bob started doing that, and that led directly to the books that Bob has written on the history of mental health. In that article that Bob wrote about David explaining this, he talked about how David really challenged him and helped him move forward in his career. And through Bob, I think it's clear that David has influenced the entire world of psychiatry and helped so many of us come to a very different understanding about what the paradigm has been and where we need to be going. So again, I'm very honored to say these words about David and congratulate him on the honor that he's being given.
Hello there, my name is Kevin, and I want to congratulate David on winning this award today. 3 things I want to tell you about that really imprinted on me on what a powerful advocate David was. One of those is David was the founder of a magazine called Dendron. This was a publication for our community, for psych survivors and anti-psychiatrist activists. David started publishing this in 1988, and the name of that journal was called Dendron. I was very impressed by this journal and the topics that it covered. I routinely subscribed to this and learned a lot of important things through this process. The second thing I want to tell you about is 1998, David organized a protest against the federal government in 1998 against their Walk the Walk. It was a stigmatizing process that the federal government was putting on, and David and his fellow band of activists protested and let them know how they felt about their activity. David was so successful, the federal government decided not to have another one of these walks. So that was very impressive in my mind. In 2003, the last thing I want to mention, David organized a fast for mental health rights. Him and several other of his colleagues organized a fast to raise awareness in the public mind and in the media the importance of standing up for psychiatric survivor rights. I was very impressed with these three things: the protest, the journal, and the fast. David has done a myriad of other things like this through his career. I am so glad that he's been recognized for his work here today. Thank you very much, and congratulations, David.
Well, it's the end of day one of the 2021 Law and Mental Health Conference. Thanks for your attention today. I know we threw a lot of information at you very fast, and some of it I know you'll want to have a second or even a third look at. So don't worry. One of the great values of an all digital conference is that everything is recorded and everything is accessible. You don't have to miss any sessions because you're in session A and not in session C. But now you'll be able to watch everything again as you like at your desk as often as you need to. Both day one and day two of the conference are online for you, and you have the links now in your logistics page on the conference website. You have the access password to that in your email, in your access email that you received last week from Liv. That live link that you've just used will work for today, and you have a different link for tomorrow. Same thing will happen for day two tomorrow when we'll have a recording link, and those links will be available to you until August 19th. I'd like to thank our conference presenters today. They were Susan Cheever, our morning keynoter, Dr. Tim Naimi from and also with Andrew Dyke and Joel Ainsworth of Echo Northwest, and then Mike Tobias from Michigan, Tiffany Hall from up in Alaska, and Mike Marshall from here in Oregon with Oregon Recovers. I'd like to thank the sponsors and the presenters who made this conference possible. And thanks to our planning committee and our board of directors for their tolerance and benign appreciation. Some of the conference presenters have shared their presentations with us, and we'll put those in the logistic page as well for you to download and review as you like. So thanks for watching today. We'll see you here again tomorrow at 9 a.m. Pacific time.